there, welcome to the show. 2 channels here, now you know. Like and subscribe, it's all we need. Alternate, you're here to speak. And defense, let's take a peek. Collaborating for your eyes. Sharing content, no surprise. Together we shine brighter than one. Join our journey, it's just begun. Like and subscribe, hit that bell. Enjoy the show and wish us well.
Yo, hello. See, I told you I lost all my chat.
Hello.
Hello, Governor.
Hello, Governor.
How are we all? We have Miss Gabby with us today. Yay!
Woo-hoo.
That's why we're tad late. Sorry. We were doing some last minute training.
Hello, Tanya.
Hey, Tan, how you going? Yeah, all the chat's gone. See?
I see it.
Can you?
Yeah.
I've got nothing.
Hello, Hiref.
Hello, Dev. Welcome. Morning. Why can't I see any comments then?
Hello, me.
Yeah, I put that up before it cleared. Anywho, so we have, I think, the last day of the trial, because at the end of day 3 yesterday, the defense rests. Where's my banners?
Yep, I can still see it.
Has to be said. Sorry. So the defense rested. And apparently there are 3 or 4 rebuttal witnesses coming on. Yes, I can. Hello, mister. Yes, mummy's streaming and you want attention now, of course. 3 or 4 rebuttal witnesses coming on, and then we go into closings and verdict watch. So, yeah, I don't think it'll be particularly long. Yeah, I think it'll be a particularly long deliberation myself, but if anyone was around yesterday and watched right to the end, I was getting pretty damn angry with that call himself a psychiatrist. Holy crap.
Yeah, he was pretty
did you watch Baker's stream? He said exactly what I did.
I only watched a little bit of it.
He just threw as much shit as he could against the wall and hoped something would stick. Pretty much. That's all he did. It started off that she had depression and anxiety or adjustment disorder. And then it was bipolar, schizophrenia.
That's like a lot. That's like a lot.
Yeah. He was saying multiple personalities, because she was writing in different writing styles. Then it was eating disorders, hallucinations, hearing voices, everything. Like, really? And they were all, it was like this questionnaire that he gives, like a screening tool. And so it was obviously all answered by Carly. Of course, she's not stupid.
Yeah.
She's going to say, no, I'm fine. She wasn't delusional.
He basically just diagnosed her with an entire book of everything.
Yep. Pretty much. Yep. On what she said.
Yeah.
So you look at the arrest when she was arrested. Well, after you look at her behaviour throughout that whole incident, there was no panic. There was no delusion. She wasn't talking to the walls.
She was singing. She was singing.
There you go. Yep. And then the arrest video, she's understanding what they're saying. She's complying to what they're saying. She is aware of her surroundings. She knows what's going on.
Yeah.
I'm sorry.
Hello, Adair.
Good morning, Adair. Good morning. We've given Gabby the power.
I've got the
no,
power.
no hands.
Look, Ma, no hands.
Yes, we're trying to work out how to when it goes to verdict watch, because it's such a late night for me. You can put up your own comments and put them on the screen now.
Oh, yeah.
Can you put yourself into timeout though?
I do that every day, Jody.
So what was I saying? Yeah,
Oh,
verdict watch. We're going to try and
yeah.
divide it up. So Gabby actually can run both of our channels now.
Yeah, watch out, Adair.
So that way AJ can have a break and I can have a break, and hopefully we can cover the entire verdict watch, which should be good. So that's the plan.
My husband said he was going to draw me a little picture so I can use it for my icon.
Yeah, just create like an avatar.
Yeah,
That's what
but I can have custom ones made because I'm married to an artist.
Oh, well, there you go.
Hi, Alicia.
Yeah. All right. So can you see the top left-hand side of the StreamYard stream, Miss Gabby? It tells us how long we've been live for and how many people are watching. Can you see that? Top left-hand above my head, right?
Oh, yeah. Yeah.
Right
Yep.
there. Yep. Cool. All right. Howdy, Edev. He's back. He's back again. Guess who's back? Guess who's back? Guess who's back? All right. So we're going straight into day 4.
That's all, folks.
Yep. Giddy up. All right. Add to stage, Jody. We have it boosted. We have it CC'd. And we have a bad pause moment. Go. Oh, and I've muted it.
Good job, Jody.
Yep. See? And L. So
L.
when you're in this screen, when you're sharing the screen later, you have to be in the screen.
Yeah.
Oops. I was pressing the semicolon. And yeah, every L puts it forward 10 seconds. And J puts it back 10 seconds. All right, so states rebuttal. So what's the blue nunnery outfit she's got on?
All right, good morning, ladies and gentlemen of the jury. Did everyone follow the court's instructions overnight? Did anyone allow themselves to be
Good morning, Tricia. How you going?
Or any news account of this case? Everyone shaking their head in the negative. We will proceed. All right, the defendant having arrested, the state may call any witnesses it wishes to call in rebuttal. State calls Olivia Weaver.
Olivia Weaver. No idea who she is.
Can you see chat, Jody, now?
I can see chat, yeah.
Oh, okay.
It was just all the previous stuff I lost. I can
Oh.
see everything now. Yeah. The chiffon sleeve. It's not rouged. Oh, now that's electric blue. She's not brunette. Sorry, you to have. Good morning, little owl. Welcome.
Adjust yourself up to the microphone. You don't have to speak directly into it. Okay. But I do need you to speak so that lady in the very back row.
Okay, got it.
Understand that you're now under oath. This is your sworn answer, subject to felony perjury. All right, you may proceed.
If you would, Olivia,
Yes,
introduce
please.
yourself to these men and women.
I'm Olivia Lieber,
And Olivia, where do you work?
Precise Mind.
And tell us a little bit about what Precise Mind is.
It's an outpatient mental health clinic, and we do research and mental health care for all ages.
Mhm.
Just to be clear, you're a little nervous today, right?
Yes, yeah, I am.
Is this your first time to ever testify?
Al Gabone.
All right. How do you, and what is your role at Precise?
I'm a psychiatric mental health nurse practitioner.
And can you kind of tell us a little bit about what that is and what you do?
Yeah. I got a degree with a master's degree in advanced nursing practice. So I chose to specialize in psychiatry.
You all hear that okay? All good? You can hear that, Gabby?
Yeah, I can hear that.
Loud and clear? Get your hand back!
Mental health. The nurse practitioner program requires 1,200 hours
Oh!
of clinical practice, and we have
Really? Really? Self-deleted or
Wow. Wow.
this is Kentucky, yeah?
Yeah. Oh no, wasn't it Tennessee?
Hmm,
I think it was Tennessee, no?
I don't know.
I could be wrong, but I'm pretty sure it was Tennessee.
No,
I feel like there's one like every day
Oh,
over here though.
yeah, yeah. I must say, I did watch the manhunt that we had. What was his name?
In Australia?
No. It was huge over. I can't remember. Anyway, well, I'm glad that's over, Tracy, and you're safe. So, but keep us updated. Let us know if how he was deleted. Whether it was, maybe we could follow that up in the
Yeah.
break. And
Well, because you did a video about it.
yeah, I did a couple of quick videos, and then I've just sort of added updates to it. But
Yeah.
we can go through that in Verdict Watch if you like. We can follow that case up.
Or during a break or whatever.
Yep. All right, let's do it.
to do different specialty groups, have experience with different specialty groups like
That sounds
geriatrics,
great.
adolescents, outpatient, and
You'd
inpatient
have.
psychiatry. So it's just a specialized nurse practitioner role, provider role.
When did you do that?
That was 2.5 years ago, and I graduated in December 2021.
And have you been at Precise the whole time since then?
Yes.
Uh-huh.
And what is
Absolutely,
it
there.
that you do? I know you told us that you're a nurse practitioner there, but what is it that you actually do, like with patients at
Okay.
Precise?
We evaluate them and assess them, and we diagnose and then do medication management.
When you're
Why did she open her mouth like that? That was so awkward.
Sounds like she's got sinus
Oh
issues.
yes, very.
And why is that?
Because we base our diagnosis on that.
She's not breathing through her nose. I think she's got like.
Did you have the opportunity to have a patient by the name of Carly Gregg?
Yes,
Do you see her in the courtroom?
I do.
Is she
I
at the
do.
table?
Yes.
Olivia, I want to talk to you. Do y'all keep medical records of your treatment that you provide to patients?
Yes.
And did you do that with Miss Gregg as well? Remember it's Wintertime? You can take that off if you need to.
Thank you.
I've given you what's been marked previously as State's Exhibit number 19.
Defense attorney needs a spray
So
tan.
take a minute and look at that and see if you recognize those documents.
Yes, these are my notes from her visits.
And again, why is it important that we have
One
medical
finger.
records?
What are they saying now about my
Remember
sweet
everything that we've
voice?
done, and just to basically keep a treatment plan of what we've
Momo
seen,
Short.
what we think is going on, and what we need
Morning,
to
Momo
address,
Short.
and then the plan that we come up with the patient and or parents.
Do you recall the first time that you?
All right, I'll be right
met
back.
Gregg? When was that?
That was January 15th,
Okay.
2024.
And prior to actually having an appointment with you,
To keep your icon there, Gabby, just put mute and stop cam at the bottom. That's it. That's all you got to do. And it will just stay in place. And then you can come back whenever you like.
and you being in the room with her, did she also fill out any paperwork or have any testing done?
They are required to fill out intake paperwork that have a few screenings and just demographic information.
Did you have Miss Gregg do any additional screenings?
Ah, cool.
No.
And who has them fill out if you'll
I
turn
was
to
looking at
ACCUS
mine.
number, it's 757, Olivia, in that.
Okay.
I'm looking at something called the cardiac screening questionnaire.
Okay. Got it.
Kind of talk us through what that is and who has the patient fill out that form.
Goals.
These are all sent to every patient. It's just like a whole intake packet, basically.
Hey, Sharon.
If they're a minor,
Good
usually
morning.
parent. And this cardiac screening is mostly for patients that we're going to have on a stimulant or something that could affect their
Oh, I
cardiac.
need one of them right now.
And in your treatment with Miss Gregg, you didn't really need much from the cardiac questionnaire. I want to take you to, looks like there is 2 pages after that. There is an adult ADHD self-report scale checklist.
Mm-hmm.
Is that similar in nature?
I did
in
that.
The patient
Oops.
fills before they ever meet with you.
Uh-huh.
Is that something that
Yes.
a couple of things on that page?
Okay.
Olivia,
Stop
it
it,
says,
Paul.
how often do you feel overly active and compelled to do things like you're driven by? And the response was very often.
Right.
Did you review that when you were making rendering treatment to Carly?
Yes.
What about number 9 when she said she had difficulty concentrating on what people say sometimes? And she said often.
Yep.
Okay. And then if you'll turn back to the next page, how often do you have difficulty relaxing when you have time by yourself? And what did she say?
Rarely.
And what does that mean to you?
That this is just normal adolescent behavior. We have up to that age, and typically you can have a range and or sleep disturbances throughout that age, throughout life. So
Court
that just
TV, you
means
give
that
me the
she
shits.
has no trouble unwinding and relaxing, just what it says.
And then when you take the page before that, when she talks about being overly active and sometimes having concentration problems, did you take that to be the same thing?
Oh.
Once I asked her more about possible ADHD, that was ruled out. So yes.
Okay. And so this is not your entire treatment of Miss Gregg,
Oh,
right?
absolutely not.
Yes. Well, I took this exact questionnaire and pretty much answered 99% of them, but I didn't delete my mother. Yes. I think I actually haven't seen the difference. You can do them online. They're pretty standard.
I'm going to ask you to keep looking. There's something called,
Yeah.
Olivia, the modified mini screen.
Got it.
On the following pages, it's 761, 762, and 763. What is, if you can tell us, those of us that are not in the medical field, what the modified mini screen is?
Teresia was saying that she's talking about the manhunt in, is it Kentucky, Teresia? I can't remember. Thought it was. Yeah, he was found deceased, I think today. But I'm waiting for Teresia to give us some more updates.
This is one of the intake screenings that we do. Really don't look at possible symptoms to those so that we're made aware of them. I usually before the patient comes to kind of have an idea of what
I'm going
I
to
need
look
to focus on.
Oh, this is
The patient responds yes or no. You would then ask some kind of follow-up question.
Definitely. Mm-hmm.
And did you do that specifically with Carly Gregg?
Yes.
I want to point you to the very last page of that, question number 21. If you could read that for the ladies and gentlemen, what the question is, Ms. Gregg's response was to that.
Have you ever heard things other people couldn't hear, such as voices? And she said no.
And what date was that
Uh,
was put in your system?
It's not what she told the other
January
girl.
15th, 24.
2024.
Mm-hmm.
So, Olivia, you told us a little bit about the, and I think that most of us have been to the doctor's office, fill out these forms, different places, different forms. You said you look over those forms,
Mhm.
and then tell us about what you do kind of when you meet a patient for the very first time.
Okay. Usually, kind of what year, what their chief complaint is, so to say, and then I do a whole mental evaluation, and that includes sleeping and eating habits. For her age group, I would ask about social stressors, friend groups, if she has a good support system, a number of things, just to kind of narrow down what's going on.
And I want to talk specifically about Carly Gregg.
Mhm.
When she came in, what was the reason for her visit with you?
Depression and anxiety, and she had some social stressors.
And what did she describe those social stressors to be?
We talked about her childhood and not
I'm
a great
looking for
relationship with
another
her
shade
dad.
that's better.
And,
This is terrible.
altercation with her mom recently. I'm going to refer to my notes.
Yeah, if you would take a look at that and then tell us once you've had a chance to review that. And that's the note
Okay.
from January the 15th of 2024.
Yes. She said that she had started feeling depressed since 6th grade, and then the social stressors were her parents and their custody battle.
Did she also mention that she had a little sister that had died some years back?
Yes.
I want to ask you, it says that about midway down, it says she's in the 10th grade at Northwest Rankin, and she loves school and is the valedictorian.
Yes.
How did you get that information?
I was mostly asking about school. This can lead to increased thoughts of self-harm. Many psychiatric medications have been shown to possibly worsen the symptoms or cause increased thoughts of self-harm. Please stop the medication and notify the clinic if this occurs, and seek help in the emergency department if you do not feel safe.
So it's commonly known in the medical community that sometimes if you put somebody on an SSRI, it can worsen the symptoms they're already experiencing.
The black box warning is for self-harm and suicidal thoughts. So that is a possibility.
What is a black box warning?
Something for the whole class that's considered serious.
Okay, so it's like a warning.
Mhm.
Okay.
That's better.
And if you will, I just have one more question for you. If you can turn to page 753.
CC's on. Come on.
And this was your March
Oh, they're not
12th,
available.
2024 visit.
Sorry.
And can you read the second sentence on that page? And this was after the telehealth visit with Carly and her mom. It starts with, she said she doesn't like the Zoloft.
Right. That it makes her feel like a zombie. So we will wean off of it and switch to Lexapro.
And then will you read what patient's mom?
The patient's mom declined Prozac as she herself took it years ago and it gave her suicidal thoughts.
And is that what Miss Miley reported to you that day?
Yes.
Thank you. Okay. I beg the court's indulgence, Your Honor.
Look out.
Is it fair to say sometimes patients don't tell you everything you need to know?
Right.
Yeah. Does that happen more so, like not just with children, but with all patients?
Well, if they're not telling me, I don't know.
But it's fair to say that that happens.
Yeah.
No, tender the witness.
Your direct examination.
Really? Wow.
Olivia, I think on when Miss Todd was questioning, you said something about that you gave Carly the option to meet with you alone. Can you tell us about that?
Sure. Usually I ask right when I go get the patient out of the waiting room, do you want mom to come or do you want to meet first alone?
Mm.
And I don't recall whether she wanted to be alone. If she wanted to be alone, I would have seen her alone, of course.
And that didn't happen. in
Lovely
this
to
case.
see you.
Ms. Todd asked
morning,
you
Miss
about if
Emma.
a person was having memory problems, they might not report it. They might not know to report it.
Welcome.
Right.
Lovely to
Did
have you.
Ashley ever report to you that Carly was having memory problems?
No.
Did Ashley ever report to you that Carly was having disassociation?
No.
Did she ever report to you that Carly had said that she feels derealized?
Objection. It's already been asked and answered, so it's properly read.
Did Ashley report to you that she had ever had homicidal thoughts while she was on Prozac?
No.
And I
She
want
wasn't on Prozac.
Ashley.
Oh no.
The medication and Miss Todd thankfully had you read that whole thing. It talks about self-harm.
Uh-huh.
It never says that it can cause homicidal thoughts, right?
No.
And in fact, none were ever reported to you in this case.
Correct.
Ms. Todd asked you about the medical history on page 745 regarding Carly's dad. And I think it was your testimony that Ashley had filled that information in.
Right.
You did not diagnose Carly's father
No.
with having bipolar.
No.
They do mention, though, that he has a drug, alcohol, and prescription abuse problem, right?
Correct.
In your experience,
No,
in
you don't
training,
need to miss
Olivia,
anything.
can people
You
that are
miss
on
anything.
drugs sometimes?
This is the first rebuttal witness on for the state. And I think there's 3, possibly 4. And then we go to closings. So
appear to have bipolar symptoms.
Sure.
And sometimes doctors, even though they're really good at their job, they might miss something and misdiagnose someone with bipolar.
Correct.
And you have no way of knowing if Mr. Gregg's diagnosis was actually bipolar, do you?
No.
And it very well could have been that it was his drug problem.
Sure.
And so drug problems are also hereditary, aren't they?
Yeah.
Drug addiction.
not necessarily.
I want to take you to page
Addictive personality,
753.
perhaps.
Ms. Todd asked you some questions about that note, and that was your treatment record from, February the 14th. I think. Hold on, I'm sorry. No, I'm sorry. That's March the 12th of 2024.
Okay.
That very last line, what did you report regarding Carly's sleep habits?
She reported good sleep.
So March the 12th, 2024, she's
Fancy
telling
that.
you that she's sleeping well at night.
Right.
And again, just to be clear, you can only treat with what you're provided with, the information you're provided with.
Correct.
And you were never told that Carly had any memory lapses, any audio,
she had amnesia too.
auditory voices.
Right.
No further questions, Your Honor.
Mhm.
Be finally excused by the state.
Yes, sir.
By the defense. You're free to go. Please leave the exhibit. State may call its next witness.
The state calls Rebecca Kerr.
Oh. Can you find the video, Treasure? Well, do you know the YouTube channel? And we can go and have a look when it's verdict watch. It's a nice mint green. Oh, teamed with the wrong colour aqua.
Swear or affirm to tell the
Should've
truth,
gone with
the whole
white,
truth, and
classic.
nothing but the truth, so help you God.
Have a seat. Adjust yourself up to the microphone. It's not necessary that you speak directly into the mic. I need just speak loud enough that lady up there in the corner can hear you, okay? You understand that you're now under oath and your answers are sworn
Beautifully
answers
cut
subject to penalty
jacket.
of perjury. All right, you may proceed.
Matched
If
with
you
a
would
terrible
introduce
colored
yourself.
top.
My name's Rebecca Kirk. I'm a licensed professional counselor.
And Rebecca, where do you work as a licensed professional counselor?
I'm an owner of a small practice called Magnolia Counseling in Madison, Mississippi.
Magnolia
If you
counseling.
could tell us just a little bit about your educational history.
I received my undergraduate degree in English education from Mississippi College, and I taught some prior and most of it simultaneously while I've been a licensed professional counselor. And then I received I taught accelerated English mostly, so gifted students chiefly, in the 9th grade at Madison, Rosa Scott for 14 years, and 2 years in Virginia. And then I also received my master's degree in marriage and family therapy and individual counseling from RTS Jackson, which stands for Reformed Theological Seminary. And that consists of a very robust master's degree program where we do 400 face-to-face contact hours in clinic, and then 600 indirect supervision hours, and then postgraduate degree. We work and do 3,000 more hours with the public under a licensed supervisor before sitting to take the mental health equivalent evaluation that the state requires for licensure. I also have to do 24 hours of continuing education classes every 2 years to maintain that certification and licensure.
And so is it safe to say that you are in fact licensed?
I am.
And you were back in March of this year too?
Yes, ma'am.
Rebecca, it sounded like you have a lot of experience working with teenagers too.
I do.
Did you have the opportunity to have a patient or a client by the name of
That's
Carly
right.
Gregg?
Yes.
Do you see Miss Gregg in the courtroom?
Yes.
Same Miss Gregg that you provided services to?
I do.
Do you keep medical records with regards to the sessions that you have with your patients?
I do.
May I approach the witness? Rebecca, I've handed you what's previously been marked as State's Exhibit S21. Actually, I think that might be
sorry.
Defense Exhibit
Chiffon.
G21. Excuse me. If you'll take a look at those for us. Do you recognize that document?
I do.
What is that?
These are my entire treatment notes and summary of counseling Carly Madison Gregg.
And in some of those notes, Rebecca, when we got them, there was some writing, like some handwritten stuff in that.
That's right.
Who did that?
All right, sweet.
Okay,
Thank you.
so
I'll have a
that,
look.
The original intake form that she's referring to is completed by Ashley Smiley, or was completed by Ashley Smiley, and the last page concludes with questionnaires, checking off like just main mental problems that a person might be experiencing. It also asks to list the goals for therapy. And the first session that I have with someone, I go over the fact that since she's a minor, I need to speak with just that first session, one of the parental guardians, unless there is a need to contact them otherwise. I make that very clear to any minor and any adult that I see, that confidentiality, and I do kind of want to say this, is very important to mental health professionals to maintain confidentiality and to not really betray that trust. It's very important. And I am doing that somewhat today from some people's perspective, but I'm not according to the Mississippi state law, because of when you declare reasons of insanity, I do have permission to discuss. She has given me permission to discuss her medical history. So confidentiality is important to me. And I make that extremely clear. I just did then. Sorry for that. that, I mean, I worked with teenagers for many years, and so any mental health professional does say and has a duty to say that it is confidential under with the exclusion of just a few circumstances, which would be if someone reports that they're going to harm themselves, if they know of a threat of harm to themselves or another, or if there's any physical abuse. And so I did meet with Ashley Smiley to answer your question for a portion of the first session. And so it's kind of confusing, that last page. I want to explain it. She completed it. She said that there were 3 goals. There are also questionnaires, that are customary. Is it helpful for me to describe what's on this last page or no?
Sure. You'll just tell us, let me take a step back.
Sure.
If you would, what was the date that this paperwork was filled out?
This was her very first session with me, which I think was January 22nd. Does that sound right? 2024.
Your records reflect the first time you know it was January.
Yes, that's right. I see it here. Mm-hmm.
So and I apologize, I interrupted you a little bit. Yes, if you'll just tell us sort of what this handwritten note reflects and kind of talk us through that first visit with Ashley and Carly.
Okay. So the first note that I have was completed, or the first set of goals on that last page of the intake form says by Ashley, she wants to feel better about herself. And secondly, another goal would be self-care management, internal thoughts. So then I followed up, and she also wrote, Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts. So then I would continue to just question Ashley Smiley and, wrote down on the same sheet some of the answers she gave me. And then I met with Carly the same session and added to some of that information on the same page that Carly, based on talking to Carly.
I want to talk to you kind of down at the bottom of that page, Rebecca. There's some things, it's kind of almost like a checklist. This actually says checklist of current functioning. And then somebody has marked easily angered. Do you know, is that something that you would have done or that either Ashley or Carly did? Either
Ashley or Carly. And I would assume it would have been Ashley. But then I confirmed and went over it verbally with Carly as well.
So they both reported that she was easily angered.
Yes.
It does say that she has intrusive or disturbing thoughts. Did y'all talk about what that meant?
Yes. Just basically,
Really?
I asked her, one of the biggest things that you do is you ask why now, because a lot of times people do war with common stressors and then more severe ones. And I wanted to know exactly why they were coming. And Ashley had said that Carly had been cutting herself, or she had found an old iPod. And in that old iPod, she found out that Carly had been cutting herself for some time. And she also described some dark thoughts. And so I tried to kind of get to the bottom of what that was, thinking that they were, representative there by that check mark of has intrusive, disrupting thoughts.
And at some point they talk about, you have notes, and it looks like they mentioned that Carly has trouble going to sleep at night.
That's right. And that seemed to be a big deal to her, the sleep issue.
When you're treating a client, how important is it that you're getting accurate information from them?
Extremely. Again, that trust is so important. And so if you're not receiving the correct information, you can't see the whole picture. So you can't really treat the person in the appropriate ways, tailored for them.
We talked about that you had a meeting with Ashley and that you met with Carly. Who knows Carly better than herself?
Yeah.
No one, right?
Right.
So I want to ask you, Rebecca, on this first meeting, did Carly ever report to you any use of illegal drugs?
No.
Did she ever report to you that she was hearing voices of any sort?
No.
Did she ever report that she was having any sort of hallucinations?
No.
What about, did she ever report to you that she was having memory trouble?
No.
What about
Can't remember.
feeling derealized? Did she or Ashley ever bring up the word disassociation?
Mm-mm.
And to be clear, I want to talk about the first day, but was there ever a time in your treatment of Carly that she reported that she was having any sort of blackout? Like there were times where she didn't remember what she'd done?
No.
But I think that was the only thing she was
So
not honest
on
about.
the
really.
first visit, you kind of go through the current functioning and the checklist
Mhm.
with Ashley and Carly.
Mhm.
And then you actually provided some chart notes from that same meeting.
That's right.
If you could, I think you talked about this, that mom reported there was a burner phone.
Mhm.
If you'll look down on page 2 of your records, it says mom was upset, she lied, and when she asked about the relationship. Is that something that Ashley conveyed to you, that she was upset Carly was lying to her?
Yes.
And then when you go down a little bit, there's a little bit of handwriting, and I think it says her bio dad.
Correct.
Who wrote that in the records?
I did. It was a grammatical, just edit for clarification.
And to be clear, there's some other times in the
Right.
records that when you produce these, you went in and kind of wrote
Yeah.
things.
Because I want to be fully present, but I also want to take, records of what's going on for my need later to help her.
See, it says that she was 4 when her parents separated due to, and you put his and then her bio dad's pill, alcohol, and pot addiction. It goes on to say he was getting high in front of her. Do you remember who told you that?
Yes. Both of them did. Ashley actually kind of broke down teary-eyed in the session, which I inferred was what we all feel as parents, which we, feel, am I the best parent? She felt a little bit, I read and then told her, this is not your fault, because she had discovered that he had been doing that for quite some time before Carly told her. It may have been like a year and a half, and I didn't get the impression the visits were often, but I mean, that's irrelevant. When she went, said that he would be high constantly in front of her with drugs all around. And then when she did tell her mom, she stopped, and then they were in actually court, discussion with trying to terminate his rights, I guess, permanently. And that was actually going on while she was seeing me.
And so she's got these other things that Ashley's told you about, the sleep trouble and the things, but you also learned in meeting with them that there's a custody battle going on.
Correct.
What about your note also says she was also taking sleeping pills because last month she hadn't been able to sleep and woke up at 2. And then it talks about now she's taking melatonin. So I want to be clear, in your records, it appears that the melatonin is not the sleeping pills.
Correct. In fact, it was my perception at the time that was one of the things Ashley was upset about, is that she was taking sleeping pills.
Did they ever tell you where she'd gotten those?
No, I know nothing more than that. Sorry.
Is there anything else that you recall specifically about that first interaction with Carly that we have not discussed?
The whole impression of working with her overall seemed to me to center on what was making her cut, these dark, nights of the soul, so to speak, when she was, she reported having like existential thoughts about life and, the meaning and things like that. And so that's kind of what I flagged in my mind as a practitioner to try to develop more trust and a desire to go there to see what was troubling her.
And do you recall, you said you kind of build rapport, trust with these people. Do you remember how many times you actually saw Carly between the first visit and your last visit with her?
Yes, I saw her every week, every work week, once a week, for a total of 9 sessions, which would have been 9 hours, not counting that time with Ashley. So it would have been a little less, that first session.
The next time you saw Carly in your records is from February the 2nd of 2024. Is that right?
Yes.
I want to talk to you. It says persons in attendance, patient. So can you describe for us, what that means?
I am trying to see where you are. Can you tell me what page you're on again?
Yes, sorry. Page 4 of 24.
Okay.
And then about a little more than midway down on the bottom, it says persons in attendance. It
Yes,
says patient.
patient, right.
What does
She
that
was,
mean?
she was the only one there from session 2 to session 9. I spoke and interacted with only her, with the exception of Ashley always brought her to her appointments. I don't think I think that's an accurate statement. I think her stepdad did come with Ashley maybe like once or twice. I know like on Valentine's Day, for instance, they were together.
But he didn't ever come into the room.
No, nobody ever. It was just the waiting room. So I would see them in the waiting room, and that was all.
On that same page, Rebecca, you did, it looks like kind of an assessment of what you might do of a patient each time you meet with them.
That's right.
Could you tell us what you observed of her behavior that day?
Yes, it says appearance, normal, grooming and hygiene, attitude, calm and cooperative, behavior, no unusual moments or psychomotor changes, speech, normal rate, tone, volume without pressure, affect, normal range, congruent, thought process, goal-directed and logical, perception, no hallucinations or delusions, orientation ×3. So that's like, where you are.
Mhm.
Like, the time, you can
Oh, she
see where
knew.
you are, hear where you are, those kinds of things. Memory, concentration, short and long-term intact, insight, judgment, good, mood, stable, and angry and sad.
So she reported to you that she was angry.
Mhm.
And I want to take kind of a couple of those one by one, Rebecca.
Okay.
You talked about behavior, no unusual movements or psychomotor changes. Can you tell us what that means?
Yes. Sometimes people are just very clearly on edge and they can't get to a calm place, and that's evidenced by a lot of movement in their chair or their body that's maybe not related to their emotional feeling of something they're describing necessarily, and then just like rapidity of speech, like very rapid, maybe loud speaking, things like that, maybe looking around a lot.
And you didn't notice any of
I
that?
did not notice any of that ever.
And it says her thought process was goal-directed and logical. What does that mean?
She was able to carry on a conversation coherently without distraction, and that would have been okay if she was distracted. But she's very gifted and very, good with her words, and we discuss things in a normal manner.
No,
The
she's
perception, no hallucinations or delusions.
she's basically saying everything opposite to what the psychiatrist made up yesterday. So she's confirming that none of what Cully reported to him was accurate.
What does that mean?
She was not reporting seeing or seeing anything that wasn't there, or not being present with reality or anything of that sort.
And what about her memory and concentration? What did you notice from that day in February the 2nd?
Her short and long-term memory seemed fine to me.
I want to talk to you about what your actual note says from that day and that visit. It says she's frustrated that her friends don't take school as seriously as she and loses her patience. Tell us what you meant when you wrote that.
She was gifted, as I think is a clear fact. She really enjoyed school, and I taught her type of student for 14 years. And so she had like an excitement to talk about school. And she also, I thought that probably one of the things she was dealing with that was difficult for her was possibly that sometimes when you're so gifted and different from others in any way, it doesn't have to do with that. You might feel lonely and a little bit more isolated. So I kind of attributed it mentally. I made a mental note that was probably a relation there. But she was just the patience part. She was just described like being frustrated with peers who were not as quick as she, and that she knew she could be a little rude with them. We also kind of talked about it's difficult when your mom maybe is a teacher too, because you appreciate good teachers and know how hard they work. So
And Rebecca, your notes say that she's regretful when she snaps at them and hurts their feelings. So Carly was reporting to you that she's like snapped at some of the kids at school.
Yeah, and I did not get the impression it was in a violent way, but maybe like her temper, she knew that she was losing her patience with them.
And later on, about midway, it says she gets angry at others sleeping through such good teaching. That's
Yeah.
kind of what you were talking
Mhm.
about, that she
Yeah.
recognized she had good teachers.
Yeah.
I want to talk to you, Rebecca, about the next time that you saw Carly. I think you told us that you were seeing her pretty much weekly. The next record I have is from February the 9th of 2024.
That's right.
Want to talk to you again about what you observed from Carly and what you put in your notes regarding her behavior.
Okay. You just want to know
Page
that.
6, yeah, of 2024.
Okay, the appearance and stuff.
That's right.
Okay.
Yes.
I think, let me just look at it to make sure I'm not misspeaking. Everything that I read a while ago, and I can read it again if the jury would like that, was normal, except the only change I made was her appearance. I specified her appearance was goth-like, wearing her grandmother's batwing black goth pants and straight hair partly in her face.
But everything else was in normal limits. Her behavior, her speech, her affect, her thought process, the fact she was not having hallucinations or delusions.
Correct.
Her orientation to time, place, and what's the third one? I'm sorry. Times 3.
Time, place, and your hearing, like just all of your 5 senses,
Okay.
you're aware.
And then memory and concentration,
Not on your Nelly.
short and long term, were intact.
Yes, correct.
I completely agree.
And then you also have some treatment notes from that day.
That's right.
I want to point you down to, it's toward the bottom of the paragraph. Toward the bottom of the paragraph, it says she has started cutting. If you would, can you read that sentence for me?
Welcome.
Yes.
Yeah. Correct. Yep.
Looks like it's fourth up from the
Yeah,
bottom.
I'm sorry. I'm trying to, because I have an edit. I have a grammatical error added in there, and I'm trying to make sense of it. 1 second. Sorry for that.
No, that's right. I didn't want to read it myself in case I was reading it in the wrong place.
Her little charade is
Okay,
over.
she has cut, not currently, but in the past, when alone and in her head a lot. It was my understanding that what kind of prompted treatment with the psychiatric nurse practitioner, Olivia Lieber, was that she had found that iPod with this information about how she had been cutting and how she had some dark thoughts. And I was trying to follow up, like I was saying a while ago, with like what was going on with you, like in those times.
And I think your note actually says, Rebecca, after some existential crisis moments of her atheism resulting in a lack of consciousness.
Correct.
Can we break that down just a little bit?
Sure.
Those are some big words for me.
Yeah, that's fine. So I never really could get her to open up about that very much. I want to be clear that atheism, that was something that I was kind of trying to think might be a possibility. She didn't, as I recall, really use that word. But she did mention the word existentialism, and basically, in my opinion and training, I do think that's related to thoughts of what is the meaning of life, what's its purpose, why are we here? It was my and I could talk more on that maybe, but basically she would get in a depressed state and cut. And she described it as an existential crisis. But I couldn't really get her to describe a whole lot about that.
But you tried to ask her about that.
I did. Yeah.
I want to take you to the next time you saw Carly, Valentine's Day, February the 14th of 2024. And I apologize, Rebecca, I didn't ask this earlier. At the top of each of these notes, you mentioned like whatever medication she's on.
That's correct.
Time.
Yes.
Are you and the nurse practitioner, Olivia Lieber, are y'all in contact about that, or is that relayed by the patient?
The psychiatric nurse practitioners or psychiatrists who prescribe psychotropics, they oftentimes refer a patient, and then unless there's a need, like for an alarm situation, oftentimes
Yay.
we don't collaborate unless needed. So no, I would be reporting what Carly told me about her med changes.
Thank you for that. We talked about this, and I'm going to
Be a
ask you
good
about each
couple of
time
hours,
you saw
Grandma.
Charlie, what you noticed, who was in attendance on that day. Well, we might get streamlined this. You said the only time anyone else was in the room was that first visit.
Correct.
What did you observe about her behavior on February the 14th, 2024?
Okay, and I'm just making sure I am looking at the correct note.
Yeah, I'm
let
on
me change
page
it.
8 of 24
Okay,
of your
thank you.
records.
Everything that we have prior discussed was the same. The only difference was her appearance. This time was just black clothing, not necessarily her grandmother's batwing black pants with the black shirt.
I want to take you to the next page, Rebecca. About midway down, she says, your record says she rated hating herself, including her humor, and says she wouldn't be her friend if she wasn't her because she's dismissive of others' ideas when she knows it's wrong. Was that something that Carly related to you?
Yes.
Tell us about that.
She seemed to, again, be struggling with maybe some social stuff that I believed was stemming from her feelings of being different and having such a zest and fervor, and she really does love to learn. And so she would just talk about, it seemed like she was being introspective about, like, what kind of a person am I?
And it seems
I 100% agree. I think if anyone saw my comments last night, once I sort of logged off the stream and I went to bed, was watching it on the telly and listening to that psychiatrist, I was getting so mad at him. And yeah, I think my last comment was she was an entitled little brat, basically. I think my theory is that because she perhaps had the issues with her father and the loss of her sister at such a young age, I think perhaps maybe the mother either wrapped her in cotton wool or babied her or, overprotected her, perhaps was maybe a bit smothering. And they both just enabled her entitlement. And yeah, I don't see how you go from depression, anxiety, regardless if you've had a THC vape pen, to what I saw on that video was cold-hearted, bang, done, sorted, no remorse, no psychosis, no agitation, no disorientation, nothing. Just straight to the phone, texted the dad, premeditated. That's my opinion.
seems like a lot of her conversations, at least up to this point, revolved around her.
There you go. See?
Yes, that's correct.
Yeah.
Was she kind of obsessed with being
Yep.
great at school?
Yep.
Yeah, she liked school a lot.
I'm glad I'm not the only
And
one.
she was glad that I could
Yeah.
tell that she had been affirmed a lot in her life for being intelligent. And so she was proud of
exactly.
that. But
Everyone's saying how intelligent she is. She's playing the game now. She is playing it and trying to milk that psychiatrist and basically said yes to everything she possibly could. And then, she had the journal that she was supposed to write in January, then didn't do anything all of February, but miraculously on the 12th of March, the week before, she decides that she's now having hallucinations and, potential multiple personalities because she's writing in different handwriting and stuff. And please.
she also just had a genuine love for learning.
I want to take you to your next visit with Carly, February the 21st of 2024, and talk about her appearance. Does it look like that's the same appearance and behaviors, thought process, no hallucinations, no delusions, things like that we talked about?
Correct. And nothing has changed.
That's true, Adair. Look, I do think she has some mental health issues, but I don't think they're anywhere near what was implied yesterday. Absolutely not. Absolutely not.
Okay, I'm back.
Statement note, the very
Hello,
first
back.
line of that says she's reading The Castle and she likes it and will read Crime and Punishment. So you told us earlier that you were an accelerated English teacher. What is The Castle? Because I don't know.
I actually do not know that one
Sweet.
very well. I just know that they're well known. She also mentioned that she wanted to read The Bell Jar. But I had wanted to read Crime and Punishment for a long time, and I've actually owned a copy for 21 years. So I was really glad that she wanted to read the classic. I knew that was a classic.
Can you tell us, what is Crime and Punishment? Kind of what's that story about?
Crime and Punishment.
Objection, Your Honor. May we approach?
There's your girlie to have. And I haven't. Oh, I do have L space. Woohoo!
L.
L. Oh, I thought she was up on the stand then.
Asked you if you would tell me a little bit about what Crime and Punishment is about.
Crime and Punishment is about a protagonist, which is the main character. It was written by a Russian author back in maybe 1866, I believe. And it is the entire book, very difficult book, about a psychopath who lives in Russia, and he is poor. He is a student. He is very intelligent, and he comes on hard times, impoverished, and he has this obsession with this obsessive thinking of basically planning to murder a woman with a hatchet. And the novel kind of really, that murderous act happens pretty early on in the novel.
Oops,
And then the remaining novel continues to kind of be about his processing of it. And he even published something in the paper about why people
Can you
kill
pause
and
this for a
things like
second?
that. Anyway.
Yes.
Who is this woman on the stand right now?
It's a counselor that Carly had seen previously.
And then he eventually is sentenced because of his admittance of his crime. That kind of also was found out as well. But he was declared insane, and he served 8 years in a Russian labor camp. And when he was in the Russian labor
camp. Yeah, so remember when the stepfather testified, he said that she had noticed that, or he had noticed that she was a bit sad, and so the mother took her to a counsellor up in Madison. Said counsellor.
camp, he was unrepentant, and he did not think that what he had done was wrong and that the woman deserved it. He did actually kill her sister too with a hatchet to her skull, but
why are you telling this story, lady?
That was kind of by accident because she came home too early.
And Rebecca, in your notes, you'd actually underlined the fact that she was reading that book.
Well, that was just for grammar, because you're supposed to underline a title of a book if you can't italicize it.
Okay. Did you and Carly have any other discussions about reading any kind of literature, like kind of dark literature like that?
Not that I can recall, no. And to be clear, in this note, she had not yet read it. She was reading The Castle. This was what, on 2/21, and she was going to read Crime and Punishment, and she did so later. But I think she read it the week of spring break, and I saw her Monday after spring break. That was my last session with her, the Monday first back after spring break.
Okay, thank you for that. I want to take you to the next note, February the 26th of 2024. Again, without belaboring the point, same appearance, behavior, speech,
Yes.
affect.
The only difference is appearance is black t-shirt and jeans.
In your notes on that day, it said something about she may be on the spectrum. Can you tell us what that meant?
Carly came in that session and she was telling me that she had a lot of symptoms of kind of autism, and that's what that means. And so like Asperger's, and she was talking about just sensory issues and things like that. But yeah, that's what that means. Yeah.
And so Carly was telling you that she thought she had autistic symptoms.
Yeah. I mean, she never used the word, but I knew
Yep.
most teenagers are very familiar with what that is.
That's
And
the only one they
I
missed
just assumed
last
that she
night.
thought she had that. Yeah.
And based off your treatment, did you think that she actually had autism?
I didn't. She did report too that her mother didn't either.
I want to take you to the next time that you saw Carly, March the 5th of 2024.
Okay.
Again, you saw her in person.
Correct.
And
Yep.
the history given regarding attitude,
Yep.
behavior, speech, affect, thought process, perception, orientation, memory, and concentration, kind of all that's the exact same.
That's correct.
In your note on that day,
This is
you have
this is the counsellor that Carly did go and see for January when they said she was feeling sad.
This is just so crazy to me how like they're
Yeah, but they have to
It's
get
just-
her up to rebut the testimony from yesterday, or the BS that came out yesterday.
yeah, it's
That's-
just ridiculous. There's just so much
Yeah, and
here.
it's, can you tell it's the exact opposite?
Yeah.
Funnily enough, but yeah, make sure you're comfortable in that chair right about now, Carly, because they're going to be plastic from now on.
CBT and attachment therapies were discussed and explored to help alleviate anxiety. Can you tell us what that is?
Yeah, CBT is shorthand for cognitive behavioral therapy and attachment therapy. So those are there are many, many different forms of therapy that we're trained in, and cognitive behavioral is really good for depression and anxiety. It's about kind of trying to analyze your unpleasant thoughts and basically, for lack of better words, get a grip on them and have a better
Yep.
life experience. Attachment therapies are rooted in this well-known belief and research about the parent-child bond and
I'll allow that.
how we feel attached to people in our lives and how that influences us.
You also put in your records, boundary setting and identity work was explored. Could you tell us a little bit more about that?
Yes. So boundary setting would be just your classic, any kind of boundary you need to set to assert your comfort as a human being while also, not causing harm to another, obviously. But a lot of people have trouble saying no to people or sometimes saying yes to them, depending on the circumstance. So it's just kind of more of a work through of like, what do I want and how can I, in a healthy way, communicate that to others.
And at this point, Rebecca, is it safe to say, I mean, you're still in therapy, she's still in therapy with you, and you're trying to work on not cutting anymore and these thoughts of just anxiety and depression that
That's
was
correct.
reported. There weren't any other known psychiatric things disclosed to you.
No.
I'm going to take you to the next time that you saw Carly, March the 13th of 2024. And again, talk about the in-person visit and the observations that you made regarding her appearance, behavior, speech, and et cetera that we've been through. That's not changed either.
Correct. It's the same.
She does report to you that Olivia Liebers changed her medicine because she reported feeling numb.
Yes.
She didn't laugh as much, nor did she feel as upset when her mom yelled at her. That she finished her reading. Is that what you were talking about? That she told you that she finished reading the books?
That's right. Specifically that one, yeah.
And she sort of relates like her anger to her mom's stress, I think. And I want to ask you about that. She says, when her mom is less stressed, she feels it in less anger. Can you talk to us about what that meant?
Okay, I'm trying to find where that is. Okay. Yes, that's kind of a poorly worded sentence. Sorry about that. I was kind of trying to do it while attending to her, but basically, she appeared to me to feel some codependent feelings, or maybe be a little bit codependent on her mother's emotions. And when Ashley felt something, Carly, seemed to be affected by it.
And I think I misspoke, Rebecca. I said when she finished her readings, and then at the very end of that, it says she's about to read.
Oh, yeah.
So that was the following week that you were talking about.
Yes, this is the week of spring break, and she was going to read it during spring break, is what that said.
And then she talked about her mom asked her to promise that she wasn't trying to be a boy. Can you tell us? And then you wrote, I think it was you wrote, due to her new haircut. Can you talk about that?
Yes, I think we only talked about her haircut maybe twice, and she had literally just gotten her haircut before that session. So that day, this would have been a week before my last session with her, I think. She had her med change, she'd gotten her haircut, and I think on a session before that, she had just expressed, I always kind of want to make sure someone's not feeling like identity problems regarding their sexuality or something that needs to be discussed. And she did talk about how her mom, I think, wasn't a fan of it or was a little bit afraid or something. I'm not sure. I really cannot recall, but I feel like the reason why I said this is because we had probably talked about it earlier, as I recall. And so I was trying to follow up. How did you think about your haircut? So she was okay with it. And she was like, yeah, she just said, that promise me you're not trying to be a boy.
And did you, in your 9 sessions with Carly, did you ever think that she was having some sort of identity crisis?
No. And in fact, I followed up that time and the very next time, which was the last time I saw her, because the next time I saw her would have been the first time her peers at school had seen her new haircut. And I wanted to be sensitive to the fact that, are you being bullied at all? Like, because there were some other negative things that had been said to her and other peers. And she always answered with a positive affect, like, no, it's fine. And I asked her too, like, was that the truth to your mom? You can tell me it's fine. I'm not going to discuss your stuff. And she's like, no, I told her the truth or something like that.
So I want to take you to the next report that I have is a treatment date on March the 18th of 2024. Is that the last time that you saw Carly?
That's correct.
And I do want to talk specifically about each of these on March the 18th. So
Okay.
you saw her in person by herself, right?
Correct.
And you reported that she was wearing a black t-shirt and jeans again.
Yes.
What was her behavior like?
Completely normal, the same as it always had been. She had just gone back to school. It was Monday, the first Monday back after spring break. And this was it a 5 o'clock session? I'm not sure.
Yes, it's 5:50 p.m. to 5:55 p.m.
Okay. And so 5:50 to 5:55, 5 o'clock.
5 o'clock. Yeah. Sorry. Yes.
So I met with her for an hour, and basically everything was the same that it had been as far as the way she appeared to me.
And at no time did she report any hallucinations or delusions? At no time did she report any memory or concentration issues?
No.
I want to take you to page 19 of 24. This is regarding your psychotherapy notes, that last visit you had with her. And she talked about kind of walking on eggshells consistently while mom's around. And I think you touched on this a little bit. Carly was maybe a little bit codependent on Ashley's feelings and behaviors. Can you tell us kind of what you meant, what that meant about walking on eggshells?
Yeah, but I think I want to say something a little bit before that, if that's all right.
Yes, please.
I honestly kind of had to lead this session with her and try to dig into some of the stuff that she might be feeling, because I was starting to really kind of wonder if I was really serving her the best I can. And, you know, if I can and someone else can, I want to refer someone. I knew that she was a school teacher. Blue Cross state insurance plans aren't real rewarding on that end. And so I really had kind of contemplated, am I really helping her? Because I felt that the sessions were really mostly about school, but I knew that there had been a big event with why she was coming. And so I really kind of honestly did a little bit of soul searching and decided before this session that I wanted to really try to go there to maybe some painful things that that she maybe was being hesitant to speak about. And so I did kind of bring that up. And I think that's important to note. Like, she didn't just start talking about her mom. I was trying to like really get to some hardcore stuff with her in this session. And she, you know, we talked about how her mom, you know, when her mom was angry, it was really hard for her to really handle that. And so I'm always trying to get a gauge, like, obviously, let's rule out abuse. I did not have any indication ever before, during, or after that her mother was abusive, but I can't make that assumption as a clinician. I need to really be sensitive to anything that might not be being reported. And so I wanted to get kind of a measure of like, what does Ashley look like when she's angry? And she described, and it's in this note, that, you know, she raises her voice sometimes, or slams doors, cabinets, speaks in shorter sentences. I think we actually discussed an example that's not noted here of, well, can you give me an example of her being angry or something at you? And she gave an example of maybe some grading some tests of some kids. She's a math teacher, and so they were doing poorly on it, which is not what any teacher wants when she's grading tests that she knows she taught well, which I'm sure Ashley did. And she noticed her mood, and she wanted to be helpful, and she kind of maybe had, and I don't think maybe this event had necessarily recently happened. I was asking her to give me one so we could work through conflict resolution and her emotions and stuff. And she said that she had done, you know, like had offered to help her, and then her mother kind of snapped at her in response. And so I try to do a lot of work with like, okay, well, let's just take that example then. What do we do when we're upset? You know, how can we communicate calmly, clearly? I emphasize the importance of cooling off. You know, your body needs to self-soothe. When it gets flooded and your heart rate gets to a certain degree, you can't think properly. And so we talked about things like that.
And your report actually says you talked about understanding anger and how to respond to it.
Correct.
That anger is a secondary emotion, and how to confront her mom when she's cooled off was explored. Is that what you kind of just described to us? I went through ways for Carly to approach anger.
That's right. Underneath anger is really sadness or fear or a blocked goal of some sort. Yeah.
I know that's the last time that you treated Carly, but there's actually another note that was added to your records.
I think you can on rebuttal. I think same as cross, you can ask more leading questions on cross. I think Udahef will be the one to ask on that one though.
May the 16th of 2024. Could you tell us about that?
Yes.
I did have a look at that.
Whenever termination of care has occurred, it's customary for clinicians to do a summary note. Either, you know, sometimes very, very rarely, it just, no communication ever happens, but oftentimes
what did I miss? Like, I went to get a cup of soup. She said yes to everything. Was she asking about what the other psych had said to this counsellor? Yes. But can you ask more leading questions in rebuttal as well, Udahef, or is it just in cross? I missed that bit while I went to get my a nice hot chicken and veggie soup. Because it's frickin' freezing here in Melbourne.
The joint, you know, agreement or the agreement of one versus the other. And this was a very different case. And so I had to write a summary report on it like I would any other.
I think she's made her
I want to
point
talk
though.
to you
She's
a little
just
bit
cutting
about
on
that,
now.
Rebecca.
Okay.
It talks about within 24 hours, something terrible had happened. And you
Google.
state in your last session with me, she appeared emotionally
On
stable
YouTube.
and she had no suicidal or homicidal feelings suspected by me nor spoken by her. So I want to ask you
Yes.
about that. You said that she didn't tell you about any feelings, but you
Okay.
didn't think
Thank
that
you
there
for
was anything like
clarifying.
that going on either.
No, that's correct.
And then you also noted that she did not indicate that her medication change from the prior week was negatively affecting her.
Correct.
What did you mean by
Mm.
that?
Well, anytime that a person's prescription meds change, you need them to be very concerned about side effects,
Mhm.
depressive thoughts, feelings of suicide, things of that sort. And so I wanted to follow up and make sure she wasn't experiencing any negative reactions regarding that.
You also said that, excuse me, nor did she appear different from
Oh,
any other
okay.
sessions, nor emotionally unstable or dysregulated.
She is reading from a report.
Can you talk about
though.
what that means?
Yes, just kind of basically what we said, that was on the first part of each of my sessions. Like she seemed very oriented to time and space and didn't seem to have erratic speech, loud speech, to be overly angry or overly happy. Just, a normal
Thanks, Uday.
situation observance of her.
And then you go on to say she did not appear melancholy nor zoned out emotionally. Can you talk about what you meant there?
Yeah, she had reported several times that, at least one time maybe, but I feel like I maybe wrote it more than once. I'm not sure. That with some of the Zoloft, she felt like a zombie. And so, she never really appeared that way to me ever. But she had reported it. So I put it in my notes when that had occurred. But I was saying here that I didn't notice any of it as well.
And you talked about how you had gone through conflict management with Carly on the day before the incident.
Correct.
I think you
She's just
also
getting her to clarify
talked
what in the
about kind of
report. I
what you
think.
observed between Carly and Ashley's relationship. Can you talk about why you thought that was important to put in your record?
Yes, sure. Well, ordinarily termination of care is in a very different manner. And I knew that this one was a very sad act that occurred. And I wanted to be clear that I did not ever observe them together other than in the waiting room. And I never really saw, anything that would allude me to believe that, or hint at any kind of very severe danger or threat.
At any point during your treatment and sessions with Carly, did you think that she was being physically abused by anyone?
No, never. In fact, I asked several times about the stepdad, and I'm very confident in her response, verbally and non-verbally, that it felt very much to me like that nobody that she was living with had been abusing her. Now, her biological father, yes.
And she described some incidents where he had been physical with Ashley as
Yes.
well.
Mm-hmm.
And then what about, I didn't see any note of this, but did she at any point ever report that she had been sexually abused by anyone?
No, she told me she had not.
Court's indulgence. No further questions, Your Honor.
Wow.
Good morning, Ms. Kirk.
Good
How are
morning.
you?
Doing well. How about you?
Just fine. My high school English teacher is about to be very proud. I too read Crime and Punishment, and you're right, it was written in 1886 by Dostoevsky. And isn't it true the main protagonist of that novel, Raskolnikov, killed his neighbor? The woman he killed was his neighbor, and he killed her because he hated her.
Yeah.
Yeah, I'm sorry, could you speak up?
Yes.
Yes. And isn't it true, actually, by the end of that novel, Raskolnikov felt so guilty about his action and was so remorseful that he didn't only confess, but he actually, in an act of remorse, bowed to the earth?
That's not the way I interpreted it, but that is the thing about literature. There's a lot of interpretations.
Yeah. Isn't it true, what the book is actually about? The act of murder happens in the first chapter. Isn't it true that the entire book is about how murder is such a horrible act and the weight and consequences that it carries on a person who does that?
Yes and no. I mean, you don't want to get me started. I'll go into my literature mode, but I really don't think the point of the book was about how murder is such a horrible act at all. I mean, I think it was about the psychological dilemma of someone mentally insane. And I mean, honestly, I think that's what that's about. It definitely is talked about, and there are different characters in there, including one that tries to kind of convert him to Christianity and stuff like that. But I mean, even when he's in the Russian labor camp at the end, he says that she kind of deserved to die. Like, I remember there being something like that. Don't quote me because it's been a minute.
But again, he hated his neighbor.
Yeah. She was a greedy, she loaned money to people and was very unkind to them, but he didn't know her hardly at all. He just went and borrowed money from her.
And he was poor and she was demanding it back.
What did you say? I'm sorry.
And the main character was poor and she was demanding it back.
I mean, it was like a debt type thing. She wasn't, I don't know about the word demanding, but yes, she was greedy. She was definitely greedy.
So he had a motive.
Yes. Mm-hmm.
Did Carly hate her mom?
I never got that impression.
What impression did you get from Carly?
I got the impression that she had complex feelings about her mom, because one time we were talking about her, I tried to talk about the custody case a lot. Mm-hmm. And I knew that, I mean, it was literally going on, and they were supposed to meet, and I would ask, how are you feeling about that? And I'm fine. And I got the impression, I'm just going to let the adults work it out. She seemed to have a lot of trust in Ashley to take care for her and to protect her, as well as her stepdad in that. And, but there was one time when we were talking about the bio dad and then her mom, and, she said emphatically, like, I know he doesn't love me. But I had to ask, like, do you believe that your mother loves you? And she really was a little unsure on that answer.
Yeah. But did Carly love her mom?
Yeah, I believe that she did. I had nothing to tell me otherwise. Okay.
And you said that Carly was a little codependent on her mom's feelings. Do you mean that Carly's emotions were real tied in to how her mom felt?
Mm-hmm. It was probably mutual. Yes. Yeah.
And the feeling that, the example about, her mom, the example about being angry Carly gave you was actually about an incident in which Carly's mom got angry with Carly when Carly had tried to help her mom.
Yes, that's correct. Mm-hmm.
Okay. And it really hurt Carly's feelings. Her mom snapping at her when Carly was trying to help. It hurt Carly.
That's right.
Didn't make her angry, right?
Well, I can't speak to that. In fact, I would assume it does make one angry from what I know about emotion. Again, anger is a secondary emotion. And it is the more safe thing that we feel when we maybe feel threatened or unsafe. And it would be understandable that her environment growing up, she had to deal with a lot of emotions, that she didn't get to maybe express healthily. So that can make one be a little, anyone. And that's a normal thing.
And is it fair to say that Carly felt like she had to walk on eggshells around her mom because she didn't want to make her mom angry or more stressed out?
Mm-hmm.
And Carly was always very careful. She didn't want to hurt her mom's feelings, right?
I don't know about her always being very careful, but I do know that, and I think that would be impossible for someone to always, but I do know that she seems sensitive to her mother's feelings. Yes.
And Carly didn't want to hurt her mom's feelings.
Right.
Is it fair to say that Carly really wanted to please her mom?
Yeah, I think so for sure.
Carly wanted her mom to feel proud of her.
Mm-hmm.
Is it fair to say that Carly didn't ever want to worry her mom?
I don't know about ever, but I do know that probably chiefly, like, no child wants to worry their parent. Yeah.
Is it fair to say that, Carly knew her mom was pretty stressed out and didn't want to add to that stress?
I really can't speak to like the level of stress she observed in her mother. But again, just making a basic assumption of any normal person, and she never led me to believe that she was different from any other average person. I would have concluded that, but I can't say that because I didn't observe every situation.
Yeah.
I only know what she reported to me when she came to me.
Okay. And is it fair to say that a person can sometimes, if their feelings get hurt and it makes them mad later, that a person can feel mad without expressing that emotion to others?
Yeah, absolutely. Yeah.
And did you in fact know that Carly never got a chance to read Crime and Punishment?
No.
I'm sorry.
No, it was my understanding that she did.
Well, it was your understanding that she was planning to?
No, I thought that she told me when she came back the Monday after spring break that she had read it, but
Objection, Your Honor, there's something in evidence to show otherwise.
And is it, and the question that that you had asked Carly about her haircut and her friends teasing her about cutting her hair shorter, and about whether that meant something about her sexuality. Isn't it true that in your notes you reported she actually laughed in answering that question and said
Right.
no?
that's right. Yeah.
Yeah. So she found that to be, somewhat a humorous.
Yeah. Right.
Yeah. Not a concern.
Well, what had happened, we were walking out actually with the padlock door, and I said, "Oh, what did your friends think about your haircut the first day back?" And she said, "Oh, they said it makes me look even more gay now." And I said, "Oh," I said, "Is that a true statement?" And she said, "No." And I said, "Oh, well, I'm sorry." And then she replied with, "Oh, it's not a big deal. Like,
She's
doesn't bother me." Yeah.
Yeah. And on the handwritten initial assessment that Ashley wrote to you, is it true that in that she wrote that Carly had been having intrusive, and she marked the box for intrusive and disruptive thoughts?
Correct.
Okay. Is it true she marked the box
No.
that Carly was having thoughts that got stuck?
Yes, that's correct.
Is it true that she reported several different times on this page that Carly had really been experiencing some difficulty sleeping?
Yes.
And in her own handwriting, doesn't Ashley write that Carly was severely unable in the last month to sleep?
Yeah, that's right.
Okay. And somewhat for the last year?
Mm-hmm.
Isn't it also true that she wrote in her own handwriting that at 2 a.m., Carly had a habit of waking up at 2 a.m. and then not being able to go back to sleep?
Correct.
Okay. And isn't it true that Carly also wrote that Ashley had written that Carly seemed to have a poor self-image?
Yes. Wait, where are you
Ugh.
referring to? I just want to
The
make
box.
sure. Yes, that's correct. Mhm.
And isn't it also true that Ashley had marked the box that Carly had been experiencing panic attacks? And when asked how often, Ashley wrote Carly had at least been having one panic attack per month.
Yes, with the correction of it didn't say at least, it
Or
said
just
one
one per
per month. Yeah.
And isn't it true that Ashley had marked the box saying that Carly had been having difficulty completing homework or classwork?
Where's that one at? I'm sorry.
That one is, may I approach, Your Honor?
I'm sorry. This is kind of a busy page.
That one is right.
Okay.
Gabby just pointed out to me, Puddletown, I'd been sending you messages in chat and answering your questions, and you're not able to see them because I didn't bring them up on the screen. So I'd been sending you messages. said to you, you should start a YouTube channel, and then you went, I'm developing my YouTube. So I put a couple up on stream, but yes, reach out if you need a hand.
Oh no, I don't. No, that wasn't checked.
For sure.
No.
I don't think it was checked.
She
Can
saw
you tell
her
if it was checked?
multiple times over
Um,
3 months.
I don't know.
You can't tell
Exactly.
You know
if
what? You know
That's
what? Let
the
me.
problem right there. That is absolutely the problem right there. Everyone else's fault, entitled. Yep. Yep. Let's avoid it. Bury the head. And that's the impression I got from the father as well. He was distant. He didn't know any details, didn't know the doctor she went and saw, why she was going to see, what diagnosis she had, just disinterested or not engaged. I don't think it was intentional, blah, meh. If I bury my head, it'll go away. If I ignore it long enough, I won't have to deal with it. No. No, your content sounds really, really good. My cousin is actually a musician. I should put his link in chat so you can have a look at his stuff. But yeah, my question in chat was for you and Udahef, where is it? Your favorite band for technical expertise. Yeah.
Look at your page because you're right. Mine is a little bit.
Yes, ma'am.
I'm sorry.
You need to refer to the original exhibit, please, as far as to making determination.
Okay.
If you would, please refer to the original, to the exhibit.
I mean, it does seem hard to read because I have written some notes to the left, but that would be surprising to me. But I'm not saying that it may not be checked underneath my handwritten note to the left. I'm really unsure.
it's just hard to read
Yeah,
because of the
That's right.
handwriting.
Yeah.
So it could be, might not be.
Yeah.
And isn't it true that what is easy to read is that Ashley had written just a few short places down that Carly had been sad and withdrawn in her mood?
Yes.
And at the top of that page, and I know it's kind of a little bit messy,
Yeah.
but at the top of that page, isn't it true that somebody reported that Carly had made a 30 on the SAT? Or
Correct.
ACT?
Mhm.
Okay, and that somebody had written in the response to the first question, what are your goals that you hope to achieve through counseling?
Mhm.
Someone had written, either Ashley or you, she wants to feel better about herself, socially, personally, physically insecure,
Yes.
and had been so since 5th or 6th grade.
That's correct. So she began by writing she wants to feel better about herself, and then I followed up with both of them and added more notes to give more detail to that. That's right.
Isn't it true also on that page, in kind of response to the question number 2, it says father had been emotionally and physically abusive,
Mhm.
and also had bipolar and
drug
ADHD.
addict.
Yeah,
Uh-huh.
and drug addict.
That's right.
And that there had been times years ago that she had reported he, meaning the father, had been getting high in front of her the whole time during his visitation periods.
That's correct.
And then briefly describe your or your child's current difficulty. Can you read for us what's written there?
Yes, it says, this is written by Ashley. Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts.
So, did Carly's mom, and on this page, there's a box for, hurts animals. That box isn't checked, is it?
There is a box for, no, it's not checked.
Okay. And it's also a box for hurts friends or siblings. That box isn't checked, is it?
Correct.
During the course of your counseling with Carly, did you ever consider her a psychopath?
Never.
Did you ever consider her a sociopath?
Never.
And again, you've met with her how many times?
9 hours, roughly 9 hours. Yes.
So 9 different sessions.
That's right. Mhm.
From January to March.
Mhm.
Okay. And were you aware that Carly had written in a journal about hearing auditory hallucinations?
Mm-mm. Unless it was the reference to that iPod. I'm not sure if they're considering that a journal or what.
But the reference.
I was never told about any kind of hallucinations, just dark thoughts is the way it was described to me in that iPod.
Okay. And did you know that in one of Carly's journal entries, when she was talking about feeling like she was losing control of the auditory hallucinations, that she'd actually written in there that she had considered bringing her journal to you?
No. No, not at all.
Do you think that speaks to the level of trust Carly had in you?
I can't really speak to that. You'd have to ask her.
Were you aware of the fact that Carly has repeatedly told people that you were the first counselor she ever felt like helped her? Were you aware?
No, it's not.
If Carly would have reported to you during one of your sessions that she was experiencing auditory hallucinations, would that have been something you felt like you needed to report to her mom?
Not necessarily. I would have followed up with a lot of questions to determine if she was a threat to herself or others.
And if Carly would have reported to you that she felt like she was losing control of herself to the auditory hallucinations, was that something you would have felt like you needed to report to her mom?
Again, not necessarily. I would have asked her to clarify with a lot of questions. What does control mean to you? You know, that means 1,000 things to different people. But if I had asked it enough to determine that she was a threat to herself or others, then yes, I would have reported it.
And is it fair to say that Carly had some fear in regards to her dad?
Her biological father?
Yes.
That was very perplexing for me, honestly. I just could not get her to open up a lot about what I knew had to have been traumatic instances. I mean, she seemed very indifferent and apathetic towards him.
Welcome back.
Yeah.
And is it fair to say that Carly saw her father as someone who is not a successful person?
Correct. Yeah, she did not like him. She was glad she was with her mother.
Yeah. And is it fair to say that if someone is afraid of having a certain mental health diagnosis, that might motivate them to not be fully forthcoming with their therapist about what they're experiencing?
Sure.
And if Carly would have told you that she was smoking marijuana to help her sleep at night, is that something you would have felt the need to tell her mom?
No.
Okay. Would Carly have had any way of knowing without disclosing that to you that you wouldn't have reported that to her mom?
Yes, she would, because I told her that on the first session.
But Carly had seen you talk with her mom before, correct?
Because she's smart enough to know that legally anyone under the age of 18 has to do it that way.
Yeah.
Yeah.
Okay. And did Carly or Ashley ever tell you about an incident in which Carly had gotten in trouble for taking a knife to school?
Never.
You don't recall that?
No.
Okay. And during the time in which you were with Carly, had either Carly or her mom reported to you that Carly had seemed to develop a hypersensitivity to certain sounds?
In that session note regarding the symptoms, she came telling me, you know, she just gave me a lot. It's probably in that one. She kind of came in talking about a lot of symptoms that typically is customary to like an Asperger's or autistic diagnosis.
And that these certain sounds, when she heard them, kind of caused her to feel irritated?
Yes, but again, like it was not ever anything, I want to be clear, like a hallucinatory manner. It was all in the context of that person's tapping that pen or tapping their foot or something
Yeah.
like that, you know?
Yeah, not furious, but just annoyed,
Yeah, right,
irritated.
Right.
And based on your sessions with Carly, when Carly would mention, having periods of time when she would be questioning the meaning of life, did that seem to be during the time periods in which Carly was experiencing depression?
I need you to repeat that, please. I'm unclear what you're asking.
Yeah. When you talked about that Carly would have these existential times and she'd be questioning, the meaning of life and things like that. Was that also during periods of time in which Carly was experiencing depression?
Well, that's what was kind of problematic about treating her, is that was really the only thing of real emotional conflict that I ever had her report, and it was because of the iPod stuff. And so I kept trying to kind of dig and find out what was troubling her. So, I mean, during that's what I'm talking about with the existential. She didn't really open up a whole lot. The last session we did talk about kind of reality and life and morality and some things like that. But, but it wasn't because she said she had been upset about it and needed to discuss it. It was based on something, I think, as I recall, her father is a Jehovah's Witness, her bio dad, and she knew I was a Christian, because that's something that I like to tell people so it doesn't blindside them if they're different. And she said, I'm sorry, I know you're a Christian. He's a Jehovah's Witness, and I believe that that's definitely a cult, So we kind of talked a little bit about it that way thematically, but not in a way that was, like I'm troubled and I need to talk about this kind of thing.
Yeah. And during your sessions with Carly, did she ever strike you as a violent child?
No.
And when you learned about the events that had transpired on March 19th, were you shocked?
It's the most shocking day of my life.
Yeah. And that's based on the 9 sessions you had with Carly and the hours you spent with her.
Yes, because I had no clue that nor had she ever reported that she was severely mentally troubled to any degree like that.
And you just, based on your knowledge of Carly and her relationship with her mom, you were shocked to find out what had occurred on March 19th.
Yes.
Thank you. We tender the witness.
State wish to be redirect.
Rebecca, as a therapist, how many people do you see that have complaints about depression or anxiety?
Almost every single one of them.
How many of them have gone on to kill their mom?
0. Sorry, her. Before that, none.
Do you have any patients that have ever reported hearing voices?
I have sometimes, yes.
And how many of them went on to kill their mom?
None.
You were asked about whether or not Ashley being mad at Carly made Carly angry and hurt her feelings. And I think you talked about anger being the second emotion.
Poor thing.
Did that make Carly angry? Sorry, you got to answer.
Yes, sorry.
You were asked about Carly wanting to please her mom and not worry her. Someone keeping secrets from their mom about a phone mom didn't know about, a secret boyfriend, the fact that someone's using drugs and cutting themselves. Does that sound like somebody who's so worried about hurting mom's feelings to you?
Can you please repeat that question?
Yeah, sorry, it was a bad one. You were asked about Carly not wanting to anger her mom.
Right.
And keeping secrets from your parent, doing things that are dangerous. Does that sound like somebody who's worried about hurting their parents' feelings?
I mean, honestly, I can't really speak to that. I mean, I would think that there could be a lot of motivations regarding that. But
Carly never reported having any mental health issues other than depression or anxiety to you, correct?
correct.
No further questions, Your Honor.
Are this witness be finally excused by the state?
Yes, sir.
By the defense?
Yes, Your Honor.
All right, ma'am, you're free to leave. If you would hand that
You get
back.
big girl panties on and get over it.
after I take care of the jury. Give me just a moment. All right, ladies and gentlemen, the jury is about 10:30 and lawyers want to talk. So that's a good time for y'all to use the restroom. Okay, everyone remain seated while the jury exits. Just knock on the door and let the bailiff know when we're ready, okay?
Bye, Paddletown. Have a great day. Don't work too hard. No worries. Yeah, if every teenage girl did what she did when their feelings got hurt by their mum.
All right,
Wow.
record reflect, we're outside the presence of the jury. You had something?
Yes, sir. I was just
Oops.
wondering how many more witnesses, the prosecutors intend to call.
Haven't exactly made that decision yet. I mean, we know 2 for sure.
Okay. At least 2, they say. All right, we'll be in recess for about 15 minutes.
15 minutes. All righty then. 15 minutes.
And we are back, or I am back. We've all been here watching this trial, watching the 2, we had a licensed counselor and the nurse practitioner on the stand. They are gone to recess now. They will be back, a judge said, in about 15 minutes. It is 10:37 now. So you do the math on that. We'll be back in just a few minutes. But we're going to sit here, going to recap what was said by 14th. She stated that she wanted to read a book called Crime and Punishment. Crime and Punishment is a novel that was written in the late 1800s, and it is talking about the mental anguish and moral dilemmas of a ex-student who plans to kill a unscrupulous pawnbroker who is an old woman who stores money.
I yesterday, whilst I was watching, I had a I had a really bad judge pause moment, so I had to save it. Ooh. We'll have to caption it. What's the best caption for that picture? Now, do we want to listen to her recap of witness testimony, or should we have a chat amongst ourselves? And
Hey Jody, the best caption for that picture is "Ooh, I'm telling."
I'm dubbing on you. Yeah, absolutely. So that was what, 2 witnesses. So hopefully only 1 to go before closings. So what is it? 10? They said 10:30 there. Yeah, so I reckon probably they'll do closings, go to lunch, and come back for jury instruction, or come back for closings and jury instructions. That's my guess. So yeah. So yes, there is a poll in the top of my chat. You can all have a vote if you like. It's about how long you think the jury will deliberate. What is it at the moment? Let's have a look. So at the moment, we've got 14% think 1 to 2 hours, 57% think 2 to 5 hours, 14% think 5 to 7, and 14% think 7 plus. So most people are going for the 2 to 5. I reckon you're probably bang on there. Bang on. I don't reckon it'll go more than 5 for sure. For sure. Not after that. Because it's not, as they said, it's not really a question of who done it. It's a question of why. No worries, sweetheart. We'll be here. So they'll come back. about 11, yeah, and I reckon the next 2 witnesses, and then yeah, hopefully we'll wrap it up today and get onto verdict watch. It'd be nice to get onto a verdict watch before a Friday, because they seem to rush it, I reckon, on a Friday. But yeah, after seeing that video, yeah, it's not a matter of who, it's a matter of why, and really they don't have to prove why. They just have to prove beyond reasonable doubt, don't they? So I do believe they have met their burden. So, all right. I'll just keep my eye on the court feed. Now, I've switched over to, we started off on Court TV, but the feed was terrible. So we jumped across to WLBT, and their feed was beautiful. So we've stayed on there. Actually, let me look up at the Kentucky, where is it? Okay. Manhunt for I-75 unalive bang banger ends after Kentucky couple find body in live stream. Apparently a YouTubing couple found the body. I'm just trying to find one that's actually... Okay, there we go. Hang on. Let me add it to the stage. So this is a pair of YouTubers that apparently found him unalived with his pew-pew beside him.
6 days. We went on a date night last Friday evening. We said, let's go see if we can find this guy. And so we've been from down in this area behind when they would have that cut off, when the crime scene was there, nobody could go up there. We would go back here in the back just in case he had wandered down through there, anywhere we could look. And Saturday we come out of here and seen a bunch of vultures up there. And what we've been looking for, if somebody's dead, it's going to be the vultures. Follow the vultures. And there's only about 5 or 6. They were lighting on that tower up there. And we figured just a small animal where there was just so few of them. We come back Sunday and Monday, and more and more. Today there was about 50. And we started to put our boots on, started over the hill, and got way down in the holler where the birds. I seen one of the vultures come up with something in his mouth.
The buzzers
we
got
knew
him.
We was getting close to whatever he had. We were getting close to it. And Sheila smelled.
What was the reward up to, Teresa?
Go ahead, Sheila.
Yeah.
Hold on one second. What did you smell?
When we came down to the trees and I was crossing over the trees, a horrible smell of something dead. You could smell it. And I told him, I said, there's something awful in here. It smells really bad. And
What time was this at?
what time? We've lost track of time.
All right, hang on. There is a couple more. Let's see. That's the 15 hours ago. When was that? We'll go to the police one, that one.
We want to transition quite abruptly because we didn't get to this live. This happened last hour. A major update out of London, Kentucky. A body has been found in the area where the mass I-75 shooting happened just over the past weekend. Now, you'll remember that this manhunt has been ongoing, looking for the suspect. According to Kentucky State Police, The body was found near exit 49. They're now working to confirm the identity of the body, though. We just have this press conference from law enforcement. They believe that this is the body of the suspect, Couch, his last name there, who started shooting on the I-75, I believe.
So, sounds like he unalived himself. Is that right? Self-deleted. Yeah. Yep. Just.
Now 2 Saturdays ago, injuring 5 people. Thankfully, no fatalities. Leading police on this days-long manhunt, and they believe now that a body that has been found in the woods near where this occurred. They believe it is the suspected shooter here. So I'll stop talking. Let's hear from Kentucky State Police officials there in London just moments ago.
An update on the search for Joseph Couch. Today at approximately 3:30 p.m., London Post, KSP Post, was notified that 2 troopers and 2 civilians had found an unidentified body in the deep brush behind exit 49 in Laurel County. Troopers had been searching in the area all day and had noticed vultures in the area. They continued to try and locate the exact nature or the area that the vultures were circling in. They began at that time while they were in there, they began to detect a strong odor of what appeared to be a decomposing flesh, whether it could be animal or human. While moving through the thick terrain and trying to locate the smell, troopers heard voices, and the troopers immediately identified themselves in the woods. They identified themselves as state troopers and asked that the individuals that were also in the wooded area identify themselves. There was a couple, Fred and Sheila McCoy, advised the troopers that they were also in the area searching for Joseph Couch. Almost immediately after that interaction between troopers and the McCoys, the troopers and McCoys stumbled upon an unidentified body. At this time, we still have troopers and personnel out there processing the scene. There were articles associated with the body that at this time we feel is Joseph Couch. Laurel County Coroner is there present, and then the body, identified body at this time, will be sent to Frankfurt for positive identification tomorrow. But again, we do have those articles associated with the body that we do feel is Joseph Couch. You know, I want to recognize the McCoys because they've been very cooperative with our troopers and provided troopers with relevant information. You know, this is still an active investigation, and we'll have more updates as we go forward with this. But, you know, I would like to acknowledge, you know,
Kelly, we was about to get it on, but them dang vultures kept interrupting us. Let us interrupt us.
We're very confident that this brings to closure in the search of Joseph Couch. But again, I want to reiterate the partnerships that we had with everybody here. Laurel County Sheriff's Office, London PD, FBI, the Marshal Service, ATF, National Guard, U.S. Forest Service, Kentucky Fish and Wildlife, our prosecutors here in Laurel County. This was a collaborative effort to bring this to a successful conclusion. But the main thing that is very good tonight is that the people of Laurel County can rest easy, much easier, knowing that this manhunt has now come to a conclusion. Sheriff Reed, do you have any comments?
Thank you, Commissioner. I'm Sheriff John Rood. I'm the sheriff here in Laurel County, and I just want to reiterate a few things that I've said since day one, since we've been having these conferences. One, the last conference we had, I told you guys that I wouldn't change a thing that we've done so far, and I wouldn't. The resources for these gentlemen that's on stage, that's here with me, some's not, has absolutely been they went above and beyond.
He has wasted so much money, time, effort on these poor people and the poor investigators and everyone else.
In every effort, and London PD, Kentucky State Police, all you guys. You just don't know how I appreciate you. I mean that.
Why did they have it sitting at that funny angle? It's ridiculous. It's like,
From the bottom of my heart. Since day one, my concern has been the residents of Laurel County. And I hope now that the residents, they know that this has been our number one priority is the safety. We've had school cancellations. We've had church cancellations. People's been in fear. That's not the normal here in Laurel County. So now that this has been discovered, I hope that our county can get back to what's normal. I will say this. I'm very proud, again, I can't say it enough, of the effort that has been put in on this stage, the effort and the manpower that's been used. And I also want to reiterate what the commissioner said, the McCoys. Hey, congratulations, we're proud. Our one goal was to have this guy recovered. And I'll be honest with you, I've always said prayer for our victims. Let's have a prayer for for Joe Couch's.
and we'll never know the motive, will we? It's Billy Bob. Billy Bob.
Family. They have worked with us. I don't care a bit to tell you guys through this investigation. We're doing the investigation end of it. I've called KSP and other resources for the ground search. But through the investigation end, they have worked with us. Just everything that we have asked, they have done. And as we all know, I have children of my own, and I hope and pray to God that they take the right path, and the family cannot be blamed for the misfortune that this guy has caused. And I really wish that we could locate Joe Smith and Joe Couch, and we would have had him live. We could have asked him what his intentions was. We could have put him through the courts. The prosecutors could have prosecuted him, and he'd have paid for what he done. I don't think nobody on this stage wished that we would have found him in the condition that we found. I'd rather he'd been alive and he could have paid for what he's done. In closing, I won't dare mention the people that has helped us in this, but not all the agencies. I mean, everything from a dispatcher to an ambulance driver, rescue.
Sorry, we'll interrupt that viewing because court's back.
And I hope, my prayer is that Laurel County will rest easy.
Get out of there and play that, Jody.
Where I conduct forensic evaluations for both the state and the federal court. And those are typically related to the similar issues as I do for the state hospital: competence to stand trial, mental state at the time of the alleged offense. I have also done some death penalty evaluations if someone's competent to waive or assert post-conviction appeals, or competence to proceed with post-conviction appeals also.
And when you're doing these evaluations, who are you usually doing those on behalf of?
It's most often it's court ordered. So it's, in my opinion, when something's court order, I consider that as the court's expert. My report goes to the court, and then both sides usually get a copy of it. Sometimes I am retained privately by one side, either the defense or the prosecution, and then I'm conducting the evaluation for them. So the person that I'm actually seeing and evaluating is not my client. It's the court or whichever attorney retained me.
And so if they're not your client, you're not actually providing them any type of treatment, right?
That's correct.
Could you give the ladies and gentlemen a little bit of information about your educational background?
I have a Bachelor of Science degree in psychology and a Bachelor of Arts degree in sociology from Lindenwood University, which is a private liberal arts school in Missouri. I received my master's in clinical psychology from the Arizona School of Professional Psychology in 2006, and I received my doctorate in clinical psychology from the Arizona School of Professional Psychology in 2008.
And do you have any type of licensure or certifications here in Mississippi?
Yes, I'm a licensed psychologist in Mississippi, and then I'm also certified as a forensic evaluator by the Department of Mental Health.
Tell us a little bit about what that means, evaluator through the Mississippi Department of Mental Health.
Yes, so the Department of Mental Health has a process where they train and credential psychologists or psychiatrists to be forensic evaluators. So they are credentialed to do evaluations of competence to stand trial or mental state at the time of the alleged offense.
Do you know how many of them are approved in the state currently?
I'm not sure our current numbers. There are some that are approved who don't reside in Mississippi. They do telehealth evaluations. I think we have around 20 right now, maybe, but not all of them reside in Mississippi.
And so that's 20 psychologists and psychiatrists that are have meet the qualifications for the Mental Department of Health to do the evaluations.
Yes, that meet the qualifications and have applied to do those.
Can everyone hear that okay? I have it boosted, so you should be able to. So let me know in chat.
Do you have? Do you belong to any sort of national or state level committees? Any type of groups regarding psychologists?
Yes, I'm a member of the American Psychological Association. I'm also a member of the American Psychology and Law Society, which focuses on forensic psychology. I am a member of the Mississippi Psychological Association, and I'm also the president-elect for the Mississippi Psychological Association.
And I know we talked about the fact that you perform these types of evaluations for both, most of the time for the court, but also sometimes for the party that asks.
Thank you.
How many times would you say that you have evaluated someone either for competency or sanity?
For competency, probably around 1,500 times. For sanity, probably around 500 times.
And have you testified in courts as an expert, as a forensic psychologist previously?
Yeah.
Now, Uda Hef, she's probably the bad pause, sorry. Probably the most attractive woman I've seen in the courtroom to date.
Yes, I have.
And how often would you say you've done that?
Probably about, I don't know exactly, about 45 times.
And you've actually been recognized by this particular court as a forensic psychologist expert, right?
Yes, I have.
Your Honor, at this time, we would ask that the witness be tendered as an expert witness in forensic psychology.
No objection, Your Honor. I believe our CV's already been entered by stipulation.
All right, she'll be accepted as an expert in the field of forensic psychology.
Dr. Gigliano, if you could tell the ladies and gentlemen the difference in like a treating physician or therapist and a forensic psychologist.
So it's a pretty different situation. I mentioned before, whenever you are treating someone, whenever you're the clinician, either a psychiatrist or psychologist, therapist, you're more of an advocate for the client, the person that you're treating, and you are treating and assessing them based on what they're telling you, usually for the most part. A lot of times treating clinicians don't have much information or records outside of what the client tells them. So they just go off of what they see in front of them and what the client tells them. In doing forensic evaluations, the person that you're actually evaluating and talking to and assessing is not your client. As I mentioned before, it's the court or potentially a lawyer. It could also be one of the parents if there's like a child custody dispute and you're doing that type of evaluation, but typically it's the lawyer or the court. And in that case, you are not an advocate for the person that you're evaluating. You are supposed to be a neutral, objective evaluator who forms opinions based on the information that you have, and you offer those to the court. So there's no guarantee that it will be helpful or not to either side or to the court. It also, when you're a forensic evaluator, it's not confidential because you have to share the information that you gather with the court in a report, or you may end up testifying. I always warn people of that also. So it's also different in that doing a forensic evaluation, because there's legal issues involved, you rely on more than just the person's self-report. It's really important to have collateral sources of information. So you are always trying to corroborate what someone tells you to see if there's evidence in the records to support what they're telling you. Do other people say the same thing? You often interview friends or family, maybe even an employer of the person that you're evaluating. So it's not as clear that you're just taking what the person tells you as the truth. You're wanting to look for corroborating evidence and find where all the data is kind of pointing you. What direction is it all suggesting?
And you spoke earlier, Dr. Gugliano, about competence and maybe somebody's sanity. If you could kind of describe for us what competency is first.
Competency in general can be applied to various different things. It's situation specific. And what it essentially means is that someone has the ability to do something. So it could be competence to make legal decisions, or competence to be over your own medical care, financial situation, things like that. In the realm of criminal cases, competence is typically referred to for competence to stand trial or to proceed with their legal situation. And so that means, does the person have the ability to understand their charges, to understand the basics about the court system and how that works, to be able to appreciate the adversarial nature of the legal system, and that they're able to assist their attorney in their defense. So competence really has to do with someone's mental functioning presently in the current moment. Sanity, or mental state at the time of an alleged offense, has to do with how someone was doing mentally at the time of an offense sometime in the past. So it's a retrospective evaluation where you're trying to figure out whether someone was so mentally ill that it impaired their ability to know the nature, quality, or wrongfulness of their alleged acts.
And I want to talk to you a little bit about that. Is there a certain standard in the state of Mississippi that forensic psychiatrists and psychologists have to follow when rendering opinions about sanity?
Yes.
Could you tell the ladies and gentlemen about that? I think you sort of described that, but just want you to talk a little bit more about that.
Yes, the standards is what we often call the McNaughton standard, because that's the criminal case that the standard developed out of. The person who was the defendant was Daniel McNaughton. And so the McNaughton standard is what we refer to as a cognitive test. That means that it's just based on someone's knowledge about something. So it's, do they know the nature and quality? That essentially means, do they understand the basic facts about what they did? Then understanding the wrongfulness is, did they understand that what they were doing was illegal? So some states have different standards. So some states include whether someone had the ability to control their impulses or whether they appreciated the wrongfulness. But in Mississippi, it's just a knowledge of what they were doing and if it was wrong.
So I want to be clear, you said something about other states allow whether somebody appreciated what they did was right or wrong. Can you describe for us what you meant by that?
Yes. So knowledge is really just understanding the basic facts about something. Appreciating is having a more in-depth understanding to where you can understand the societal and moral implications behind it and reasoning for it. So for example, someone might know that killing someone is wrong, that it's illegal, but they may not really understand why it's wrong to do that. They know that it's bad, they know they're not supposed to, but they really don't understand why. So that would be more the appreciation, where they don't understand the reasoning behind why it's wrong.
And Mississippi doesn't allow us to talk about the appreciation of someone, right?
It doesn't include that in the standard.
I want to talk to you about the defendant, Carly Gregg. How is it that you became, or did you have the opportunity to work on an evaluation involving Carly Gregg?
I did.
And how is it that you became involved in that case?
You contacted me to see if I would be available to do an evaluation of Miss Gregg's competence to stand trial and sanity.
And was it your understanding that you were being court ordered for that?
It was.
And is that how you went about your evaluation?
Yes, it is.
And in fact, we talked a little bit about how that's different, but when you're court ordered to do it, you said you returned that report to the court and the defense attorneys, right?
Yes, actually in Mississippi, I submit my report to the circuit clerk, and then the circuit clerk distributes it to the judge, defense attorney, and prosecution.
Does the prosecution have any ability to edit the report that you prepare?
No.
Does the prosecution actually really have any input into what you put into your report?
No.
And sometimes those reports actually come back and say that the defendant is incompetent to go forward, right?
Correct.
And sometimes you will render an opinion that the defendant is in fact insane.
Correct.
I want to talk to you about this particular case. Dr. Guglielmo, did you prepare a report regarding your findings?
I did.
And are the opinions that you formulated in that report, are those based upon a reasonable degree of medical certainty?
To a reasonable degree of psychological certainty, because I'm not a medical doctor, so we use psychological certainty for psychologists.
Thank you for that clarification. And what types of items did you review before rendering your opinion in this case?
I reviewed some court orders involving this case. I reviewed some of the discovery materials. I also had some treatment records, not all of the ones that have been talked about so far by other experts. I had the Magnolia counseling records, so Miss Kirk's records from the therapy. I also had precise clinical neurosciences records from the medication that she was being prescribed. I had a few records from the jail from her current incarceration related to some crisis contacts, but I did not have any records regarding the medication that she was being prescribed in jail. Then I also spoke with Ms. Newman about her concerns regarding the case, and I spoke to Ms. Todd, the defense attorney, about any concerns she had regarding the case.
Did you interview anybody besides the defendant in this case?
No, I attempted to interview her stepfather, but he had asked to have his attorney present, which I said was okay, and he was going to call me back where we could set up a time to do that, but he never returned my call.
Why is it important to try to talk to family members before you conduct your evaluation?
I do that because I'm trying to see if there's anything that they say that that will give me an idea of what to follow up on, or there may be something that isn't in the records that they're aware of. And sometimes they can give you a direction to go with your questioning. I do a pretty broad evaluation, but if there are any significant concerns or specific concerns, I want to make sure that I know about them so I can ask about them when I interview the defendant.
And Dr. Gregg, you just testified about some of the things that you reviewed, that you had conversations with both my office and the defense. Is that information, facts, and data that you typically rely on in conducting your mental health evaluations?
Yes, it is.
And is that information that is pretty regular for a forensic psychologist to consider when forming their opinions with regards to competency or sanity?
Yes.
Did you actually have the opportunity to speak with Ms. Gregg?
Yes, I did.
Was that interview recorded?
It was.
And do you record all your interviews?
I record most of them. There's a few times that I haven't for the federal courts because the attorneys have not wanted me to.
And why is it that you record those interviews?
I record them in case I need to refer back to my notes. I take notes while I'm interviewing someone, but I like to be as accurate as possible. And I really think that quotes are helpful for either a court or a jury, for either the judge or the jury, whoever's making the decision, to see what people actually say. So I record it for my benefit, and then I also record it in case someone wants to get the recording so they can listen to it. I try to have transparency in my evaluations. I'm not trying to do anything that I wouldn't want recorded. So it's to help just confirm what I'm reporting in my report.
When you're conducting one of these evaluations, Dr. Giuliano, is it your role to favor one side or the other?
No, as a forensic evaluator, your goal is to be as objective and unbiased and neutral as possible.
How often, when you're doing these evaluations, do you actually have mental health records from the day before a crime was committed?
Very rarely.
And how often do you get the opportunity to have a video where part of the crime is committed on the video to consider?
It's not unheard of, but it's not in the majority of cases.
I want to talk to you about the interview that you did of the defendant. Who was present during that evaluation?
It was myself, Miss Gregg, and Miss Todd.
And is it common in your practice for attorneys to be present during the evaluations?
I wouldn't say that it's uncommon. It doesn't happen in the majority of cases, but it's not unusual.
How often, when you have attorneys sit in, is it common for them to make comments during the evaluation?
Most attorneys don't say much during the evaluation unless the defendant asks them a question. I always let both the defendant and the attorney know at the beginning that if the defendant wants to consult with their attorney during the evaluation, we can stop and they can consult in private, or the defendant can even ask their attorney for guidance at any point without us also stopping the interview. So it happens, but most of the time when it happens, it's the defendant who initiates the consult with the attorney in the moment.
And in your training and experience and all the evaluations that you perform, is it unusual for an attorney to be asking their client multiple questions instead of you during an evaluation?
Yes, I would say that's unusual.
Dr. Giuliano, I want to talk to you about
Hello,
the specific findings in your evaluation. Can you tell us when you conducted that evaluation and sort of walk us through what happened?
We met in a room at the detention center, and it was for several hours. I think we were probably meeting for about 5 hours, but we had several brief breaks in that time to where the interview was a little over 4 hours, and we had a break for lunch also. But essentially it was me asking the majority of the questions to Miss Gregg, and Miss Todd interjected at some points, but that was pretty much it.
Were there things that Miss Todd shared with you that were not provided to you in discovery?
Yes.
Is that typical in cases when you have evaluations?
It's not unheard of. Miss Todd shared some things with me on the phone. I talked to her before I met with Miss Gregg to do the interview. So she had shared some things with me on the phone that I was not aware of at that point. And that's one of the reasons that I call attorneys, is to see if they have any information that may be helpful.
And when they give you that information, you then try to follow up, get some sort of confirmation about those statements or what that information was?
Yes.
What, if anything, did Miss Gregg tell you during your evaluation about the use of illegal drugs?
She told me that she was smoking marijuana through a vape pen, and she denied any other illicit or illegal substance use.
What did she tell you about abusing any other prescription medication?
She didn't answer that question.
And was that important to you?
It's a regular question that I ask when doing an evaluation. Both illegal drugs and prescription drugs, or even over-the-counter medications, can have impacts on someone's mental health or in their functioning. So I routinely ask those questions.
And if someone were to have been on a prescription drug at the time of the crime, it would have been important for you to be able to explore that a little bit further, right?
I would definitely want to know if they were on medications at the time, or if they were taking anything that wasn't prescribed to them.
And if so somebody wasn't truthful or didn't provide you an answer about that, that would impair your ability to make a decision about anything regarding medication. Is that correct?
It might not impair my ability. I'm limited in what I can say about medications. I don't prescribe medications. So I'm limited in what I can say about that, but it could limit things such as, it might be a consideration that someone's actions, feelings, behaviors could have potentially been due to a drug or medication. And so if you don't know that they were using that, then you wouldn't know that that's a potential factor.
I want to back up just a little bit. The defendant told you that she'd been using marijuana. You have the opportunity to review prior medical records in this case. Did you see anywhere in her prior records where she had reported the use of marijuana?
I believe she had reported it to the jail, maybe, after she was arrested.
Prior to March 19th of 2024, had she told any of her treaters that she was using marijuana?
From the records that I reviewed, she had not.
From the records that you reviewed prior to March the 19th, 2024, had she ever reported to anyone that she was having voices in her head?
No, she did not.
Prior to March 19th of 2024, in the records you reviewed, had she reported to anyone that she was having lapses in time?
She did not.
And did you find anything that was provided to you by either side to corroborate that Ms. Gregg was having lapses in time?
Miss Todd told me during our telephone conversation that Miss Gregg's stepfather had mentioned that Miss Gregg was having lapses in time and kind of spacing out. And so I asked Miss Gregg about that during my interview of her.
But you weren't able to corroborate that with him?
No, I wasn't able to speak with Mr. Smiley.
I want to talk to you about the use of marijuana. In your experience, can the use of drugs alone cause some sort of psychosis?
It can.
And what about marijuana or THC alone?
It can. We thought previously there was a common belief that marijuana was fairly benign, but there are higher levels of THC in most marijuana now, or a lot of marijuana now. And so with the more potent marijuana, it is possible that people can experience symptoms of psychosis just from marijuana use.
When we're talking about symptoms of psychosis, can you describe for us what you mean by that?
That could be hallucinations, such as seeing things or hearing things that aren't really there and that other people don't see. It could be delusional beliefs, which are beliefs that are untrue, but the person staunchly believes that regardless of the facts or evidence presented to them that dispute those beliefs. It could also be mood symptoms like an emotional flattening to where they don't seem to have the normal range of emotions that most people experience. It could even be slowed thinking or slowed body movements.
During your interview with Miss Gregg, did you talk to her about some things that might have been bothering her at the current time?
Yes, I did.
Could you tell us a little bit about that?
Yes, may I refer to my?
Absolutely.
I always ask people that I'm evaluating, if you had to pick the one thing that was bothering you the most lately, what would that be? Because it's a pretty open-ended question, and it can kind of give you a good idea of what is, on that person's mind maybe the most. And Miss Gregg reported that she was bothered that she knew school was getting ready to start up or had just started back, and she missed school because she said she really enjoyed school and that had been a main focus of her life. She also discussed feelings of sadness, difficulty sleeping. She reported having mood swings.
What did she say about her mood swings?
She said that they could occur minute by minute or could happen over the course of weeks or days or months. She said, when I asked her to provide some additional clarification, she said, quote, "I'll be really happy one minute, then I'll be desolate the next," close quote. So she was describing, it seemed to me, pretty quickly fluctuating mood states that appeared at least somewhat dependent on her situation and what was going on with her in her life.
Dr. Gregg, you were in the courtroom during the testimony earlier where somebody had mentioned that Miss Gregg's father potentially had bipolar disorder. Can you describe for ladies and gentlemen what bipolar disorder, I think it's type 2, is?
Yes, there's two different types. I'm not sure which one Mr. Gregg has been diagnosed with. Type 1 involves episodes of mania, which you guys had heard about previously. It's whenever someone has the really high emotional experiences. They have a lot of energy. They may feel like they're on top of the world, really happy, feel invincible, have trouble focusing. They may start a whole bunch of tasks but never finish anything. They can be more irritable. And it's so severe that it impairs their everyday functioning. Then bipolar 2 disorder is kind of a less extreme version of mania that we refer to as hypomania, where they're elevated more than what is normal, but it's not quite to what we consider a manic episode.
And when you're talking about a hypomanic or an episode in bipolar, is that consistent with somebody whose mood can change minute to minute?
No.
Could you describe for us why not?
Yes, for bipolar disorder, it's something that isn't based on someone's situation. They really have no control over their emotions. It's not due to something good happening in their life or something bad that's happened in their life. And for a diagnosis of bipolar disorder, they have to experience either the manic episode for 1 week, where from every day, more days than not, that they're in this hyper aroused state. For hypomania, they have to experience it for at least 4 days in a row. And so that's not something where you would see fluctuations within the same day or hour.
All right, everyone, thank you so much for tuning in. It appears to be a problem or an issue with the camera in the courtroom. We are working on getting that set back up and getting that stream going again for you. Who is on the stand right now is Dr. Amanda Gugliano. She is the director of forensic evaluation at the Mississippi State Hospital, and she evaluated Carly after Carly was arrested. She also has all the clinical notes from the different doctors that saw Carly. So we are working to get this put back up for you as soon as possible. We will get that going again for you. And we do have a reporter there in the courtroom who will be able to give us an update on what was said during this time. But we will, we're getting it worked on for you, and we'll be back in just a moment. Please do not go anywhere.
I didn't do anything. You left, and then the whole thing crashed, and I was like, of course, this happens to me.
What, the site crashed?
No, the site didn't crash. It was something, it's something to do with their feed in the courtroom. She said that she'll put it back up when it comes back.
Oh, they must have a miner in there, is there?
No, I just think there's something wrong with the camera feed.
All right, let me see. If court TV's got the feed's still up.
About the intrusive memories regarding
Did we see this
the
bit?
offenses, because I had not yet determined whether she was competent to stand trial.
Yeah, I
and
think we have,
essentially revealed
but it
incriminating
needs to
information.
be boosted.
Until later to ask that, and we never ended up circling back to that.
And Dr. Giuliani, in your, was there anything about your
Is this repeating what we've seen already, or
I'm pretty sure, yeah.
because that's live now? It's not like we're behind it all.
Yeah.
Should we continue and see if
the
it just continues
conversation
on?
where somebody said something
Yeah.
about feeling queasy when they were thinking about the event?
Yes.
Tell me about that, if you would.
Carly reported that sometimes when she
Can you
thought
boost it?
about the alleged offenses, that she would feel queasy.
Yeah. Can you not hear it?
And what else did she say about being
It's
paranoid?
really
Go
low.
more.
She described having thoughts that bad things were going to happen, such as that someone would jump on her in the jail or things like that. And in my experience and opinion,
Better?
that's more consistent with anxiety than delusional paranoia. Whenever people kind of have those
Nah, it's still kind of
thoughts
low,
where
but
they just worry about
that's all you
all
can
the
do. That's all you can do.
potentially happen, that is symptomatic. You know, they often
Oh, that was my
say
end. My volume was down.
things are going to happen, but they're not using it in the clinical sense of paranoia, and it's not what I would think of in the clinical sense as paranoia, as like psychotic paranoia.
I want to take a step back, Dr. Giuliano. The word queasy, and you talked about that Carly said she felt queasy when thinking about the event. Can you elaborate on what that meant?
I didn't ask her, but I was assuming that
Yes.
it meant sick to her stomach.
About the crimes that have been committed?
About something in relation to them. I didn't ask for any specifics.
Oh dear.
At some point, Dr. Giuliano, did you have a discussion with Carly about whether or not she was hearing voices?
Yes, I did.
And what did she say?
The last 3 witnesses have repeated this. Really?
About the voices?
They're really hammering in those nails,
She
aren't they?
said that
Yeah,
she
it's
had
kind
been
of
hearing
annoying.
one voice, a male voice, since she was young. I think she said maybe around like 5 or 6 years old, which is unusual. And she said that she heard the voice every day and that it was always kind of there in the background, but she could usually ignore it and tune it out.
You said that it was unusual that somebody would start hearing a voice at 5 or 6. Can you tell us why?
Yeah, that's not really consistent with a psychotic disorder.
No.
Typically,
Didn't do
people
her
start
research very well,
having
did she?
symptoms of psychosis for women in their early to mid 20s. For men, it's late teens, early 20s. It's very unusual for a young child, to have what are actually hallucinations. And it's possible that it wasn't what we would clinically consider a hallucination. It could be,
A
you know, as
dear?
a kid,
Don't
it could
say
be
a word.
something like their own inner thoughts or their inner dialogue, and
George
they
isn't here.
don't recognize that as what that is.
She describes those voices that she was hearing every single day.
Yes.
Is that common in people in that age group?
No.
What did she say about whether or not these voices ever told her to do anything?
She said the voices never told her to do anything. She said that they made snide comments about other people and just really rude comments, kind of talking down about other people. I specifically asked her if the voices ever told her or said anything about her mom or her stepdad, and she said no.
You were present in the courtroom yesterday during Dr. Clark's testimony, right?
Yes.
And you heard mention that Carly had disclosed to an employee through Vital Court that in fact her mom, she heard voices that told her to harm her mom.
Yes, that's what Dr. Clark said.
So there's records saying Carly said, the voices told me to hurt mom, but that's not what she reported to you.
Correct.
Dr. Guglielmo, as part of your evaluation regarding competency, one of the things you consider is the defendant's ability to recall facts. Could you tell the ladies and gentlemen why that's important?
That is a requirement specifically for Mississippi. Most other states don't have that as part of their competence to stand trial requirement. There's not a clear definition of what is specifically meant by that in the standard. The general interpretation that I have for it is that it means that someone can recall basic information about their case. If they have a discussion with their attorney, are they able to remember what they talked about? What do they remember about the alleged offenses? If they don't have a good memory or don't remember the alleged offenses, are they able to go over the evidence and remember the evidence enough to be able to help their attorney prepare their defense?
And in this case, what did you find regarding Ms. Gregg's ability to remember relevant facts about the alleged offense?
It was my opinion that she
Not at
had
all,
the
Helen.
ability to recall relevant facts. We talked about the month leading up to the alleged offenses and what all was going on with her then. And her report was fairly consistent with the records that I had available. She also did not demonstrate any current memory deficits that would have been concerning. So I didn't talk to her about that day in particular because I didn't end up evaluating her sanity at the time of the alleged offense. So I don't know exactly what all she recalls from that particular day.
With regards to your evaluation, did you in fact find a forensic opinion regarding Carly's ability to proceed to trial and competency?
Yes, it was my opinion that she had the ability to do so.
And is that to a reasonable degree of psychological certainty?
It is.
And again, just to kind of go through those factors with us, the ability to understand the nature and the proceedings against her.
Yes.
And then what else is that?
The ability to rationally communicate with her attorney about her case, the ability to recall relevant facts, and the ability to testify in her own defense if she chose to do so.
And in fact, you found that Carly was competent.
That was my opinion. I don't decide that. That's up to the court to decide.
And in this particular case, Dr. Guglielmo, did you send your report to the clerk's office like you do when you're court ordered to perform an evaluation?
I did.
No further questions, Your Honor.
How many days have you got left to wait before you can turn it back again, little Al?
Lunch is here and it's set up and ready for y'all, so we're going to take a recess till at least 12:30. Remember not to discuss anything about the case at this point.
12:30.
Just whenever you're done,
What time?
around 12:30, or thereafter, it's y'all's lunch. Knock on the door and let the bailiffs know you're ready. Okay, everyone, please remain seated while the jury exits.
So what time is it over there now? If they're coming back at 12:30, because it's 2:47 a.m. here. So is that 11:30 or 11:15? 12:47. All right, so I've got to do the math now, and it's too early. So if they're going to be back at what time did you say? Shit, I can't even remember what time they said they come back. Is it an hour? So 11:47 there now. Okay, so that's 3 hours behind me, and they're going to be 1:30, so an hour and 45. So 3:30 a.m. No. Oh, 4:30 a.m. Is that right? One. You're going to be back at. Okay, so no, no. I can either. I can do that. Yeah, my brain doesn't function this time of the night, morning. All right. Let me just see if they continue on, or if they actually. Yeah, no. Okay, cool. So we're not missing anything. I will keep that on in the background so I know. All right. So, what do we do? What do we do for the hour? Well, what is it? I can't. Judge looks bored, yeah. Correct. Yep. We have a Gabby Q&A. All right, let me see what
Very
I can
funny.
find.
Very funny. Haha.
Uh-huh. What was I looking at? I wonder if Grandma's awake. Where's my history? History. God, I'm so glad I'm getting my new glasses tomorrow. George of the jungle. Oh, come on. Today, Junior. Now, which one is it that has? It's Law and Crime that has like Vinny and all the other extras, isn't it? Like all the other side. Yeah, Law and Crime. There was something on there that were very, very funny. Just got to find it. Bear with me. Maybe it was under. There we go. It's under sidebar with Jesse Weber. If I can find all of his. Where did that go? Ah. Come on. It's better. Oh, all right. Here we go. Let's just have a look at this. See if anyone knows where this might be and who might know them. It's only 10 minutes. Oops.
I am smart and like I am courageous. I tell you.
The mother of a 2-year-old girl is going to prison after she pleaded guilty to
This isn't the funny one. Sorry. Just FYI. I was on the way to the funny one.
poisoning the toddler with prescription drugs and watching her die. We're going to have on a trauma expert and licensed social worker to talk about this. Welcome to Sidebar, presented by Law and Crime. I'm Jesse Weber. Prosecutors in California say Macy Sylvie was just 21 years old when she gave her 2-year-old daughter, Riley, multiple prescription pills and watched her suffer inside of a car before she died. Now, Sylvie ended up pleading guilty. Charges of murder in the first degree, kidnapping. This was back in May. And now she has been sentenced. Sentenced to 33 years to life in prison. By the way, when we put Sylvie's name into the search box on TruthFinder, we learned that she was charged for this murder in August of 2023. This was months after it happened.
Whose sponsors that?
By the way, talking about TruthFinder, you can find out a lot of information on TruthFinder. It's one of the largest public record search service. You can. Okay, so back to this. First responders in Shasta County, California, say that on January 5th, 2023, they responded to a call that there was an unresponsive 2-year-old in a vehicle near a state highway. EMS, they rushed her to the hospital, but she died that night. Now, a pathologist report apparently noted that
I think I clicked on the wrong one. Whoopies. What have I done? I did. I clicked on the one below. Sounds about that. I'm like, this doesn't sound right.
find her a lot. We use it to research our.
Let's go back.
And stabbing a man as he was trying to get into the shower. Even though the victim was allegedly able to point the finger at her, he has now died, and she is facing upgraded murder charges. An Indiana criminal defense attorney is here to talk about just how much trouble she could be in. Welcome to Sidebar, presented by Law and Crime. I'm Jesse Weber. Okay, let's talk about Briley Turner. So the 25-year-old was arrested back on August 18th for aggravated battery. This is a level 3 felony in Indiana, as well as attempted murder. Now, this is according to officers with the Bloomington Police Department, but they say Turner had attacked a 36-year-old man named Michael Hodge inside of her apartment, causing severe injuries. Also, we put Briley Turner's name into the search box on TruthFinder, and we were able to see a criminal history under a lot of public records, access to unlimited reports about almost anyone. So if you're interested, one reportedly at around 7 p.m. that Sunday, August 18th, to report that they could hear a man and a woman both yelling. And it sounded like at least one of them was shouting, "Help." Now, officers at first could only really hear loud music coming from the apartment. Then they were able to hear the screaming. So they break down the door. They find Turner lying on the couch covered in blood, but it turns out that blood wasn't hers. No, Michael was on the bathroom floor with multiple stab wounds. That's the report, according to a.
This is in Bloomington, Indiana. Who lives in there, in that state?
AJ.
Apparently,
Well, she lives in Indiana.
Yeah. Apparently, Carmen knew this chick somehow, either
really?
through her work or school.
Huh.
criminal complaint, quote, during officers' initial observations of the bathroom, it was determined that there was a bloody plastic handle to a kitchen knife with the metal knife portion missing near the bathtub. Additionally, there was a bloody black-handled tire plug tool with a metal spike on it located on the floor nearest to the sink. Lastly, in the main living room of the apartment, to the right of the main door, was a bloody baseball bat leaning against the wall. So you have 3 deadly weapons, a victim who's gravely injured, and a suspect covered in blood. Just imagine what an awful scene that was. So when the detective gets to the emergency room, doctors told him about Michael's very serious wounds. He had stab wounds to his chest, rib cage.
I just happened to come across this this episode of Sidebar, and it's about a woman who comes from the same county and state as AJ. So I thought I'd just play it just for shits and gigs while we're waiting.
Neck, quad, upper right buttock. Part of the knife, which they found broken in the bathroom, was still inside Michael's body. He also had a broken arm with part of the bone sticking out. So this is a really, really horrific attack. Gruesome stuff. Now, police, and this is important, they were able to speak with Michael, and he told them that he had been getting into the shower and thought that Turner was going to join him when she suddenly attacked him out of nowhere. He alleges that she started with the baseball bat, then switched to the knife. He said he tried to grab the knife away from her, but he only ended up with cuts on his hand. And Michael said that there hadn't been any sort of argument or altercation before she hit him. So Turner, going back to her, she was also taken to the hospital. She had blood all over her hands and arms, but again, none of it was her own. According to the criminal complaint, quote, as medical staff attempted to evaluate Briley, she would not talk to them and also refused to speak with officers. During this time, she repeatedly made jerking motions with her extremities and loud moaning and whimpering noises, but would not communicate directly. The detective also noted that Turner had yellow and purple bruises on her legs and sides that appeared to be older. So now that's important because if we're talking about new injuries, it doesn't appear from this at least that there were new injuries. And why is that important? Because an officer who was with Turner at the scene documented that, quote, Briley made statements to him on scene stating, he tried to get me. He effing tried. He effing held me down, and he tried to put that stuff down my throat. I don't know what he put in my throat, and I had to defend myself. Dude, I tried to defend myself. After making these statements, she began hyperventilating and would not communicate with officers. The statement goes on to say, quote, while being placed under arrest, Briley complied with all orders. She was able to stand on her own, listen to commands from Officer Wells, and got into and out of a wheelchair on her own. While in the back of Officer Wells' squad car, I again asked Briley if she would talk to me, to which she shook her head no. The detective ended the criminal complaint by stating, quote, based upon the facts and circumstances of this investigation, it is my belief that Briley Turner knowingly and intentionally inflicted injury on Michael Hodge that created a substantial risk of death, committed aggravated battery. And
I swear his name is familiar, Michael Hodge. I swear. I don't know where I've heard it from, but oh.
Then things took a turn. Things took a very bad turn because Michael died on September 11th at the hospital. The Marion County Coroner's Office ruled his death a homicide. Now, I should tell you at the time of this recording, it is being reported that the charges have been upgraded, that she has now been hit with the most serious charge, murder, attempted murder, aggravated battery in connection with what happened. But some people online have actually compared this case in a way to the Jodi Arias case. Remember her? She was the woman convicted of first-degree murder for the brutal stabbing death of her boyfriend, Travis Alexander, in Arizona back in 2008. He was found in a shower with 27 stab wounds, a slit throat, a gunshot to the head. Now, Arias had said there was self-defense. The jury didn't buy it. During the penalty phase, they deadlocked on the death penalty, so she was sentenced to life in prison without the possibility of parole. And of course, Travis Alexander, he couldn't tell investigators what happened to him, but Michael was able to communicate and say what happened to him, pointing the finger right at Turner. So now let's talk about this. I'm joined right now by Mark Worthley, an Indiana criminal defense attorney. Thank you so much for coming on, Mark. Appreciate it. As a defense attorney, what's the best defense here? Is there one?
Well, obviously, her statements when she was confronted by the police initially would lead you to think that she wants to make a self-defense claim, but probably it's more likely going to be an insanity type defense. Because there's no injuries on her, I think it would be really difficult to make a comparison between the number of stab wounds that the victim had to essentially no visible injuries and say that she was defending herself. So I think self-defense is probably going to be a stretch for her. And then when you compare that to the statements she was making to the police, the language she was using, and the movements that they're describing, that would probably lead a defense attorney to want to make a claim of insanity.
But that would be tough to prove, right? That's tough to prove in any case. But I feel, well, I mean, some of the things that she was saying was pretty out there. But what would an insanity defense have to look like here? What facts would you need more of to actually mount that in Indiana?
We heard all
they
those.
Would need to get an expert involved, somebody who would be able to say that her mental capacity at the time of the offense was degraded to the point that she wasn't able to appreciate the wrongfulness of what she was doing.
I guess the question is, going back to
He doesn't look strong enough compared to him. Bizarre.
Your defense, putting insanity for the side. If you go back to the idea of self-defense, right? Do you need to have injuries on your body? Have you seen cases where somebody, they're in a position where they think they're about to be attacked, but maybe they don't have to wait to be attacked, and they ultimately can mount self-defense? Here, the argument's strange because it sounds like there was some sort of physical confrontation. And I think what's really difficult for her is multiple weapons that were allegedly used.
Right. There would not need to be an injury. But in this case, there's only two witnesses. And the fact that there's not somebody there to corroborate that he was attacking her. So her statements would be viewed as self-serving by a jury, and there wouldn't be any corroboration to her to say that the self-defense claim was anything more than just a get out of jail free card for her in that instance. But yeah, in a lot of instances, especially if you were dealing with two guns, the victim and the perpetrator both had guns, then it would be a little bit easier to say, well, I shot first because I wasn't going to wait till he shot me. And then there wouldn't be any injuries. But yes, self-defense in this case, I think, is going to be torpedoed because she doesn't have any injuries.
And to have the victim speak, because how many times in trials do we hear we're representing the victim's voice? This is them crying out from the grave. This is the grave. This is them saying what happened. It's not true. They're trying to say there were other ways that a victim would say, this is the person who killed me. Here, you actually have a victim explaining what happened to them before they ultimately die. And I'm curious about the impact that statement would have, both, in terms of mounting a self-defense argument or prosecuting the case, but B, the very act of a jury hearing the last words, the dying words almost in a way, of a victim. That's I feel very tough for a defense attorney to find a fair and impartial jury that's not going to be swayed by that.
This will be a really big issue for them at trial because that statement is hearsay for certain. And then the question will be is whether or not a judge would let the statement come in, even though it's hearsay. So there would be two different ways that they could evaluate it. One is whether or not the statement was made and the person making the statement believed that he was imminently about to die.
Right.
That would be extremely fact sensitive. Was it at the hospital? Were they telling him that he was potentially going to die? Or had he recovered? Was he conscious and stable? In which case, then now the evaluation has changed because he has died and he's unavailable to testify. So there are a few more options that the court could let that statement in. But the defense is going to push really hard to keep that out. I don't know how that's going to play out, but once the statement comes in, then yeah, the reason why it's hearsay and the reason why this will be a big issue for the defense is because it will be such a damning statement, and there won't be any cross-examination available to say, easy for you to say this happened when you're at the hospital talking to the police, and maybe who knows what cross-examination questions they would have wanted to ask, but it's not available to them.
And to be clear, the way that you would get this evidence in is the people that.
Just watching another. I happened to stumble across this the other day, and I didn't watch it. I just saw the title, and it happened to be in AJ's hometown. So I thought we'd check it out. But I've got another thing queued up that should be quite amusing after this one. This has only got a few minutes left because we're on lunch. Court is in recess on lunch.
He allegedly made these statements too, right? Like the first responders or law enforcement, they would testify about what he told them, and you could cross-examine them about what they heard, right?
Yeah, you can't really cross-examine a police officer on what he heard. I mean, the only cross-examination question would be are you sure you heard it right? It wouldn't be like, well, when you want to talk to the victim about saying that she went crazy, she lost her mind, she stabbed me, you couldn't ask her any questions like, what preceded that? What did you do to her? What did you try to put down her throat? Obviously, that's what she said, but.
Right. Let me ask you this. If this goes to trial and she mounts a self-defense argument, she has to take the stand. I mean, what I mean by that is she doesn't have to take the stand. It's her choice. But in a self-defense case, it's when we see, I think it's one of those rare times in the law we actually think it's a benefit for a defendant to take the stand, explain their side of the story, explain the danger they were in. She would have to do that, right? In this kind of case, to explain the danger that she felt?
Yes. So self-defense is flipping the burden onto the defendant. So you may have heard numerous times that the burden is on the prosecutor to prove the guilt. So the defendant doesn't have to take the stand, doesn't have to do anything, and the jury can still be compelled to find the defendant not guilty, even if the defendant presents no evidence, because it's the state's burden. The state has to do things to convince you that the defendant is guilty. But if you allege self-defense, you plead that, and then you seek to prove it, you have to present evidence. Otherwise, the self-defense claim fails. So she would need to take the stand, testify about what happened before the attack or during the attack, and prove to the jury that she was defending herself. And she also has to essentially admit that the attack happened. If she pleads self-defense, or if she makes that argument, she's essentially admitting that she attacked him and killed him, but she was justified in doing so.
And by the way, if she were to take the stand, the other past criminal history that she may have, she could be questioned about that, right? That could hurt her in the end.
Anything that she has that would relate to her ability to tell the truth, or for a jury to infer that she was telling the truth, would come in, and possibly some of her other convictions as well.
All right, so it's an interesting case, sad case to say the least. An interesting one from a legal perspective, though. We'll continue to follow it. Mark Wordley, Indiana criminal defense attorney, thank you so much for coming on. Appreciate it.
You're welcome.
All right, everybody, that's all we have for you right now here on Sidebar. Thank you.
All right, let's check out this one. This will amuse you too. You know who I'm talking about. Big screen. And share this tab instead. All right. 3 women who flirted with police to try getting out of an arrest caught on body cam.
Oh,
I haven't seen it.
excuse me? No, it's just... You look hot.
Okay, good.
I understand.
Can you hear that okay? Let me just boost it a bit, just in case. We got to get the full audio effect. And should we close caption it? Let's put it up in the middle. All right. Let's go. And roll.
Thank you. You got all that stuff to go through.
Yeah.
You want to take me?
No.
Do it.
Stay in the blue box.
I like it.
Some suspects will try anything to stay out of jail, and sometimes that even includes trying to seduce police officers. We're taking a closer look at the top 3 times detainees tried to flirt their way out of an arrest. Welcome to After Hours, presented by Law and Crime. I'm Sam Goldberg. We begin today's episode with a suspect who seems to have a love-hate relationship with the police. It's November 2023. Police in Lake Forest, Illinois are checking out a parked car with 2 people inside. Hi.
Hey, I'm Vanessa. Are you standing?
I am.
No, I'm sorry. No,
What are you guys-
I'm sorry.
what are you
I'm
guys
sorry.
doing here?
No, I live right here. Don't do this to me. No, I live right here. I'm not gonna drive anymore. I'm just trying to get the
Okay. Just, you gotta... I'm sorry?
No, not here.
I saw you guys driving in, so I want to make sure everything's
No,
okay.
that's my house.
Okay. Do you have an ID with you?
Yeah.
Central 301. Can you serve me a code too, please? Do you have your ID with you? Can I see it? Just so you know, everything's being audio recorded,
Yeah,
okay?
So I live down the street from here.
Where do you live?
Not even
Like-
talk.
Right there.
Here?
Yeah. So no, live right there.
Where did you guys come from?
No, like we've been staying right here. Like we've been trying to stay. So we just wanted to show you a video, but if you don't want to see it, that's okay.
No, I'm just asking where you guys coming from, because I did see you guys pull in here
Wasted.
earlier. So I just wanted, again, when you see a car with 2 people in it at 1 in the morning, you got to make sure everything's okay, you know?
No, we're okay. We just wanted to see you like pull up and like look at the video.
Gotcha. Okay.
So we just wanted to see you from.
I can't because we've got closings to do and then verdict watch and AJ's at her dad's, so I'll stay up for another probably 45, maybe an hour. We'll see how we go. 'Cause poor Gabby's got to fill in the middle, so we shall keep going.
Our perspective and
Where did you guys come from?
we just wanted to come from our apartment. So like if you didn't want to come from our apartment.
Do you know where you're at?
Of course we did.
You know what town you're in?
Of course. I live here.
What town are you in?
I love it.
Okay.
Don't
Just making
play
sure.
with me.
Just make sure
Don't
I'm
play
not.
with me.
Sir,
Look,
you have an ID with you?
of course, and I'm gonna
No.
play with you. Look, I'm a businesswoman, so I have a lot of ideas with me. If you don't mind me just pulling out of ideas with me.
Okay. What do you do?
Hey, no, hold on. I don't give a about your woman. So I'm a.
I don't know if that's fine with you. Yeah, that's good. Can I see your driver's license?
Yeah.
No worries, just making sure that I'm okay. It's late at night,
Okay.
Keep looking for your ID, okay? I'll be right back. The officer checks some information and identifies the driver as Vanessa Castrejón. He then grabs his jacket because this is going to be a long and cold traffic stop. Hey, Vanessa, did you find your driver's license?
I have my.
You don't have your ID or anything? We're trying to figure out who else.
Okay, look. So you can have this, but
What problem? I'm just asking for your
I live literally right here. So, like, I
Did you have your driver's license at all or anything?
I haven't gotten out of it. And so right now I'm living, so I lived my, oh my God, no. What's that?
I'm just asking
Go to the next bit.
Tell her the car.
No, you're going to stay in here. We're still talking. So again, I'm going to ask you one more time. How much have you had a drink today? I can clearly smell it. I can see your eyes. Or bloodshot. I asked you for identification. You never were able to produce it. You gave me your registration. You pulled out what looked like a business card.
I was at Pennsylvania. She was driving. Neither of you are admitting to losing this. So now I'm asking you that.
I haven't had any chance. Thanks to
I
all.
love that for you. Thank you. This is so crazy because this has never happened to me, and I feel like just because I'm a Latina, it's happening to me.
First thing I notice is the car. I don't notice the people who are driving. It's dark out. It's 1 a.m. It's 1 a.m.
Oh no, the music coming.
I'm Hispanic as well. You noticed it right away as I walked up. Again, you gotta understand. I see a car, 2 people. At 1 a.m, I gotta make sure everything's okay.
Fine.
I walk up here.
Maybe
He clearly says
have
you're drunk as hell.
hallucinations.
Those were his words.
Those were his words.
Hold on,
Back
Vanessa.
up.
Vanessa.
No. I'm so
Then I
sorry.
could-
Those were
I
his
could
words.
I can see it in your eyes.
No, I just want to go to work.
How much have you had to drink today?
Can we work this out?
Can we work this out?
Excuse me?
No, it's just.
What did she say?
You look hot. Like I know. Are you Tori's dad? No. This is really.
I want to just offer it in. She wasted.
Just stay in the car, right, Vanessa?
Okay.
The officers want Vanessa to do field sobriety tests, but the temperature is in the teens, so they don't want to do it outside. They then decide the best bet is to have Vanessa go with them in a squad car to a nearby building. The male passenger isn't in trouble, so the officers allow him to go inside the apartment to feed Vanessa's cat. Meanwhile, the officer and his partner patiently try to coax Vanessa out of the car, but her attitude suddenly changes out of nowhere.
Vanessa, are you willing to perform the exercise? Yes or no? Okay, so then let's go. If you're gonna do the exercises, I need you to step out. I don't want you to do them out here in the cold. I want you to do them somewhere where it's
I
warm.
would never want.
Okay, so let's go to the train station where it's nice and warm.
Yeah,
I'll take you in my squad car.
cool. It's like, do you have kids?
Are we gonna go? Yes or no, Vanessa?
Do you?
I don't want to keep you out here longer than you should be.
Get out of the car, bitch.
So, the faster we get to do this, the faster you can get home. So you're gonna go with me, yes or no?
Yes.
Okay, so let's go.
Wait, what's that?
Just lights.
Done.
She's obviously influenced. She's got white stuff all over her top. Yeah.
I hope you kill me.
I do not hope that at all.
No, I hope you kill me.
Okay. Maybe
I
that's
hope
statement.
you kill me.
She's not going to go. So ultimately, it's whatever you want to end up doing with it.
Because this is my home,
No one's disputing this is your home or not,
and
Vanessa.
you would never do this to a woman. And if you want to do this, you can do this.
Like I told you earlier, I see the car. That's all I saw. It's 1 a.m. at night. I can't see in the car. It's dark.
White in the morning. Oh, white.
1 a.m. Doesn't matter what kind of car
Do
it
you
is.
want to know how much I earn a year?
Who cares?
I honestly
You
don't care.
probably don't care, but
It doesn't affect me, Vanessa. If you earn a lot of money, more than me, good for you. I'm happy for you.
I
The
want
better
you
you
to give
progress.
You're still
I
breaking the
want you
law.
to give up
Yeah.
because I see you around the streets. I see you. I do.
I see you.
Yeah, because my job is.
The next bit. Oh God, it's still going.
Yeah.
I need you to step out the car. I get that. Your friend's feeding him right now. You gave him your house keys. He's taking care of that.
We're going 95, right?
Yeah.
Road 95, right?
Okay.
Yeah, tell me.
All right. So I am going to place you on arrest for being under the influence. So you're clearly driving. I saw you driving. So you are under arrest. So I need you to step out the car, and then I'm going to take you into custody. Okay?
Interesting.
That's it. I'm being honest.
Wow, you
There's clear signs of impairment. I can see it in your eyes and all that. So I just need you to get out, okay? We can discuss this more at the station where it's nice and warm. You're not out here in the cold. Please step out of the car.
The officers finally managed to get Vanessa handcuffed and in the back of the squad car, but not without more drama and serious screaming.
Shoot me right now, because you're
Body
gonna
cam, booby shot.
kill me regardless. Shoot me right now. Shoot me. Kill me. Kill me right now.
Oh crap! I've got that. Eardrum's about to explode.
Once they get to the police station, Vanessa makes her situation even worse by spitting on the officer.
Oh, you dirty, dirty. That's revolting. That's one thing I cannot stand. Oh, you
So
filthy,
that was.
filthy.
You did not need to spit at me.
I did.
I need you to face.
Force me.
Yeah.
Force me. Take me to jail. Take me to jail. Take me right now. Take me to jail. Take me to jail.
Yeah,
Take
copy
me to
elbow to the
jail.
head.
Right
Oops,
now.
sorry.
She spit. She spit. She spit.
So that's going to be an extra charge.
I know.
Yeah.
Take it.
2, because you did kick
Take
me
it.
too.
Thank you. Oh, I kicked you?
Yes,
Oh.
you did on camera.
Take me. I just want you to take me so bad, and you just want to be.
Kicked me in the squad car. Just spit at me in my face.
I just want him to take me.
Say again? She just spit at my face right now and kicked me in the squad car.
Yeah.
So just so you know.
I just want to.
Is that like a form of assault?
Don't spit.
I'm gonna piss myself
Oh.
right now.
All right, Vanessa. In order for me to
Get
get
the
you off the
hazmat suit
handcuffs, I do
Where's
need to do a
Brian?
search. We didn't have a female on shift
I want
right
a
now,
female.
but there isn't.
I don't give a.
So
I want a female.
and I'm going to explain how I'm going to search. The way I search.
I want a female. The last time a female searched me, she searched my hurt.
There isn't a female on
And I'm
shift.
gonna do the out of you. Oh, touch me. Touch me.
Use the back of my hand
Touch me.
to make sure you don't have anything on you. Okay?
Oh.
Fine.
It's the back of my hand.
Touch me. Touch me. I'm going to piss myself right now.
Dirty.
After the search is complete, the officer plans to let Vanessa use the bathroom in one of the holding cells. He's gone for just a few seconds, and in that time, Vanessa started taking off her clothes.
Leave your shirt on, Vanessa.
Oh. No,
I'll let you use the bathroom. Back there.
No. No. Check out these hoochie coochies.
I'm not closing it.
No one's impressed.
Go to the bathroom and come back out. Go to the bathroom and come back out.
before you
Use the bathroom. Use the bathroom. You're gonna best girls. You're gonna be cuffed to the wall.
Oh, me. Cup me too.
Like,
I'm not pissing myself right now.
I don't care if you piss yourself.
And you're gonna clean this right now. Thank you, baby.
Vanessa continues to flip-flop between being extremely angry and extremely vulgar.
I want to give you the respect that you deserve, and that
I
give you that
deserve
privacy.
freaking calm down.
Vanessa, put your shirt on. Vanessa, if you don't do that, I'm going to put you back on handcuffs on the bench, okay? I don't want to do that. I want you to use the bathroom and take care
It's
of that.
so hard. Oh my god, I want to die. I'd rather you kill me right now. What the like, do you condemn Hamas?
What?
Are you Jewish?
Nope.
Good.
Vanessa then spits again in the officer's direction. When the arresting officer reads her a long page of rights and regulations, Vanessa lays on the floor underneath the metal bench. As she's put back into handcuffs, a spit hood is then put over her head.
Lock me up or don't lock me up. Lock her up or don't lock her up. Like, lock me up or don't lock me up.
For 1,000 attorneys. How did they get 1,000 attorneys, you might be wondering? It's a great question. 6 million in PA or less, or 23.
Hi.
The
The reason I'm stopping you, well, I didn't stop you. Why did you stop? Let me ask you that.
Because I've been doing this a lot. Play drama.
Okay.
I'm sorry.
Okay. So where are you coming from right now?
She's coming from Thatcher's.
From Thatcher's? Yeah. Okay. Gotcha. All right. So you came straight from Thatcher's?
Yeah.
Okay.
Sharon, you're on my channel, so you'll see who's in my chat, and you will see what I bring up on screen. Whoever's in AJ's chat, so, but I can see both sides, so that's why you're probably not seeing everyone's chat. Yeah, maybe refresh your page and go to the right-hand side where it says the chat, and now right up the top, it says top chat or live chat. Click on live, and then you'll be right up to date with us.
Where do you live?
In Malville.
Where?
And I am checking Court TV. It's not on
Where?
yet.
What street? What street? What's your address?
4 Willard Lane.
What's that? 4 Willard. Okay, and where are you headed to right now? Okay. So from Thatcher's to 4 Willard Lane, you were over here on Fowler and then on Canals?
Yes. Okay. It's where my best friend lives. On Fowler.
Okay.
18 hours.
Gotcha. Okay. All right. Well, the reason you caught my attention when I pulled up behind you is because when you came out of there, you swerved completely all over the road. How much have you had to drink tonight?
Nothing.
Nothing at all? No?
I'm sorry.
You had no drinks at Thatcher's? No?
I'm not
Okay. You got your license registration insurance?
Yeah.
And I don't need that whole packet. Just pull out the cards for me.
Can't you just take it? And
All right, step out of the car.
yeah.
Step out of the car.
Why?
Because I'm going to do some field sobriety tests on you and see how much you've actually had to drink tonight. You know the English alphabet? You know your alphabet? I know, silly question. You know the alphabet? Okay. Can you say the alphabet from the letter E to the letter P for me without singing it? E through P.
E through P. I can do it. Oh, all right.
H-I-J-K.
Perfect.
Sorry, folks.
Thanks, sir.
Court is back in session. No audio yet. Here we go.
State ready? Yes, sir. Fed's ready. All right, I hear you.
Your Honor, just now, the defense received exculpatory evidence from one of the minors, BG's, whose phone had been turned over to law enforcement, and law enforcement downloaded contents of his phone. However, these text messages were not provided to us until BG himself provided them to us earlier today. This was a phone that was taken into custody by Zach Cotton on March 19th. If you look at the state's base numbered document 283 is actually his arrest, the search warrant for that phone. Now, while
while they did provide us text messages from the day of March 19th, they did not provide us any of the other text messages. BG found these text messages on his phone and texted them to myself earlier today. I printed them out on the lunch break, and according to both the United States Supreme Court case law, Brady v. Maryland, Mississippi, King v. State, and also Arizona v. Virginia, which is a U.S. Supreme Court state, the failure of law enforcement to disclose exculpatory evidence is imputed to the state, and such disclosure mandates either a continuance until the defense has had time to review this documentation or dismissal of the charges themselves with the failure to provide exculpatory evidence in discovery.
Mark.
Yes, Your Honor, I would like to mark on Friday.
All right, I'll be marked Friday purposes only.
So we look at it. Yep, got the copy right here.
I mean, I have a response in general without looking at them.
Hang on. Take a look at them. What were they marked? 23 ID on them.
Your Honor. The date is on the top text message. The one in general that we believe goes to the exculpatory evidence is on this page. So it would be this page. BG is in blue, Carly is the black.
Versus do it back. Is that the first text message?
Yes.
All right. So the defendant says do it back.
My schnoz. I'll be back in a second.
Germany says, I don't know what that is. What's going on? She responds, I don't know. I called Anthony because I wanted to talk to him. And then I saw him and I couldn't breathe. And I couldn't say anything because I didn't know what to say. And I can't remember anything that happened today. I zoned out for most of it and I don't know what's wrong with me. That's showing as the exculpatory part.
Yes, Your Honor. And that this text thread is dated as of November 22nd of 2023.
All right. Anything further from the defendant? By way of motion.
No, Your Honor, just that the U.S. Supreme Court and also the Mississippi State Supreme Court is clear about the failure of the fact that it was in the possession of law enforcement. Law enforcement downloaded the contents of this phone, had it by search warrant and failed to produce it. And the failure, and according to the U.S. Supreme Court and Arizona v. Youngblood, the failure of law enforcement is imputed to the failure of the state for discovery purposes.
Okay. Response by the state, or do you need a few moments?
I'm fair, Your Honor. First of all, I don't believe that the text message.
Let's step up to that podium.
I may have to go upstairs at some point and get a signed piece of paper from Ms. Todd, but I think that I have it here. First, let me address the fact that this is not, in fact, exculpatory material. This is a text message between Bennett, Germany, and the defendant from back in November. Bennett, Germany took the stand. He could have provided this at any point. He actually, in fact, spoke to the defense attorneys previously. This is not new information that they had. It's not exculpatory information. However, in order for it to be a Brady violation, the state would, in fact, not have had to produce the material that they had. On June the 4th, 2024, the state of Mississippi provided to the defense attorneys one jump drive containing digital evidence media files, witness interviews of minor friends, the indictment, discovery bait stamps 1 through 349, supplemental discovery bait stamps 350, 351, third Snapchat report 352, 356, 2 CDs labeled Heath Smiley hospital interview and Deputy Allison Dufour body cam, and 1 hard drive containing phone dumps. Your Honor, they were in fact provided the phone extraction from Bennett, Germany's phone. It is not the state's fault that they did not review those messages. Everything that was on Bennett's phone that was taken from law enforcement was produced to the defense attorney on June the 4th, 2024. Since there had been issues with the state of Mississippi and the defense attorneys claiming that they had not in fact received items, the state went ahead and had them sign something stating that they had received discovery, and also the entire jump drive, now not the external hard drive, but the jump drive that was provided that had the media and electronic data on it, was screenshotted. Ms. Todd signed off on April the 20th, 2024 that she had received all those items, including through bait stamps number 798. When Mr. Camp reached out to me the day before the defense attorneys had provided their expert discovery, I believe it's by email, I can go back and look, Your Honor, I believe responding to him around 5 o'clock, he said something to the effect of, where are the text messages between the kids? And my response was, well, there's two places. There's screenshots that you guys were provided, and then there's messages within the actual phone extractions. Your Honor, they had this material. They knew this material existed. And for them to try to claim now that they were not provided that information is disingenuous. And again, this witness took the stand. If they knew this, if he knew this, if they had this information, they met with him previously, why on earth would they be producing it now? We do not believe this is exculpatory. This is something that happened back in November. We're here because the state has charged Carly Gregg with murdering her mother on March the 19th, 2024. We are here because the state has charged Carly Gregg with attempting to murder her stepfather, Heath Smiley, on March the 19th, 2024. And we are here because the state has charged Carly Gregg with tampering with physical evidence for removing the surveillance footage that captured a portion of the incident and hid it in the refrigerator. There is nothing about this text message that would indicate that it is anything other than messages between the defendant and one of her friends who on the stand said he was her best friend. This has not been authenticated. I don't know, Your Honor, without going and putting the phone extraction into my computer, whether or not this message is actually there. But if it is, they've had it since June.
In a second.
Yes.
I'm going to give you a chance to reply.
Mm.
All right. What documentation do you have to prove that you turned this over to the defense? I believe you said there was a jump drive that contained the phone extract, and I'm familiar with phone extractions, that there's no way to extract part of a phone on Celebrite.
That's right, Your Honor.
Okay. So did you...
Doing a Brady motion, I think. The defense is trying to get in some kind of text message they're claiming is exculpatory, and they've only just had it. And the state's saying that, no, the phone extraction was done back in June or something, and they have had it, and they've got proof that they've got it or some. No, the state didn't withhold it. The defense is only claiming that they just got it, and they're full of shit.
You show me what you got to prove that you turned over a jump drive.
Of course,
And if you need a few minutes to go grab your paperwork, you
I
go.
do not, Judge.
Show it to counsel opposite.
We've had this issue come up previously, so now we have the defense attorney sign saying they picked up material.
All right. Do you have a copy of that we can mark for identification?
This is the only one I have, Your Honor. I can rip it out of the file and make a copy if necessary.
Mm-hmm. The state has said we've been through this before, so every time they've turned over evidence, she's made them sign for it. And that's what she's showing him.
All right. You showed it to counsel opposite, correct? All right. Mark it for identification purposes for the state.
Your Honor, for the record, that bears Ms. Todd's signature and date.
Okay. Let's mark it so I can see it. All right, and what you're saying is this jump drive contained digital discovery. Is that correct?
Your Honor, there was a jump drive that the defense brought to our office. That jump drive contains the digital discovery, the physical file, the PDFs, the 2 CDs that we had in our file, as well as we had an external hard drive that had these phone extractions on them. They were put onto the jump drive that Ms. Todd picked up on June the 4th, 2024, as indicated by a hard drive containing phone dumps. Your Honor, there are multiple emails between myself and Ms. Todd that if I need to, I can run upstairs and print off, where I've said, let me know if you can't open a file. Let me know if you don't have something. I said, in fact, hey, I screenshotted 800 pages and scanned it in. Let me know if a single file doesn't open. Mr. Camp and Ms. Todd were attached to all those messages. At no point did they ever say, hey, we don't have Bennett's phone extraction. Again, just because they don't know how to access something, they didn't ask our office for something, or they didn't take the time to review that material, Judge, does not put that burden on the state.
Is there anything else the state wants to move in for the court to look at?
I'd like an opportunity to go upstairs and print all those emails I've talked about, if that would assist the court in any way.
Can you do it within 10 minutes?
I believe so.
All right, we'll be in recess 10 minutes.
Uh,
I'm going to give you a chance to reply, but I want to see her. It's going to go motion, response, reply, I rule, we're done. Nope, not till I see her documents. I won't complete the state's response. That way you can have a reply. We're not going to have a reply, response, reply. It's going to be motion, response, reply, I rule, and the rest of it's up to the appellate courts. All right, y'all got 10 minutes.
Your Honor, I believe that I could probably just make a copy of all of this, and that would entail my emails back and forth with Ms. Todd regarding discovery. I kept them because I assumed that there at some point would be some sort of argument that we hadn't produced something. But I do not have a copy of this. This is just the one copy I kept for my file.
Well, I saw Mr. McDivitt stand up back there. He can make himself useful and cut down on the jury's time. I think everybody in the courtroom knows I don't have a problem abusing lawyers and their staff. So give him the email, the email. Mr. McDivitt, you go copy it.
I think that should be everything. I'm gonna make sure that's all of it.
And please bear in mind, I got a jury waiting.
mm-hmm. Goddamn defense again.
The problem is there's a bunch of staples in it, but I don't know what I got. But I'll keep them. Thank you, sir.
All right. Ms. Gugliano, still don't discuss your testimony with anybody. Well, let me ask this. While he's making copies, would there be some objection to us going on ahead and hearing her testimony? I mean, you're asking me to dismiss the charges, basically, Ms. Todd, correct?
Yeah.
Okay. Well, if I don't decide to dismiss the charges, we're going to hear Ms. Gugliano's testimony anyway. So rather than wasting the jury's time, I'm going to bring the jury in, let you cross-examine her, let them redirect, and then I can take another break, and maybe copies will be done by then. I'll hear objections to that procedure by the state.
No objection.
Objections to that procedure by the defense.
Yeah.
All right, let's bring in the jury.
Bring the jury.
Have a seat. Everybody take a deep breath.
Sharon, you must be way back at the start of the of this stream. We're at the 3 hour and 52-minute mark. And that lady that was crying was right at the start. I think she was one of the first 2 witnesses, the second witness. You might want to skip ahead, love.
All right, ladies and gentlemen, as I said, every day after lunch hour, things get slow, people get a little tired. If you get tired at any point in time, just stand up, okay? Stand up, try to shake off the afternoon sleepies. All right. Dr. Gugliano, do you understand you're still under oath and your answers are still sworn answers?
Yes, Your Honor.
Did you discuss your testimony with anyone during the break?
No, I
All right, you may proceed. Cross-examination.
Good afternoon, Dr. G.
Good afternoon.
If you recall during your direct examination, Ms. Newman asked you about information you received from me. Is it correct in my understanding that you called me?
Yes.
Okay. And I provided information upon your request?
Yes, you did.
Okay. And during an evaluation, when you're evaluating a minor or any person, who's in control of that evaluation?
I am.
And if you felt for any reason that your evaluation was being hindered, either by something with the location or anything else, what would you do?
I would try to take steps if I could to correct it.
And Dr. G, you mentioned on direct examination with Ms. Newman that there was an occasion in which I interjected or interrupted during your evaluation of Carly.
Yes.
And was that because there was a time or two in which I was aware that Carly was trying to answer a question for you that she didn't know the answer to?
There were a few times where you interjected to tell Carly not to answer if she didn't know, or to just say she did not know. And then there were times that you interjected to prompt Carly.
Yeah, to make sure you had all the information, correct?
I can't say what your intentions were. I'm just saying you prompted her by giving her, a word or something like that, or mentioning, remember this.
Okay. And Dr. G, you were originally there to do an evaluation on Carly's competency to stand trial and to determine whether or not she was competent at the time of the incident on March 19th. Is that correct?
Yes, her competence at the time to stand trial and her sanity at the time of the alleged offenses.
Okay. And can you, explain, but in the course of your evaluation, you ended up just evaluating whether or not Carly was competent to stand trial, correct?
That's correct.
And that's very different than whether or not she was actually competent at the time of the incident, correct?
Yes.
Okay. And you have testified for this court once before at a competency hearing. Do you recall that?
In this specific case? Or?
Yes, in this case. Yes. And do you recall your testimony in that case that you informed the court that you stopped your evaluation because you became aware that medication might be an issue in Carly's competency at the time on March 19th, and you felt like there was someone else who could evaluate that?
Yes, it was my opinion that it appeared we had started talking, as I mentioned before, about what was going on with Miss Gregg in the month leading up to the alleged offenses, and she mentioned her psychiatric medications and how she stopped one medication and started another a week before the alleged offenses, and that she had some reactions to those medications. So I recommended that a psychiatrist, a forensic psychiatrist, do the evaluation because I could not address whether any side effects or withdrawal symptoms may have been present due to medication, since that's not a specialty area of mine.
Thank you. I tender the witness, Your Honor.
Dr. Giuliano, in fact, you did try to question Ms. Gregg about whether or not she abused prescription medication, didn't you?
I did.
And she refused to provide an answer.
She declined to answer the question.
And are you able to go forward with any evaluation about medication when somebody fails to provide you information about it? Their abuse of medication.
If their abuse, no. No, if you're asking specifically about abuse, no, but there are other questions that I would have asked later in the interview about medications if I was evaluating her sanity.
And I believe you shared earlier that you did in fact render an opinion regarding her competency and her ability to recall facts, and that was that she is competent. Is that correct?
Yes, it was my opinion that she was competent to recall facts in relation to being competent to stand trial. I'm not saying how much she may or may not be able to recall of the alleged offenses.
No further questions, Your Honor.
May this witness be finally excused by the state?
Yes, sir.
By the defense?
Yes, Your Honor.
All right, y'all approach. You can stand in.
Thank you.
All right. Do we have one more witness or? Can't even L because we're up to date. Hopefully we can get through this Brady motion really, really quickly and go straight into closings. That would be good. That would be really good.
Apologize. This is my fault. Okay. We
Mm.
have some things that we have to take up
Like how the
outside your
judge
presence.
takes the blame
Go
every
ahead-
time.
Go ahead. Step back to the jury room for just hopefully a few minutes. When I say a few, 20, maybe 30, and I apologize. This is my fault. Okay. So I know it's in and out, but nonetheless, just take a breather. Give us about 30 minutes. All right. Everyone remain seated while the jury exits.
No, we're live. Live. So it's 1 o'clock
Take about a 10-minute recess, and hopefully the emails will be back
in the afternoon in Mississippi. Is that right?
All right.
We're 3 hours.
We'll be in recess till
We're an hour behind Eastern Standard Time. Yeah, he said they're going to take a 10-minute recess and they'll be back at 1:05. So it must be like 5 to 1 there. So they're an hour behind Eastern Standard Time. So if it's 1 o'clock there, I'm not sure if we still have one more witness, but then we've still got closings and then jury instructions. So we may get to verdict watch by the end of the day, but what's that? 2, 3, 4, 5. Yeah, we might, but only just maybe. Hmm. Not quite sure what to do. We were hoping that by early afternoon the witnesses would have been gone through and we'd be out closing arguments and ready to go into verdict watch, because I had some things teed up for early afternoon. But and that's where Gabby was going to take over.
Yeah, that's true.
It's just it's 4 a.m. and I don't think I can make it till they're 5 o'clock in the afternoon. Does that make sense?
Yeah. Hold on.
Are you able to get hold of AJ at all, or? see what she wants to do. Yeah, the problem is though, if I go to bed, I have to cancel the stream. Which would mean AJ'd have to start another one up, and then you'd have to catch up with closings and then verdict watch. Or you could skip jury instruction. That's a bonus. But I'm not sure what to do. Yes, it is. I know, but I hate cutting out in the middle of something. It's not fair on you guys. We had it all sorted. It was like, right, this is going to happen, and as soon as early afternoon, Gabby will take over. She'll fit in the middle bit where we're just watching the jury, and know that the stream doesn't have to be run. There's no chopping and changing, screen sharing, and all the hard work. You can go to Baker. That's true. That's true. But I can't redirect. I'm running the stream, and because I'm not quite monetized yet, I can't redirect the stream. Only AJ can do that. So, but I have just made her an admin on my channel. Well, not just. I made it a few hours ago, and she hasn't seen my email yet. So, they've been to lunch. Miss Gabby, you don't know how to start up another stream, do you?
She told me a quick thing on how to do it, but
no,
my husband
hard.
is still here, and I'm trying to be here and somewhere else too, right
Yeah,
at this second.
that's all right.
So
I'll
I
hang around.
figured once they got to jury watch, my husband would be gone at work. You know what I mean? So I would be able to be right at my computer.
Yeah, yep. Nothing's fallen into place, has it?
No, I know.
We'll wait and see how this Brady goes, and we'll go from there. I'll do what I can do. Alrighty? We shall play it back, yeah. And hopefully the closings are really, really quick.
I know.
Because I can't even send them over to Baker. Oh, I've still got that
No,
up, sorry.
yeah.
No. Is he on afternoon shift, is he, Gabby?
Blame Gabby's
Your
husband.
hubby?
No, my husband's a tattoo artist, so he doesn't usually go in until he usually will leave around 1, but I found out this morning that his tattoo doesn't start till 6. So he's not going to be going in until maybe like a couple hours from now.
Yeah.
Oh, Grandma's here.
Yay. And look, she's got a wrench. Oh, sorry. I haven't had a chance to check my Discord. Sorry. I'm doing too many things at once, Grandma. We're just trying to work out.
Can't you just leave this up and I can just do it from here?
Yeah, I can. But aren't you supposed to be spending time with your hubby?
No, it's not spending time with him. I was doing stuff around the house.
What is it? 2:00 in the afternoon?
Yeah.
that's 3 hours.
Yeah. I know what you're saying.
Yeah.
I'm the one who's not making any sense.
No. I just don't want you to
Oh, that's cool, Teresa.
is my daughter-in-law is cool. Well, this is only a 10-minute break, so we'll get through this and then we'll make a decision if they've got another witness.
Okay.
We'll see
Yeah,
who that is.
so
We'll just play it
let's
by
get
ear for
through
now.
let's
Yeah.
get through that, and then
Yep.
I'll come back and let you know if my husband's gone. And if he's gone, you can just leave this up and I'll just take over. I'll take over from there.
Well, Grandma's also got the link, and I've made her a mod as well. So if she wants to pop on later, and you two can entertain for a little bit. But yeah, 3 hours is just way too long to wait. Yeah. I can't do it. Yes, it is. It is an absolute skill for sure, especially
Yeah.
when you'd start designing them and coloring them in, and yeah, it's
Well,
very, very talented.
my husband graduated with a bachelor's degree in fine arts painting, and
Oh,
then he, went into doing tattoos.
oh, really?
Yeah.
Cool.
Yes, I call him the walking encyclopedia because he's really smart.
So that's what he does now, tattoos. I thought
Yeah,
he was
he does
designing
tattoos.
t-shirts.
Yeah, he does it all.
Cool.
He does it all.
So that's right. You've got the giraffe tattoo, haven't you?
Yeah.
Did he do?
Yeah, he did my giraffe tattoo.
Ooh. Aw. When's your stream, Grandma? Is that at 5, isn't it?
Yeah, the extreme Wordle starts at 5.
Yeah.
And then
5 o'clock. You've got a mod for that too, don't you?
Yeah. And then at 9 p.m. tonight, Grandma goes back on and does TV guide trivia. And I mod for that.
Mm-hmm. Yeah. No. I can't do it to you, Gabby. I'm sorry. All right. Well, even if, how long does the trivia normally go for? A bit over an hour at 5 o'clock? Because I was hoping that we would be up to verdict watch before Grandma went on and she could come on and do some trivia and some games with us. But while we're waiting. And she's more than happy to do that. She's keen as, which is great. Just for something different,
Yeah.
I didn't get a chance to look into the bingo. I slept until about 3 o'clock this afternoon. But I didn't get to sleep until 6 a.m. It was light outside.
Yeah. Also, if you want to go, Jody, I can just set up I can call AJ on the phone and she can walk me through how to make a stream on her channel. And then we can just start a whole other stream.
Oh. You're an admin on my channel.
Yeah.
So
that's what I mean. You can just leave this up and I can just switch over.
We switch streams and you share the screen. I can lay down and be on my phone and talk like I did yesterday.
Yeah.
And still be involved.
Wanted to do that.
That would just mean that you bring up the comments, that's all.
Yeah. So what did they say they're on? How long is this break? Like 20 minutes?
Said 10 minutes, 5 past 1. They were supposed to come back, so they're due now.
Okay.
We'll play it by ear. It'll work. It'll work out in the end. Look, I don't think I've got anything. What's tomorrow, Friday? No, today's Friday, isn't it? Oh, Grandma, hello.
Grandma.
Hey, you just woke up. I'm listening to you now.
Says, Gabby doesn't need to be here. Be there. We'll miss her if she's too tired.
We'll live, maybe.
Yeah, maybe I would
She loves it
probably.
there, Grandma.
Maybe I would probably miss Extreme Wordle, because that starts at 5.
Oh my God, I've just updated to 18 on my phone and everything's different. It's like, what the? What was I looking for? I got on my phone to do what? Oh, to see if I had anything on today. That's right. If I can sleep all day, and yeah, look, now I've got nothing on. Nada. I put the washing on before the stream. House is clean. Cats are fed. I've got my lava lamp. Might need to make another coffee though. Look, we'll manage. We're soldier on. We are women. And I've got my strawberries. I could do some ASMR. No takers. No.
I'm sorry. Hold on, I'll be right back.
All right. Let's see what. The second I switch over is the second the court will come back on. You watch. Let me see what else I can find. Let me see what Baker's up to. Let's go and spy. I spy my little eye. Something beginning with Baker. Broken Baker. He's a funny one, that one. He cracks me up. Something horrid. Oh, there he is. Let's share that screen.
If you have a sad
Hello,
smiley, and I
Baker.
know this from being in bakeries, not that we ever had that, but before you get that, you will get a notice that this needs to be fixed. And
So you don't
if you
need to
don't
go
fix it,
there.
you'll
Bring him
get
here.
tack on massive fines. I had a buddy who worked as a representative for a big chain of bakeries, and that was one of the things he spent a lot of time trying to fight against, because they'll just fine you 10,000 Danish. That's like 2,000 if you don't fix the thing within X amount of days. And some of it could be that you just needed that much more tile on the wall. And if you come back like the next visit, and there's not like you have like 3 months to fix it, it could be the next week, then you maybe get fined $3,000, $4,000. So it's different.
Do you know if we have another rebuttal?
Couldn't you just have a aroma diffuser?
Witness still.
Yeah, that's but luckily she got paid for damages.
No, we have another rebuttal witness still to come.
Carrie Morrissey is the prosecutor in the Ross trial. Oh, that one. Yeah, I didn't watch the trial, so I don't know the names of them. Just who? What?
After the Brady.
Well, McDonald's don't care, but McDonald's aren't the one who runs the business. I don't know. Isn't it franchisees? Franchisee. The guys who owns the franchise. That's the little local guy. That's the thing, because we have a lot of our extreme left wing commies are always saying McDonald's don't pay no taxes in Denmark. No, but every franchise taker in Denmark pays, because they have 1 or 2 restaurants. They pay taxes on that part. Maybe McDonald's does some creative marketing, bookkeeping to keep the cost low. But McDonald's do pay taxes, but it's just not the main company, because it's not the main company that runs any of the restaurants. It's the franchisee, maybe.
Smiley face.
Have you ever given us a tour of your background? It's my super chat boards, my Knoxville Avenue, my... Oh, it's really hard when it's the other way around. My Elvis sign and my broken baker's sign with 100% suasion. I got from Panilla. That's my background. And some Legos. $100-mile coffee, because once you got it, you had to drive 100 miles before you could drink it. I actually, I like... do you have that McCafe kind of thing they put into fight against Starbucks? I like their cafe latte a lot, and it's very cheap compared to buying it at another coffee place, and I think it's good.
There
Do you
we
know
go.
if we have another rebuttal witness still to come by any chance after the Brady, trying to estimate when verdict was made commerce? Rumor has it one more. Closing arguments will probably be at least an hour each.
Yep.
I'm not sure that the verdict watch will commence today.
There you go.
Wish I had working jurors.
There
I'm
you
very worried
go.
about the jury system in the country right now. After Can Read, I'm deeply concerned. Well, at least I'm still a volunteer, even though I just sign up for 4 years at a time.
Much appreciated.
And that means, and I talked to what's his name, Judge Fleischer, about this on the
so
stream I was
funny.
on with him.
Well, that's what we could
But
stream.
as he said, well, who's going to pay? Because I get $100 every day I'm in trial.
Yeah,
But that's taxpayer money that's coming out of somewhere
Baker,
else.
he's in the middle of jury duty as well. So he's getting up, doing jury duty, and then coming home and doing this, and like having 2 hours sleep in between, and then doing another stream and having another 2 hours sleep. So I shouldn't be complaining. There we go. Let's send him a message. Much appreciated. Thank you.
So thought McCafe was placed only in alternative lifestyle communities. Who says I don't live in an alternative lifestyle community?
You never know. He
5
could be
ice
a
cubes in
nudist
your hot
behind
coffee.
closed doors.
I never used to drink because when it's that black coffee, it tasted so burned, so I didn't like it.
It's still not back. I'm checking.
In Canada, Tim Hortons is the go-to coffee chain started by Canadian ice hockey player Tim Horton.
I'm keeping my eyes open.
I have heard about this chain in How I Met Your Mother. I've never been, but it's good. But never trust anything I say.
We just got Baker thumbs up. There we go.
Yeah, I like that. I don't. The first time I started or tried it was they had them in Switzerland when I was down there. And
did you hear that, Gabby?
I think they have a really good cafe latte. I don't like Starbucks. I think it tastes the beans always taste, or the coffee always tastes like they burned the beans. So I don't like that. No. My neighbor's daughter is 7 years old.
So doesn't look like we're going to get to verdict watch.
It's
So
probably not the
all
confident.
plans out window.
Do you think Carly taking the stand would hurt or help her case? She can't take the stand. Either way she did the crime, it's either premeditated or insanity. One, she can't take the stand. She has waived the right to take the stand because the defense rested yesterday. They should have brought her on yesterday if she wanted to take the stand. All of this comes down to what was her mindset when she did this. They have to convince the jury she was insane.
Yep.
And I don't see that happening, but I'm 100% wrong 65% of the time. And the feed is really wonky right now. I live in an area with, in my county, we are 50,000 people. We have one McDonald's and one Subway clone. That's the only chain restaurants we have in all of my county. Then we have like burger joints and stuff like that, but nothing. We used to have a Burger King that closed yet. Oh, come on, don't go away. I have to put this up again. Are we gonna go through it again?
I'm still having StreamYard issues. Poor bugger.
No, but fast food chains, mostly major cities are close to the highway.
Oh, I asked Baker if he knew if there was going to be another rebuttal witness after this Brady hearing, and he believes there is one more to go, and then he thinks that closings will be an hour each, and then we've got jury instructions. So he doesn't believe that verdict watch will commence today. So, and if it's true, he's sequestering them. It doesn't make sense to not give the jury. Oh, is that what's happening? Judge told them yesterday once they start delivering, they will go until they reach a verdict, and to make arrangements for today and tomorrow. So I'm not sure if he'll keep them or let them go this evening. It depends if they've finished their closings and the jury instructions, I suppose, won't it? And they're still not back from their 10-minute, half an hour break. No, we'll watch Baker until.
No, it tastes burned.
They come back. I'll put us back.
He said 20, 15 minutes. So.
Okay. How come he's got the feed? What the actual? Who's he on?
They're coming back right now in the courtroom.
I'm on court TV and I've got nothing.
Oh, really? I have Carly sitting down right
really?
now. Yeah.
Let me refresh. Oh, you son of a. Okay. Share this tab instead.
Mark them all as a deposit next to them.
Boosted. Oops.
For the record, while we were out, the state went upstairs and grabbed a copy of our external hard drive that had the phone extractions on them. We opened that extraction. It was dated April the 30th. It included Bennett Germany's cell phone. We found the messages that Miss Todd showed the court are in fact on that external hard drive found within the phone extraction that was turned over to them on June the 4th. Ms. Todd is currently in the process. She initially told me she did not have Cellbrite on that file. I showed her on her jump drive where she had it, and she's currently in the process of opening up Bennett Germany's cell phone extraction that was produced on June the 4th.
Your Honor, I have it open right now if I can respond.
Hold on, time out. Where's the stuff you wanted to mark for ID? Is there any further response from the state?
Well, Your Honor, the fact that the witness took the stand already.
Okay. So let's finish up the response.
Yeah, Your Honor.
Again, motion, response, reply, I wrote. Okay?
Yes, sir. Your Honor, they were provided the information. This witness has taken the stand already. He could have been asked anything that they wanted to about these text messages. Their motion was that it was exculpatory and that it wasn't turned over. In fact, it was turned over. Your Honor, that I don't know any other way to say that they have it.
Okay. All right, you can be seated. Reply by the defense.
Yes, Your Honor. If you will recall at our hearing on June 4th of 2023, which I have a transcript of, at that day, this court told the defense the state to provide all discovery to the state by 5 o'clock that day. The court then asked me if I, in fact, on page 66 of that transcript, the court says, Ms. Todd, do you have an external hard drive you can turn over to the state? And I said, yes, Your Honor, I do. And it said, you owe that to them by 4 o'clock today. And at that point, Your Honor, I did provide an external hard drive to the state before 4 p.m. that day. The state, I think Catherine was just a little mistaken when she said the state gave me these files in digital on the thumb drive. They weren't on the thumb drive. They were on a hard drive, and on the hard drive, it contained specific screenshots from March 19th with Bennett. And then in a different section of it, it contained like a summary on the external hard drive of it looks like this of text messages. They're not in chronological order. There doesn't really even seem to be a date order, but I did type in one of the words from Bennett.
They don't have to organize it for you, love. They have to turn it over. It's your job to sort that shit out.
Text message that I gave you on March 28th, which was zoned out, and it's not pulling anything up.
Do you know how to use the Cellbrite extraction? Do you know how to use the Cellbrite tool, Ms. Todd?
Yes, Your Honor.
So you looked for it in the reader.
Yes, in fact, it even says here, select.
Is that not
word.
true?
And when Ms. Newman typed it in on her computer, she typed in zone and it pulled up that particular text message, but it's not pulling it up on this one.
They're just too lazy and don't want to do the job.
Sure.
You're not happy either. As long as the state has turned it over, they don't have to organize it for them, do they? Because they can just dump boxes of exculpatory evidence on them and just go, there you go, it's in there, find it. Yeah.
Did you find it, Ms. Todd?
Mm-hmm. Yeah.
Yes, Your Honor, I did provide it.
Because
So you
she's
did, in
used
fact,
to.
receive it.
Yes, Your Honor.
Yeah.
All right.
Mm-hmm.
Ms. Todd will say this. When you accuse a prosecutor of a Brady violation, if she had in fact committed a Brady violation, it should be terminated. That's a very serious allegation.
Yes.
Now, as far as Brady versus Maryland, this is the court's ruling. First, the court finds that the defendant did receive it. As such, there is no Brady violation. Second of all, the first prong is that the state possessed evidence favorable to the defendant, including impeachment evidence. In fact, what I've read in this does contain impeachment evidence, but it impeaches Mr. Bennett Germany and your client. This talks about drug usage back to November of 2023, when her testimony is she didn't begin using drugs in any form till January. Second, that the defendant does not possess the evidence, nor could she obtain it with any reasonable diligence. As this court, in fact, the defendant did have it. And obtaining it with any reasonable diligence, as I recall, Mr. Bennett Germany testified that he was her best friend and that he got on a bike and rode several miles to come see her on the day she said she needed help. I think Mr. Bennett Germany has been more than available to Mr. Gregg.
Yep.
Third prong is that the prosecution suppressed the favorable evidence. In fact, they turned it over. And finally, that had the evidence been disclosed to the defense, a reasonable probability exists that the outcome of the proceedings would have been different.
Get off your phone, Orange Tie. You're in
This
trouble
reads
too.
more like she has some crush on some boy named Anthony, and there's a talk of a whole bunch of use of taking
I wouldn't
drugs
be smiling, lady.
and sleeping pills. I don't see where that would create a reasonable probability of a different outcome.
You gonna get
Finally, the
stand
court notes
hard.
the state has no duty to search out and discover all possible exculpatory evidence. For those reasons, the motion to
It's
dismiss the
dismissed.
case for a Brady violation.
Now, is he going to put any?
All right.
Is he going to sanction now? Come on.
I'll get these back to the court reporter.
Sanctions. Put her over your knee, Judge.
All right. Anything further from the state before we bring in the jury?
No, sir.
From the defense?
No, Your Honor.
All right.
Yeah, they wouldn't want to. So they wanted to bring in messages. The Brady violation was over messages that actually impeached the defendant. They clever.
State, get us next witness on the front row, please.
So I believe this is the last rebuttal witness. Oh, look, I'm sorry, but he's got every right. They have done nothing but one balls up after another, and to accuse the state of a Brady violation when they just too stupid to find it because they didn't look for it. It's, you know, the one thing where you move. There's the milk. It's in the fridge. No, it's not. Yes, it's behind the sauce bottle. Move something. Continually throughout this trial, and I'm surprised he hasn't sanctioned him, to be honest. Oh, hello. Yes. Yep. And, you know, he's going to have to deal with this crap day in, day out, every day. He would much prefer to have his courtroom run smoothly, I'm sure, and not waste everybody's time. Especially at $25 a day. And for BS.
All right. Thank y'all for bearing with me. I apologize. That was my fault. But I think we're ready to proceed now. Okay. State may call its next witness.
He's going to be biased against one or the other. And poor bugger has to take it on his own chin. So that would piss me off even more.
Adjust yourself up the microphone so I speak directly into it. Make sure you speak loud enough that lady on the back row can hear you. Okay? Yes, sir. You understand your down to earth, your answers, your sworn answers under penalty of perjury.
I do, Your Honor.
All right, you may proceed.
Dr. Pickett, if you would introduce yourself, please.
Hey, my name is Jason Pickett, Pickett. I am
He's
a
testified already, hasn't
board
he?
certified psychiatrist.
Is
I
he?
am a board certified emergency physician and a board certified forensic psychiatrist.
So I want to break that down one at a time. Tell us about, you are a board certified psychiatrist.
We have now the fourth rebuttal witness that's going to tell us how much BS the previous psych yesterday told us.
That means I did a residency in psychiatry. I did it at the University of Virginia. And I treat patients with mental illness, anxiety, depression, OCD, PTSD. I work at the North Mississippi State Hospital where I see patients who've been committed to the state hospital. Most of my patients have a serious mental illness, which is typically schizophrenia,
I think they're being
bipolar
overly
disorder,
cautious.
schizoaffective disorder, things like that.
As a emergency medicine physician, can you describe for us what that is?
Yes.
Because remember, that guy prattled on for over 2 hours yesterday. So they have to leave this in the minds of the jury to override exactly what he said. So repetition, if they hear it 4 times, they're going to remember that more than what he said once. Yeah?
As an emergency physician, I work in the
Hello,
emergency
people.
department and I treat emergencies. So stroke, heart attack, car wrecks, psychosis, acute, altered mental state. Patients are brought in by police, paramedics, family, so whatever can walk in the front door.
And we heard from Dr. Gugliano earlier about what a forensic psychologist does, but what is it that a forensic psychiatrist does?
So a forensic psychiatrist, we do a lot of the things that a forensic psychologist does, but we also have the expert experience from residency dealing with and prescribing medications. So we're better qualified to consider medications and how they may benefit or harm somebody related to, in a forensic realm, it's related to maybe a crime or competency to stand trial, sanity at the time of their mental state at the time of the offense and such. So.
I want to talk about, kind of back up before you got your certification and talk about if you could give us the benefit of your educational history.
Yes, so I went to Mississippi College and have a bachelor's from there, a master's degree from there. Then I went to the University of Mississippi Medical Center for medical school. Then I stayed at the University of Mississippi Medical Center where I did a 3-year emergency medicine residency, completed that, and immediately after finishing that, I went to Virginia and started a second residency in psychiatry. Completed that, worked as an emergency physician throughout that training, periodically here and there as much as I could. And then I did a 1-year fellowship after completing the psychiatry residency in forensic psychiatry where I stayed in Virginia. And that included 2 days a week, I would go to the state hospital in Virginia where I would see patients pertaining to competency and sanity. And then 2 days I was at the ILPPP, it's the Institute of Law, Psychiatry, and Public Policy, where there's a lot of forensic psychologists and we work on forensic cases together. And then 1 day a week, I would go down to the women's prison and see patients there as typically a general psychiatrist, but it's in a correctional setting. So.
And when you're doing this fellowship, you're actually already licensed to practice medicine.
Yeah. To some degree, I have my MD. You get that when you graduate medical school. So I had that throughout my ER residency and my psychiatry residency and my forensic fellowship. And I was moonlighting as an ER doctor while I'm doing the second residency and fellowship just to pay some bills. But so yeah, I was able to practice medicine throughout all that.
Do you have to take a test or get any kind of certification before you can be a forensic psychiatrist?
Yes, you have to do a 1-year fellowship, which you have to apply for. In the state of Virginia, they only take 1 applicant a year. And fortunately, I was blessed enough to receive that position. which was an honor, and I was very thankful for my training there. Then after completing that, you have to take a board certification, which is expensive and takes a lot of time and money, but I did it and passed, and I'm happy.
And where is it that you're licensed?
We would accept him as, I think we're wanting to have him as an expert in general psychiatry, forensic psychiatry, and emergency
medicine.
We don't object to that.
All right, he'll be admitted as an
Oh, they're being, they're being very
Continue with your
agreeable now, aren't they?
witnesses' qualifications if you wish.
Yes, sir. Dr. Pickett, have you, I do want to ask about this. Prior to being involved in this case, have you had the opportunity to perform mental evaluations of defendants?
Yes. In my fellowship, I had on the forensic unit at the state hospital, by definition with the forensics, most of them had some kind of criminal or some kind of crime related to their mental health. And so I would evaluate their competency to stand trial to see, do they understand? Do they meet all the qualifications and such? So yes.
And we heard Dr. Gugliano talk about there's a list in the state of Mississippi of forensic either psychologists or psychiatrists that are certified to perform these types of evaluations through the Department of Health. Do you know, are you one of those?
Yes, I am.
And how many forensic psychiatrists are there in the state of Mississippi that have gone through the qualification to perform the mental evaluations through the Department of Health?
I don't know how many have gone through the process, because you do have to apply and go through those credentials. They, in my opinion, would be qualified if they wanted to do the process. I don't know how many did the process, but there's only about, I think, 6 in the state of Mississippi. And as far as forensic psychiatrists go, not all of them are practicing. And many of the forensic psychologists are actually out of state. Some of them are out of state that we have. And the list is not very long.
When you are asked to do, in your previous evaluations, when you're asked to determine whether somebody is either mentally competent or insane for trial purposes, who usually hires you, or who are you doing that on behalf of?
To date, I'd say 99% has been the defense. This is my first case being retained for the prosecution. But I do want to make it clear that I remember when we first talked, regardless of whoever brings me into the case, my opinion is my own, and I take great pride and responsibility in that. And regardless of who gets me involved, I let them know from the beginning that my report may fall on your side or it may not, and that's that.
And when you were retained by the state, we agreed to that, right?
We did.
Can you explain, and I know you were present for Dr. Clark's testimony and that you were in the courtroom for Dr. Gugliano's testimony, but I just want to make sure that we're talking about the same insanity standard. Can you describe for the ladies and gentlemen what the McNaughton standard is in the state of Mississippi?
Sure. So the McNaughton standard for insanity, and it does vary from state to state. In Mississippi, it is named after Daniel McNaughton, a guy in 1843 who he thought he was killing the prime minister, and he actually killed like a secretary, and he was found insane. And so at that time, they came up with a law, again, this was 1843, I believe, where you have to have a threshold mental illness just to consider insanity. If you want to move forward, you have to have at least a mental illness. Once you have that mental illness, that's like your ticket. That's like you cannot pass go without that ticket. So you get that diagnosis, and then we can consider the other prongs of this standard. And for McNaughton, it is, did the individual understand the nature and the quality of what they were doing at the time of the offense? That's one. The next one is, did the individual understand the wrongfulness of what they were doing? And so you may have a mental illness, schizophrenia, bipolar disorder, PTSD, whatever it is, but that does not equal insanity by the McNaughton standard. You have to meet the other prongs.
I want to talk about those prongs, Dr. Pickett. You said to know the nature and quality of the acts you were doing. Can you kind of break that down and explain that for us?
So nature, to understand is, from my understanding, is a relatively low bar. It's a knowledge. You know what you're doing. It's a fact-based knowledge. An appreciation, in my opinion, would be a higher standard of you. I think, as Dr. Gugliano testified to earlier, you would also understand the social implications and the ramifications. It's a higher standard. But in Mississippi, according to the Mississippi Rules 12 of Criminal Procedures, which talks about the standard and such, there's simply an understanding. Did this individual know what they were doing? Did they understand the nature? For example, understanding the nature. Let's say somebody is really psychotic. They are out of their mind. They are squeezing a lemon. They think they're squeezing a lemon. And they're squeezing, and then in reality, instead of squeezing a lemon, they're choking somebody to death. They would not, in that instance, understand or have an appreciation or an understanding of the nature and quality of what they're doing. They think they're squeezing a lemon, when in reality,
I forgot what that was all about this morning. Nidawau. You'll have to re-enlighten me with a description. That was nearly 5 hours ago. Me forgets.
they're choking somebody to death. Or, yeah, so that's basically that.
And as far as the second part of that prong, did they know right from wrong? Did they know wrongfulness? I think we all kind of are taught as children right from wrong, but can you describe for us in a legal stance what that means?
Yeah, so in Mississippi, the second prong is, did they know, have an understanding of the wrongfulness of their acts? And in Mississippi, it's a legal wrongfulness, just simply knowing that it's illegal, not even necessarily morally wrong. In other states, it's a moral, like, yes, I know it's illegal to do that, but it might not be morally wrong. I have to, let's say, yes, I know murder is illegal, but I have to kill this alien to save America. So they wouldn't understand the nature because they're psychotic and delusional, and they wouldn't understand the wrongfulness morally because they think it's an alien and they have to kill this alien to save America. So morally, they might not think that was wrong in that example. But in the state of Mississippi, it's simply a knowing legally that it is wrong.
Cool.
And so just to clarify, even if they didn't morally know it was wrong to kill that alien, they thought it was an alien. In Mississippi, you still don't get to insanity.
Correct.
In this particular case, well, who was the defendant?
Miss Carly Madison Gregg.
And did you have the opportunity to interview Miss Carly Madison Gregg?
I did.
What other information? Well, let me take a step back, Dr. Pickett. I apologize. Did you perform an evaluation and prepare a report in this case?
I did.
And did you render opinions regarding Carly Madison Gregg in that report?
I did. I met with Miss Carly Gregg on August 30th for about 4.5 hours here with Attorney Todd, and I rendered a decision that was based on my interview with Carly, my extensive review of a lot of discovery, my training, education, experience, and knowledge. I pulled on all of that to surmise a opinion.
And was that opinion to a reasonable degree of medical certainty?
Yes, it was.
And the items that you're talking about that you reviewed, the interview with the defendant, the mountain of discovery, talks with my office. Did you also talk with Miss Todd?
Yes,
To
to some degree. I talked to her, I think, mostly during the evaluation and occasionally via email correspondence.
In relying on those things, is that something that a similar situated forensic psychiatrist would rely upon in rendering his opinions?
Yes.
So I want to talk to you about, well, I want to talk to you first. Let's talk about what your opinion is regarding Carly Gregg's sanity, and then I want to back up to how we got there.
Okay.
So what was your ultimate opinion as to whether or not Carly Gregg was insane at the time of the murder, attempted murder, and tampering with physical evidence on March the 19th, 2024?
I'm happy to discuss my opinion. I want to say the ultimate opinion is for the fact finders to decide, and I would just offer my opinion. So I do not want to speak to the ultimate decision, but I just want to lay out my opinion based on everything that I have researched and written and read and done. So my opinion is that Carly does not meet Mississippi's standard for insanity at the time of the offense, and that she knew the nature, quality, and wrongfulness of her actions during that day.
So, Dr. Pickett, I want to take you back to the things that you reviewed. You talked about a mountain of discovery. We've seen in the courtroom, we've seen some videos from that day. Did you have the opportunity to review those?
Yes, I did.
Did you consider those in rendering your opinion?
Yes. When you say those, I've seen the garage video footage. I've seen the Wise video camera footage from the dining room. I've seen body camera from the officers. I reviewed several of those. So I have seen a lot of video.
I want to take you back to your interview of Carly Gregg. When did you say that happened?
August 30th of 2024.
And who was present during that interview?
Me, Attorney Todd, and Miss Carly Gregg.
In your practice, is it common for a attorney or a defense attorney to be present during your evaluation?
It's not common. Most of the time I do my evaluations for the defense. And so most of the time they don't come, and they know that I'm there most of the time. But no, they can be there. It's not standard that they are, but they can, and it's not a problem if they are.
In this particular case, in your report, you noted that Ms. Todd was present, but there was something that stood out to you about the participation in this evaluation. Can you tell the ladies and gentlemen about that?
Yes. So at the beginning of the evaluation, Attorney Todd told me that, hey, there's some things that Carly doesn't like to talk about, so I will have to prompt her. And I told her, that's fine, especially in adolescence and a 15-year-old. When I see patients outside here, parents are often involved. That's not unheard of. They have to prompt them. That's totally okay. As the evaluation went on, though, it seemed to be significantly more than just simple prompting. It seemed to become very leading questions, close-ended questions, interjecting particular things and redirecting the conversation at specific times. And in my report, which is 85 pages, I do list examples of this, and I can go through that if that's desired. But it did seem excessive, and it seemed like I was being led somewhere in some of the examples.
And what was your, what was your opinion as to why you were being led?
I really don't want to speculate as to why a defense attorney might, interject so much. It did seem calculated to me, and like there may be some secondary gain in trying to fool me into believing something. In my experience, most of the time when patients are experiencing these things, they do not really need a lot of prompting. Most of the time, if they're suffering with severe mental illness, auditory hallucinations, these scary dissociative spells, they will volunteer that information usually and be able to tell me very vividly and without prompting what they're suffering with.
And just to be clear, Dr. Pickett, it was not your intention to pick on Attorney Todd, right?
No.
You simply noted that in your report because you found it unusual.
Yes.
I want to talk to you about, during your evaluation and your review of the discovery materials, did you ever find any evidence of drug use by Carly?
Yes. There's a lot of mention from her friends, and which, I try not to put too much weight into that because that can be hearsay, opinion, text messages here and there about substances, but there was a lot of it, which made me think there could be more involved here with substances. And it seems like that was the trigger or the impetus for the conversation on the 19th between her and her mother. So I do think substance abuse is relevant.
Did you also review the results of a drug screen of Miss Gregg?
I did.
Could you tell us what a little bit about that?
Yes. There was a drug screen that was obtained, I believe, at the juvenile center after she was detained, and it tested positive for cannabinoids.
Did you have the opportunity to review the vital core records also?
I got some records from Region 8 afterwards. I did not get the vital records afterwards.
I think
Only
that
it would have been in discovery, but by that time, I think I had already written my report. And what was in the records, medical records, mental health records after the fact, to me is highly skeptical. And so I don't necessarily put a lot of weight on what was said after the fact, given the very large
definite disquality
gain.
Dr. Pickett, if there were another drug screen in the vital core records that showed the presence of marijuana, what would that indicate to you?
It would indicate that she had used marijuana at some point in the recent history of that drug test.
30 days, I think, for it takes to get out of your system, according to Judge Fleischer. At least 30
I want to
days.
talk to you about some of the other things, Dr. Pickett, that you relied on in your evaluation of Carly Gregg. May I approach the witness room? I'm handing you what's previously been marked as Defendant's Exhibit 11, and it does not appear these pages are numbered, so I just kind of want to go through them in order.
Okay.
There's Miss Becca Lynn today.
Does that look like something that you reviewed previously?
Yes.
If you could tell, ladies and gentlemen, what's on the very first page of one of the journals or sketchbooks or scratch pads from Ms. Gregg's room?
It says water, fire, earth, air. Water, fire, earth, air. Water, fire, earth, air. Fire is circled, and it says, I choose fire. It is powerful, beautiful, and deadly. These are the traits I desire, so I choose fire! Exclamation mark.
And did you consider that whenever you were rendering your ultimate opinion?
I take everything into consideration that I have, that I can. When I look at this in these journals, there's a lot of things in these journals, and I took the time to look through them, and some of them are concerning. Some of them, I question the truthfulness of it. Is it more theatrical? Is it truthful? I think it's hard to know, but I try to use my judgment as I'm reading it in the context. This one seems to me that she writes down in her journal that she desires powerful, beautiful, and deadly.
What were some of the other journal entries that stood out to you, Dr. Pickett?
Can I look at my report, please?
Sure.
Okay. So one of the journals, I think this is the Brown Journal, it says in the beginning.
If he's going to refer back, can you just tell us what page he's referring to?
This would be, I'm sorry, this says entry January, it would be the first, I think it's the first one on January 2023, 2024, the Brown.
Yeah, if you can tell me what page.
They're not bait stamps. That's what I said.
Oh, yes.
It's hard to tell because they're not bait
Yes.
I think, weren't you saying approach?
Yes, I think she's definitely got her tail between her legs, that one, and is very sheepish, and I would be hiding my head too, because that was totally
He's on page 20 of his report.
unnecessary.
Regarding Charlie's journal.
If you would proceed, Dr. Pickett.
Okay, thank you. So it says in the first entry of this journal, I know one of y'all is going to read this eventually, which I guess I have no control over. So to me, the very first entry of this journal, she acknowledges that there's going to be an audience. Somebody's going to read this journal, and she suggests that she has no control over that. And so as I think about that, I ask myself, is this a personal journal where somebody puts things that they are really trying to keep secret? Or is this a budding, articulate author that describes things for theatrical reasons? And so as I go on, there's other things that make me say that. For instance, she talks about various movie reviews. One of them was Pinocchio, the still life. It's a new one that came out, and she talks about her favorite scenes were when the bomb was dropped on the church that killed Carlo. Mussolini, and Mussolini, he's like, he was an imperialist that was associated with Hitler, believed in xenophobia and imperialism. And so I believe signed a pact with Hitler at some point. And so her favorite parts of the movie were the war crimes, Carlo getting killed, and then there's other things where she talks about Harley Quinn, which is some of this stuff is childish, but it shows us into her mind. And so she's right, Harley Quinn is the Joker's girlfriend, and she's crazed and psychotic and does these violent crimes. Then one instance in her journal, there's a little pin mark where she says, it looks like you just poked the paper. And then she writes beside it, look what I did right here. I stabbed my journal like it was Tom Riddle's. Tom Riddle is from Harry Potter series, and he turns into Lord Voldemort, and he's evil. And so in her journal, she talked about Harley Quinn, war crimes, Tom Riddle, There was another page where I can find where she says, you know, what do I believe? And she writes these tenets down. And one of them says, it's okay to be evil. There is no God. And if I can have a minute, can find others.
Judge, may I approach?
Yeah. Thank you. So this one in the journal also, what do I believe? There is no God. Heaven and hell are fake. Love is important. You don't need family. Writing your own destiny with a check mark beside it. Loving yourself. Having friends is important. Don't belong to anything. Never be alone. Go to your place of comfort often. Sometimes you must blend in, but never forget it's okay to be evil. Sometimes you must jump into the dark to truly see the light. Privacy is not loneliness. Death is inevitable.
Were there other portions of the journal that you found concerning?
Another part where she talks about her reported auditory hallucinations. She says on March 12th, 2024, this is on page 21 in my report, she mentions enjoying books about crazy people. And then she adds that she had a psychotic break, but calls the incident quite silly. And she goes on to say, I actually spoke with one of the voices in my head. Well, I didn't hear them until earlier today, but only then. My particular friends and I were practically screaming bloodthirstily and ravenously. Thank God physical confrontation was not fruitively possible. I sound crazy. And then she continues on. In other sections of her journal, she talks about all the dishonesty.
The dishonesty with what, Dr. Pickett?
I believe she was referencing to after, I have here that.
Now, don't forget too, this journal entry was done on the 12th of March, and she was seen by the counsellor, the second witness we had, the second rebuttal witness with the aqua shirt, on the 13th of March, and had stated to her that she had not had any, not heard any voices or had any hallucinations or anything like that.
After the iPod that she was using as a burner phone had been found in early January, she wrote in her journal at some point, you know, I'm kind of relieved. Thanks, you know, because of all the dishonesty. I'm glad it's just over with, so to speak, was my impression. So there were a lot of things. Yes, sir. There were also text messages that I had seen between her and friends that were concerning. When I'm trying to understand somebody's psychiatric mental state, all important. Text messages with friends, conversations with friends, parents, what's going on at school, what's going on at home, drug use, medical history, psychiatric history, all of this is important. And so there's a lot of detail here. And so as I was looking through text messages, one of them she says to, this is on page 22, she's talking to Thad on February 7th, 2024. And she says, you don't understand how fucking psycho I was that day. I almost murdered my parents. And so as I am preparing to come and evaluate her, given the context of what's going on, I take extreme time to go through the mountain of text messages between teenagers, diaries, journals. Some of it seems theatrical.
You think?
And to almost entertain a would-be reader. And some of it is very concerning.
Dr. Pickett, were there also some, I want to come back to the text messages in just a minute. Were there also some notes that you were looked at of Carly's about gaslighting?
There was a folder that was found, and it does, it goes into a lot of detail about emotional manipulation and gaslighting. And it says at the top, emotional manipulation, gaslighting, and it would define kind of what that is and the setup and how you set this up, how you do it. And then, you know, at the end of it, it signs off with a valediction that says, take advantage, happy hurting.
There were also, I guess, what had been labeled as a dream journal. Do you remember looking through anything where she described some of her dreams?
I do remember one of her writings where she talks about her dreams and kind of leaves the reader with like a cliffhanger of, I had something along the lines, I'm paraphrasing, of I had a really good dream last night. I hope I have another one tonight. Should I write my dreams down? In other words, to like share them with whoever might read it in the future.
Do you recall also seeing, Dr. Pickett, something where she said back in April in one of her notebooks, I have depression and anger issues, but no one gives a shit?
Yeah, I think she used the word rage.
Before I move on, I think there was another one. There was actually something that was produced in discovery, and you were present when Dr. Clark testified. It was like a piece of paper that was in green, like a green marker handwriting. As your understanding and from the testimony yesterday from Dr. Clark, that Carly denied ever writing that or knowing who wrote that. Is that right?
I don't know that I asked her specifically about that page during our evaluation.
Have you reviewed his report?
I have.
And he asked her about that.
He did?
And then
I believe he did.
when you were present when he testified yesterday about that?
Yes.
What did Carly say in one of her journals or notebooks about innocence?
There was a quote in one of the areas that said, I think I'm on page 46. It says, life's greatest illusion, innocence.
So Dr. Pickett, you talked about some of the text messages that you reviewed. Were those messages from the day of the incident, March the 19th, 2024?
Yes, some of them were. I reviewed text messages for a long time, various people, but yes, I did review text messages from the time, very close to the time of the offense.
So I want to walk you through that. So the messages that you reviewed, can you kind of tell the ladies and gentlemen about why that was important in rendering your ultimate opinion?
Yes.
I wonder if these are the messages they're talking about that impeach her.
Text messages at the time of the offense are a window into her mind at that time. And having her words that close to the time of the offense is a pretty good window into her mind and what she was thinking and how she was doing at that time, in my opinion.
And I asked Dr. Gugliano, I believe you're present in the courtroom, it's not very common that we actually have like medical records from a defendant the day before they commit a violent crime, is it?
In experience, I'll have medical records related to somebody who's had a crime, but having somebody exam the day before is pretty unusual, rare, not the typical norm. If I have that, I'm very thankful for it.
I want to talk when we get to your what you relied upon on the day of the incident. I want to talk a little bit more about the text messages and things too. I want to call your attention to something in your report where you talked about that Carly's responses seemed almost textbook perfect. Tell us what you meant by that.
Well, when I would ask
He's a
her
cunning little shunt
to tell me about some of her reported dissociative spells, she would give me the cliche answer of, well, I just felt like I was outside my body, like I was right here. She kind of did that hand motion like that and said, it's like a dream, like I was just watching myself. And that was another example was when we were talking about racing thoughts. I asked her to, can you elaborate on that? Tell me more about your racing thoughts. I think she said it's like the ocean. And sometimes from experience, people who may not actually have a diagnosis will have trouble going beyond the simple textbook
definition
cliche answers. Whereas when I see people who legitimately suffer from schizophrenia, bipolar disorder, or even I've seen a few rare that actually had a dissociative disorder. It is rare. They usually can vividly describe these things to me. And oftentimes I see them objectively. They can't hide it. Sometimes they don't even have insight into it. And when somebody comes to me at the state hospital, I mean, it's hard to give a impression of racing thoughts, but these patients, they go from 0 to 100 and their thoughts are one after another, boom, 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 boom.
Absolutely.
They may or may not connect.
Yep.
And their pressured speech, it's hard to get them to stop. It's very obvious when they're to that degree. If they're psychotic,
at the very least,
it's even more obvious.
At the very least, I'm convinced that she started this on around the 12th, at the very least, the 12th of March, because that's when she started documenting all of these new symptoms. But yes.
In my opinion, you don't have to be a psychiatrist to recognize some of these things.
No,
their
you don't.
cousin or their mother or their brother will say, Johnny's not doing good, doc. And they'll drop him off in the ER or they'll drop him off at the state hospital. Well, they'll get committed and come to the state hospital. But it'll be very obvious.
Yes.
Dr. Pickett, at some point in your report, the DSM-5-TR, and we heard Dr. Clark talk a little bit about the DSM-5 yesterday. Can you tell us what the difference in the 5 and the TR is?
Every few years, the American Psychiatric Association councils get together and revise, do a text revision. So they update the DSM-5 criteria with various things and criteria. And so every few years, there'll be a new revision come out. And the DSM-5-TR is the latest version and the one that I depended on while I rendered my opinion.
Part of your report talks about Carly's thought process, that it was linear, logical, I think reality-based and goal-directed. Could you explain to us what you mean by that?
So linear, so as a psychiatrist, our physical exam is a lot of observation. Kind of start at the head, eye contact, you know, their blink rate, are they slow? Their speech rate, their speech content. We get into their thought content, their thought process. Is it linear, A, B, C, D? Ideas seem to connect, or is it, you know, very disorganized and they don't connect? And so linear means we're having a conversation, it's going from A to B, and they connect. Logical means it's reasonable and it's real. It makes sense. You understand it. Reality based is it's not delusional. So somebody that I see at the state hospital who's psychotic, they may come in with delusions and they'll say, the FBI's after me. And I know it because I saw a gas can at the gas station and I knew that gas can was a sign that the FBI's following me. Or they'll come in and they'll talk about revelations and the black horses and the white horses and the orange horses and the 6-point stars. I mean, it is very disorganized. It's hard to give you an example, but when you see it, it's pretty obvious.
We've heard testimony. Dr. Clark described a manic state and a hypomanic state. During the course of your evaluation with Carly, did it ever appear that she was having any sort of manic state?
Not during my exam, certainly not.
In your review of the medical records, did it ever appear that Carly had reported any type of manic state?
No. I reviewed, I think the therapy notes started with Annette Bryant back in 2015. At least those were the oldest that I had to look at. I looked through those, did not see any mention of dissociation, no mention of auditory hallucinations, no mention of mania or hypomania. So that was from 2015 to 2019. Then I reviewed the LPC Kirk, the counselor, her charts from January of 2024 through March of 2024, the day before the event. There was no mention of auditory hallucinations, dissociative spells, hypomania or mania, or disorganized thoughts, or anything consistent with psychosis. And then I reviewed the mental health nurse practitioner Lieber. I read all of her notes, January, February, March, and none of those mentioned it either. I also found some medical records from UMMC. I think she would have been about 11 years old. There's a Dr. Vaughn and another doctor. Those were well child visits, but you know, a lot of times, commonly, if a general practitioner recognizes that somebody has bipolar or schizophrenia or whatever, they'll put it in there. And I didn't see anything in those either.
I want to come back to the talk about disassociation, but I want to talk a little bit about Dr. Clark said that Mr. Gregg, Carly's dad, had been diagnosed with bipolar. Did you see medical records that had him listed as a diagnosis of bipolar?
I saw very sparse records that listed him as bipolar.
Based on your training and experience, if someone also suffers from a substance abuse addiction, would it be hard to diagnose them as being bipolar?
It is hard. It's not impossible. But can I elaborate about his notes? So I reviewed and I asked for any records, any psychological records pertaining to Mr. Gregg's mental health. And the only thing I got were the 3 records from Dr. Hardy. And there was some mention of his bipolar disorder in some of the therapy notes, like I believe LPC Kirk's, but that was secondhand that had been given to her from Ashley. The only ones I could see to confirm, supposedly confirm, is from a Dr. Hardy. And so as an emergency doctor, as a psychiatrist, anytime a patient is brought to me, whether they're in the ER or whether they're in the state hospital, I do my best to go back and review these diagnoses, because I do not like to just simply accept them, because it is common for people to be misdiagnosed with some mental illnesses, especially if they abuse substances heavily. which, according to my review, Mr. Kevin Gregg was well known for his substance abuse and for many years. And I talk about that in my report if you want me to go into that.
Sure.
So, let me see if I can. So I started from the beginning. There's tweets from Mr. Kevin Gregg that start in 2012. Oh, 15. So there's text tweets from Mr. Kevin Gregg on March 6, 2012, DMT, psilocybin, lysergic acid, diethylamide 25, that's LSD, mescaline, which comes from the peyote cactus, I believe. It's a hallucinogen. MDMA, which is ecstasy, good when used responsibly. Salvia, opium, coca, which are like plant natural things that you can make opium and cocaine out of. Good naturals. He says that in 2012. And then he continues on. I mean, there's like 50 or almost 50 tweets. He tweets at Obama, legalize marijuana. You're ignoring this huge campaign because there's no funding. Bomb the Middle East with cannabis. They'll think they'll want to fight or eat. And he goes on. Ashley, in her journal that I read, it has 334 entries in it, approximately, that I read through.
Why is he reading out the biological father's tweets and Ashley's journal in 2012? I don't see the relevance there.
I don't see the relevance of any of this.
No. It's like, yeah, read out the messages that Carly sent, the days leading up to the incident, which he mentioned, gave her a good insight into her state of mind at the time. But he didn't elaborate any further than that. And I don't get it. But yeah, it sounds like he thinks she's full of it as well.
Yeah.
I wouldn't be smirking or smiling, girlie. You in trouble. It's got a nice, neat, trimmed beard. Well manicured. Wonder what his fingernails are like. My granddad, when I was of dating age, used to check my boyfriend's hands out to see if they did
She wrote in
work.
her journal of 334 entries a lot about her problems, issues. And she basically described him as, to paraphrase, abused a lot of drugs, had a lot of mood lability, up and down, substances, and he was an awful father to Carly. He was verbally, emotionally, and even occasionally physically abusive to Carly and Ashley. I believe there's one incident she talks about in there where Carly had a black eye from her, and it was assumed it was from Kevin. Kevin's parents had mentioned his temper and were real kind of awkward around her after the incident related to it. But it goes on to talk about Kevin wants pain medicines. Janet will get pain medicine and give it to him. It just goes on and on and on about that.
I want to talk a little bit about bipolar because it's my understanding that that's one of the diagnoses that Dr. Clark gave to Carly Gregg. Can you talk about whether or not you believe that Carly Gregg actually has either bipolar 1 or bipolar 2?
Okay. Yes, I can. Can I finish my thought about
yes,
the
I
dad,
apologize. Yes,
Kevin? There's
yes.
one more important thing, and I'll drop it. When I was talking to Carly during the evaluation about her biological father, Kevin Gregg, I mentioned benzodiazepines. I was talking about drug use that did she have? Can we talk about that? And I mentioned benzodiazepines, and she said she knows what benzodiazepines are. And I said, okay. And she explained, I know what benzos are. My dad took them. My dad had this drug cabinet. It was this cabinet full of drugs, like he had prescription pills from like everybody. Again, then I went on, I said, and I'm on page 12. I said, talking about LSD and hallucinogens and mushrooms, I brought those up. She said, again, that's my dad. He took all of that, but I did not. He once bragged to me about taking 10 caps of dried mushrooms, which apparently is a lot because most people only take 2, I think, because that's what he once told me. And so it was emphasized from everybody, Ashley's journal, Carly, and then as I was even watching the body cam footage, I think it's of Deputy Zetterholm, some of the other family, Ashley's parents, I think Bob and Vicky, were there talking to the office of the deputy and had mentioned Kevin and started talking about some of his drug use. I think he mentioned marijuana in the video. And so it seemed by all accounts, going back as far as 2012, with his tweets saying this stuff, family describing him as this, and Ashley even mentioned that he would get Janet to give him pills. To me, it made the diagnosis very skeptical of Mr. Gregg to have bipolar disorder. The very limited and sparse records from Dr. Hardy made it very questionable. And then lastly, Dr. Hardy, who supposedly are the records that support this diagnosis, saw him 3 times, totaling at 1 hour. And he ultimately prescribed, along with other things, Adderall, Ambien, and Klonopin, which are 3 highly addictive, highly abused neurostimulator and neurosedatives, to a person that, by all accounts, everybody knows him as somebody who habitually uses drugs. And to me, prescribing 3 controlled substances to a known person who uses drugs is not what a responsible physician would do if they knew the truth about an individual's substance abuse. And lastly, if you have bipolar disorder, I would hesitate to put you on Adderall, because if anything's going to push you into maybe a manic state or a hypomanic state in bipolar 2, Adderall is a lot more likely to do it than an SSRI.
So I want to talk to you about the bipolar diagnosis, and then we'll come back to a SSRI, which nurse practitioner Lieber told us a little bit about this morning. So the bipolar, Dr. Clark testified that Carly had these desolate, I believe, I don't recall his exact word for using that, but very specific times of mania, kind of discrete, thank you. Some ups and downs, discrete periods of ups and downs. In the medical world, what does that mean?
So the DSM-5-TR has specific criteria for bipolar disorder. What makes that? We all have a mood. Let's say this is neutral. And there's a zone that is considered normal variation, where we can go up, we can have a good day, we can have a bad day. We can have a good day, we can have a bad day. People with depression, unipolar, that's one pole. Bipolar means there's 2 poles. They're opposite ends. Unipolar depression, they have the downs, and it goes below that normal area, way down here, where they start to have depressed mood, loss of interest. We call it anhedonia. They don't enjoy the things they used to enjoy. Maybe feelings of guilt, hopelessness, worthlessness. concentration difficulties, appetite issues, psychomotor slowing, which is like a sloth, like they don't want to get out of bed, they don't go shower, they don't bathe, they don't brush their teeth, they're so depressed, they don't cut their toenails. I could tell you some stories. Or they go the other end. They're manic and they have too much energy. They are restless. They have pressured thoughts. Their thoughts are racing. They may start one task, but they can't finish it. They may be very easily distractible. Little noises, things will distract them. They may have a grandiose view of themselves. They may have flight of ideas, so their ideas are bouncing all around. It's really hard for them to go A, B, C, D, E. There can be activity increase where they don't want to sit still. They're restless. They're moving around. There can be sleep disturbances, and there can be very talkative, pressured speech. And so those are the differences. You have the unipolar depression, you're down here, or in bipolar, you not only have the depressive periods, but you have the manic periods. In bipolar 1, you have mania. It's the most severe form. It can be so severe that you even develop psychotic symptoms.
Are you just waking up or are you just getting home?
So you're so manic, pressured speech, racing thoughts, restlessness, not sleeping. And interestingly, these patients who don't sleep, they feel great. They may have only gotten 1 or 2 hours of sleep last night, but they feel really good. They're not tired after that. And so you oscillate between these two periods. For bipolar 1, mania, really high, it's 7 days of a persistently elevated mood, all day, every day, to the point that it interferes with you socially, occupationally,
This guy
or
likes the sound of his own
interpersonally.
voice.
It is obvious to people around you, and it is causing significant troubles for you, one way or another. But you feel great. You're not sleeping, racing thoughts, pressured speech. That's 7 days for bipolar 1. Then you go down, you will oscillate. Eventually you'll come down and you may be depressed for 2 weeks or 2 months. It doesn't know. And then you'll come back at some point and you'll have another manic episode and you'll go up and down, up and down. That's bipolar 1. Bipolar 2 is called hypomania. It's a little less than mania. I've seen patients and treated patients who have this, and they can live pretty functional lives. I can remember specific patients that they had more energy, a little bit more talkative than usual, wasn't sleeping as much. They'd had periods of depression, and they qualified for bipolar 2, but they were functional individuals. They were not, it wasn't to the point where they're psychotic, usually, from my experience, at least in hypomania. And you can live a pretty good life, and especially if you're put on medications, can help you, typically a mood stabilizer.
So Dr. Clark diagnosed Carly as being bipolar 2. Do you agree with that diagnosis based off your evaluation and the review of all of her medical records?
No, I do not.
And why is that?
Well, politely and respectfully to Dr. Clark, providers can review different things and we can draw different conclusions. Looking at our reports, my sources are about 8 pages long. I stopped once I got to about 100 because I couldn't keep listing my sources that I reviewed. It was exhaustive. And when I looked at his report, it doesn't, at least that he wrote, I didn't see that he reviewed that much. And so I suspect that we came to different conclusions because we.
Is AJ home now? Is she? Let me get on. Whenever she would like to, sweetheart. Whenever. If she's home, let me just get on and see if she's set it up. Whenever she's on, that would be awesome. And I can Where is she? Eyes blind and can't see. God, I need new glasses. Badly. Badly. God, I can't even find her. Can't even see her. Where have you gone? I can't even find her in my subscriptions. I don't know if you wanted her to send you links. Yep, look, that's fine. Get her to send it because she might still be going with Verdict Watch. So it better to be safe than sorry. And I can always jump back in if I need to. So yeah, get her to send it. But if she wants to set up the stream and start anytime from now, that is absolutely fine with me. I will go with the flow. Just tell me when and I shall send everyone over. Okay. Sounds like AJ's back home and she's about to set up the stream to continue going on with this witness and closing arguments, and in the hope that Verdict Watch starts this evening. I can't see it happening, but yeah, just never know, because the jury's sequestered once they go into deliberations. So depends on what the judge decides at the end of the day, and if they finished closings and jury instructions, and they've got what, 3 hours to do it. So in Mississippi it would be 2:30, 3:30, 4:30. Yeah, 2.5 hours. They're pushing it, but it might be possible. All right, so we'll just wait. We'll wait and proceed.
May have reviewed different material. My opinion is that, based on reading his report, that some of his opinion of diagnosing Carly with bipolar disorder was that he took Dr. Hardy's notes for face value. And when I read Dr. Hardy's records, importantly, he never said, Kevin has bipolar disorder and I reviewed the records from his recent hospitalization, or he has bipolar disorder because he met these criteria. He essentially just says he has bipolar disorder and he used to drink and maybe do a little bit of drugs, but doesn't do any of that now. And so I really, only having 3 visits for 1 hour with no collateral records, minimizing his substance abuse, and then prescribing him the controlled substances he did, I just wonder, did he have all the facts? And if Kevin doesn't legitimately have bipolar disorder, well then Carly, it's a lot less likely that she would. And then I go back and I look at Annette Bryant's records from 2015 through 2019 when she's young. There was no mention of manic episodes or hypomania. Then I look at LPC Kirk's records from January through March. There was no mention of hypomania or mania. Then I look at nurse practitioner Lieber's medical records, and there's no mention of hypomania. And then I looked at the UMMC records with the well child visit, and there was no mention. And so given all of that, and given the fact that Carly acknowledged using marijuana, and there's discussion of when that started, text message conversations between her and I think Thad, he talks, it's not a text message, I think it's a really, really long Snapchat message. I mean, the Snapchat message was this long. It was pages and pages of photos. So he talks about, thank God she stopped using marijuana, all these substances. He mentions that around Christmas. So she would have been doing it at that time. So long story short, given all of that, Highly doubt and do not believe that Carly has bipolar disorder.
Impeached.
I want to walk you through the second diagnosis that Dr. Clark gave to
Yeah.
was
Right
based
there.
on her, it says several year
Boom.
history of auditory hallucinations occurring quite frequently. Dr. Pickett, I want to know, in your review of the records, was there anything to indicate before Carly was arrested on March the 19th, 2024, that there were any auditory hallucinations?
I believe in her journal, she did write one time about the voices, as I spoke to earlier, about hearing them ravenously, and thank goodness, you know, physical confrontation was not realistic. So yes, she did mention it there. I was highly skeptical of that because it seems more theatrical and making light of something that, as I've seen patients who really suffer from this, they are haunted by it. It is torturous to them, and they do not describe it as quite silly, and they do not trivialize it.
You were present in the courtroom when Dr. Gugliano testified earlier, right?
Yes.
And she said it was actually quite rare for someone, Carly had reported hearing these voices all the way back to 5 or 6 years old, and it was quite rare for a child that young to experience voices. Is that your opinion as well?
Yes, it is.
And what about the fact that she was claiming that she started hearing these voices every single day from a young 5 or 6 years old?
From my experience, talking with patients who have schizophrenia and have auditory hallucinations, they're not usually continuous all day, every day. They're usually here and there. Occasionally they're command. At one point during my evaluation, I did not write this in my report, but it's somewhere in the audio, I'm sure. She talks about, we're talking about the voices, and she was asked, I hope it's on the audio, it may have been during a break, but I do remember she said, I think Attorney Todd asked her, did you listen to that voice? And she said, no, it's a voice in your head. You don't listen to that. And I couldn't find it, but I remember it now. It was there. And that to me says, when I see people who have schizophrenia and they're disorganized and they hear these voices, you're more likely to do what they say if you recognize the voice, if it's like, yes, my dead grandmother, and you trust the voice.
All right, people. We have a new link. Those people that are on. Oh, I've got an echo. Hang on, let me shut this down. Because I'm hearing myself on AJ's channel. Hi, AJ. Hi, Gabby. All right, so those people that are already on AJ's channel, you can now jump into the new link that she set up to continue the stream. And those in my chat, the link is in the chat there. Oh, no, that's for me. That's a StreamYard link, Gabby. I don't need to see that. I know I can't get rid of it. So if you go into my channel on my actual channel page, you go into the top section where it says what my channel's about. All of AJ's links are in there, her YouTube channel, everything. You will find it in there, unless that is the link to the YouTube. Yes, it is the YouTube. Sorry, my mistake. So this is the link here to get directed straight across to the new stream, and she will pick up where I have left off. Okay, I'll leave that up for a little bit longer. So thank you all for watching and being so patient. I honestly thought this day would go a lot quicker. I only thought, 4 witnesses, will be out by after lunch and on verdict watch. But best laid plans. So yes, I'm off to bed. The magpies are chirping. Sun's about to come up, but that's all right. I shall catch you all on the flip side. Thanks again for watching and joining us. And don't forget to grab that like and subscribe on your way out and enjoy the rest of today's trial. And hopefully we have an answer tomorrow when I wake up. Yay! All right. Love you all. Thanks again. Don't be good. No, be good. Be good at it. Yeah, something like that. Arrivederci.
Be and Debbie here. Fill your screen with cheer. Hit like and tap subscribe. Join our happy